our September 9th, 2021 Board Business Meeting. Welcome to our board members, MCPS staff, and members of our community who are here to observe the meeting and to provide public comments. This meeting is being live streamed on the MCPS website and MCPS TV. Before we officially begin the meeting, I would like to recognize the upcoming 20th anniversary of 9/11. On September the 11th, 2001, almost 3,000 innocent people lost their lives as a result of the worst terror attack in this country's history. This attack was carried out in New York City, Shanksville, Pennsylvania, and right here in our own backyard at the Pentagon. The pain and loss associated with this tragedy endure for the families of the victims and for our entire country. We must continue to honor their memories and to remember the heroes who were compelled to show up and run toward chaos and danger in the name of saving and protecting human life. Most of our current MCPS students were not even born in 2001, and so all they know is a post-9/11 world. But I encourage all of our students to ask your parents and your teachers where they were on that day. Learn more about the impact of these events on your families and how the tragedy unified this country in unprecedented ways. Because of our proximity to Washington, D.C., our community was immediately affected by the attack on the Pentagon. Many of us have family, friends, and neighbors who work in Washington, D.C., or for the federal government, or for the Pentagon. There were MCPS students who were visiting the district for field trips on 9/11. Phones were down, which made it impossible to locate loved ones or confirm that they were safe. We were paralyzed by panic, horror, and fear of the unknown. Today, I would like to observe a moment of silence in order to commemorate the upcoming 20th anniversary of the September 11th, 2001 tragedy, and in honor of the lives lost, the sacrifices made, and the tremendous impact on our community. We reject the type of hatred that gave rise to the events of 9/11 and the acts of violence and discrimination that followed. We remain committed to creating a unified, pluralistic community based on mutual respect and peace. Let us never forget. Now let us stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic on which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll call the roll of board members to establish that we have a quorum, starting with Dr. Daka,
Judy Daka, thank you for being here today.
Ms. O'Neill,
Good afternoon.
Ms. Mandrowski,
Good afternoon, nice to see you all.
Ms. Silvestri,
Good afternoon.
Ms. Evans,
Good afternoon.
Ms. Harris,
Good afternoon, everyone.
and Ms. O'Looney.
Good afternoon.
Also joined by our interim superintendent, Dr. McKnight.
Good afternoon. Thank you for being here.
Now we can begin the meeting with the approval of the agenda.
Move approval.
Second.
All in favor, raise your hand. And that is unanimous. Dr. McKnight, we're up to item 3.
Thank you, President Wolf, and good afternoon, board members and members joining us today. I'd like to move forward the monthly Human Resources and Development Report for approval.
Move approval.
Second.
All in favor, raise your hand. And that is unanimous. You may
Thank
continue.
you, Ms. Wolf. Today, I will start by recognizing some of our beloved staff that have passed away. The death on June 29th, 2021 of Mr. Stephen Furtog, General Maintenance Worker 2 with the Division of Maintenance and Operations, has deeply saddened the staff, students, and members of the Board of Education. During the 2.5 years Mr. Furtog worked for Montgomery County Public Schools, he contributed to the success of every student by helping to maintain a safe learning environment. He maintained the grounds by expertly repairing sidewalks, driveways, and play equipment for our students. Mr. Furtog was particularly dedicated to the teams with which he worked. He was highly motivated and maintained an upbeat attitude, which significantly contributed to excellent morale among his coworkers. Now, therefore, be it resolved that the members of the Board of Education and the interim superintendent of schools express our sorrow at the death of Mr. Furtog and extend deepest sympathy to his family.
I move approval.
Second.
All in favor, raise your hand, and that is unanimous.
Thank you. The death on July 11th, 2021 of Mr. Lassell Samuels, Building Service Worker, Shift 1 at Montgomery Blair High School, has deeply saddened the staff, students, and members of the Board of Education. During the 14.1 years that Mr. Samuels worked for Montgomery County Public Schools, he was a dedicated and organized staff member who was well respected by his co-workers and Montgomery Blair High School students and parents. Mr. Samuels demonstrated an exceptional commitment to students and staff by maintaining a clean and healthy school environment in which students could learn. Now therefore be it resolved that the members of the Board of Education and interim superintendent express their sorrow at the death of Mr. Samuels and extend deepest sympathy to his family.
Move approval.
Second.
All in favor, raise your hand. That is unanimous.
Thank you. The death on August 28th, 2021 of Ms. Clara Matos, school registrar at Walter Johnson High School, has deeply saddened the staff, students, and members of the Board of Education. During the 31.9 years Ms. Matos worked for Montgomery County Public Schools, she always understood the importance of her job and demonstrated her commitment to MCPS students by diligently fulfilling all of her duties. Ms. Matos was very knowledgeable, kind, and caring. She served as a mentor for her teammates by working closely to model and explain different assignments. She had a positive attitude and handled all matters in a confidential manner. Now therefore be it resolved that the members of the Board of Education and the interim superintendent of schools express our sorrow at the death of Ms. Matos and extend deepest sympathy to her family.
Move approval.
Second.
All in favor, raise your hand. That is unanimous. Thank you.
Thank you. I do have a couple of appointments, and I'll begin with the first one. Our first appointment is Dr. Jennifer C. Norton as the Director in the Department of English Learner and Multilingual Education in the Office of Curriculum and Instructional Programs in the Office of Teaching, Learning, and Schools. Dr. Norton comes to Montgomery County Public Schools as a Program Manager of English Learner Supports for the Office of the State Superintendent of Education in Washington, D.C. She has more than 10 years' experience as Manager and Director, leading the development of English language proficiency assessments. Dr. Norton looks forward to joining MCPS to support quality English learner and multilingual programming and advancing equitable opportunities and outcomes for multilingual learners.
Move approval.
Second.
All in favor, raise your hand, and that is unanimous.
Thank you and welcome, Dr. Norton. Our next appointment is Ms. Diana K. Wiles as the Supervisor of Resolution and Compliance Unit in the Office of Special Education, then in the Office of Teaching, Learning, and Schools. Ms. Wiles comes to MCPS with experience as a teacher, researcher, and attorney. She most recently served as the Associate General Counsel for Prince George's County Public Schools. Ms. Wiles looks forward to joining MCPS to support the Resolution and Compliance Unit.
Move approval.
Second.
All in favor, raise your hand, and that is unanimous. Give a recognition for Hispanic Heritage.
Thank you, President Wolf. I will move forward to the next item, 4.0 recognition. Today, I bring forward a recognition for Hispanic Heritage Month. Hispanic Heritage Month celebrates the cultures and traditions of those who can trace their roots to Spain, Mexico, and Spanish-speaking countries of Central America, South America, and the Caribbean. During National Hispanic Heritage Month, we recognize the valuable contributions and the important presence of Hispanic and Latino Americans in the United States and celebrate their heritage and culture. Hispanic individuals have a profound and positive influence in our country through their strong commitment to family, faith, hard work, and service. And they have enhanced and shaped our national character with century-old traditions that reflect the multi-ethnic and multicultural customs of their communities. Now therefore be it resolved that the Montgomery County Board of Education and the Interim Superintendent of Schools hereby declare September 15th to October 15th, 2021 to be Hispanic Heritage Month in Montgomery County Public Schools.
Move approval.
Second.
All in favor, raise your hand. That is unanimous. Thank you.
Thank you.
We're now up to item 5, which is public comment. Public comments is one of our opportunities to hear the views and receive the advice of community members. Board members will take your comments into consideration, but it is not our practice to take action at this time on issues that are raised. We encourage public input on policy, program, and practices. This is not the proper avenue to address specific student or employee matters, so we encourage everyone to utilize existing avenues of redress for complaints. This is a public meeting, and we expect the conduct of all speakers and members of the audience to be within the bounds of proper etiquette. Inappropriate personal remarks, rude retorts, or other such behavior is out of order and will not be tolerated. Please check our website for information about upcoming board meetings, hearings, and work sessions, including any changes to our meeting start times. With this board meeting, we have resumed live public comments and have 9 persons signed up to provide in-person testimony. Each speaker will receive 2 minutes for comments. Please speak clearly and directly into the microphone. 30 seconds prior to the expiration of a speaker's time, a yellow light will go on accompanied by a beep. A red light and a buzzer signals that your time has expired. Please push the flat button below the microphone to turn it on and begin speaking. Push the same button once more at the sound of the buzzer to turn it off. In addition to our in-person speakers today, we have 1 audio testimony and 9 video presentations. We will play these submissions once the in-person testimonies have concluded. Copies of testimonies can be found on board docs, where they are posted with the other materials for this meeting. So, our in-person speakers, we will start with Jennifer Martin. Oh, there she is.
Good afternoon, Dr. McKnight and members of the board, and thank you for this opportunity to speak today. I'm honored to serve as the new president of the Montgomery County Education Association. As we embark on this new school year, MCA members are relieved and hopeful as we return to providing in-person learning for our students. However, our anxiety remains high. Over 1,000 students have already been forced to quarantine, and educators already find we're struggling to do 2 jobs, providing instruction to those in the classroom and to those at home. Our students have returned to us with greater needs than before, and we must do more than address academic progress. This must be a time of healing. They have sustained trauma of prolonged isolation, Many have suffered as family members have lost jobs. Some have survived the loss of loved ones and caretakers. COVID has exposed inequities that have always existed for our children living in poverty, special education students, English language learners, and students of color. We now have an opportunity to address these persistent problems. We're fortunate that the American Recovery Plan has directed money to our schools to help meet the current crisis. However, the path to sustaining these needed improvements lies in the blueprint for Maryland's future. Through the blueprint, state funding of schools will increase in coming years, but we must make sure there is a commensurate investment by our county. For too long, the county has relied on state funds to supplant rather than support local spending on public education. MCA asks you, the Board of Education, to stand with us in demanding the County Council provide adequate funds for a high-quality education for every student. Thank you.
Thank you. Next up is Laura Sardilli.
Good afternoon, and thank you for your time today. I am a proud mom of 2 MCPS students and the founder and CEO of Prodigy Link Health. Many infectious diseases like flu and strep present with COVID-19-like symptoms. We should be talking more about tools to reduce the compounding effect this will have on disruption to in-person learning. With the primary focus on the transmission of COVID-19 by air, we are more vulnerable to transmission of other pathogens by hands and surfaces. Traditional hand sanitizers do not provide enough protection. Our biggest gap is awareness of how hand sanitizer works and awareness of new technologies that provide better protection. Alcohol, the only germ-killing agent and sanitizer recommended by the CDC, is highly evaporative. Sanitizer provides about 30 seconds of germ-killing action. You're unprotected the second it evaporates, while your skin absorbs the skin-drying, flammable residue that's left behind. Several studies have shown that we touch our face at least 15 times per hour. Counterintuitively, this number is likely higher with mask wearing. 30 seconds of protection means that every time you touch your face, you need to reapply or risk exposure to germs. Thankfully, we have had some of the brightest minds at work on this. Scientists have discovered a technique mixing alcohol with a patented USDA biopreferred organic polymer that produces 3 layers of active hand protection. This is the world's first and only organic alcohol-based flame retardant sanitizer that provides 2 hours of protection per application and prevents transfer of germs to other surfaces, including the COVID-19 Delta variant. This is backed by independent, publicly available data from FDA-approved labs. In addition, the polymer prevents alcohol from being absorbed in the skin, eliminating skin irritation. This formula is disrupting sanitizer standards. As examples, the Marone 9/11 Center for Counterterrorism and Security and Magnet Group, a large medical group purchasing organization, have both endorsed this formula as a game-changing sanitizer. I encourage MCPS to evaluate this innovation to better protect our community and help minimize the disruption to in-person learning. I am passionate about helping our community and bringing awareness of important innovations like this. Thank you for the opportunity to share these remarks today.
Thank you. Next is Yelena Gawk. Press the button. Could you help her out?
Someone's coming.
Sorry for that. Okay, I'm going to read because, I want to put everything in 2 minutes, which is really hard. Dear member of Montgomery County Board of Education, thank you for accepting my request to share my thoughts and experience that, to my view, are relevant to the topic of the present discussion. My name is Yelena Gach. I'm a PhD physical chemist and an immigrant from the USSR. We lived in Bethesda for 23 years, and our daughter went to MOCA schools from Bethesda Elementary through BCC High School. Although she graduated 13 years ago, I think that everything that is related to children, to their health and education, is dear to any parent's heart. We came to this country from the Soviet Union 30 years ago with the main goal to raise a healthy and happy child. There was no way to achieve this goal in the country in which the system was based on hypocrisy, lies, censorship, and dictatorship. Freedom, truthfulness, openness, and transparency in all aspects are necessary elements to raise physically and emotionally healthy children. Unfortunately, what I'm witnessing now brings back memories of my past. It looks like I'm back in the Soviet Union, and in some respects, it is even worse than what we lived through in Brezhnev's times. This is not only mask mandate for kids in schools, which has been already demonstrated to be health hazard for children without any benefits whatsoever, but also new curriculum. This new curriculum brings to me the worst memories of brainwashing Soviet kids with Soviet propaganda. Replace the words classes, such as working class and capitalists, with races, and you will get exactly the lessons on hatred for people from other groups. We hated capitalists, who in fact were the main engine in building of this society. Equity is the end of education in this country, which is already falling behind, and soon will be destroyed. Equity was the theme in the Soviet society, which did not accept the idea that people have different talents and abilities. The Soviet system was aiming at getting the proper percentage of representatives from working class and intelligentsia. This led to hiring people who were incapable to do their job in their leading positions, and you are aware of the consequences of such ideology. These times are a litmus test for each of us and each of you. This will be your responsibility to choose the right path against the one that will lead to destroying the future of these kids and thus the future of this country. Thank you for your attention.
Next, we have Marjorie Smelkinson.
Can you hear me? Okay. Do I start some? Okay. Okay. I'm Dr. Marjorie Smelkinson, and I'm an infectious disease scientist and have 4 elementary school students. Last Thursday, most of my son's grade was quarantined because of one COVID-like symptom. Not a COVID case, just a headache. Quarantines based on symptoms will result in our kids sacrificing yet another year of their education to ridiculous and unscientific policies. This policy put 1,000 kids into quarantine in just 4 days. It is the strictest in the nation and goes far beyond CDC and state recommendations. Again, we are a national outlier. Why have you placed so little value on in-person education? Why are you adhering to a policy that will continue to needlessly keep kids out of school? Your misguided approach also puts the burden on one family to test their kid to end the quarantine for the whole class. Some parents may not be willing to get a test or have the job flexibility or resources to do it quickly. The inevitable consequence of this insane policy is that lower-income students will get fewer days of live instruction. End symptom-based quarantines immediately. Instead, use on-site rapid antigen tests on students with COVID-like symptoms. If they're negative, let them stay. If positive, implement a test-to-stay program instead of quarantining the whole class. This involves daily testing of close contacts for a week and keeping them in school as long as they test negative. Other states are using this as an alternative to quarantining and ensures that only those infected stay home. Last year, you ignored scientific evidence, played politics, and provided some of the least live instruction in the country. This year, be brave and prioritize our children. The state has tests. Get them, use them, and do whatever it takes to keep our kids in school.
Next is Stephen Posnack.
My name is Steve Posnack. I have been a Montgomery County resident for over 10 years. Why am I here? I am here as a parent of a 3rd grader and a 5th grader who need to be in school. I am here because I can afford to be here. I can afford to take time off in the middle of the day to come and talk to you about this issue, and that other parents don't have the time and resources to do so. This may come as a surprise, but respectfully, you all are failing. You're failing to keep your word. You're failing to keep our kids in school. You are failing to provide common sense leadership, and you're failing to follow science and data. Most of all, you're failing to keep the parents, the children, and the rest of the residents in the county informed about what's going on in the county. Within the first week of school, entire classes are being sent home to be quarantined, and no one is saying a peep. There's absolutely no transparency, and the only reason why we know is because we're getting a specific email from the class, the principals, and parents are doing the work. Parents are doing the hard work to figure out what's going on. To my knowledge, these preemptive quarantines are not listed on any public resource where this board and MCPS can be held accountable, because there is no evidence of a COVID-19 positive student. There's no evidence. There's no positive COVID student. So classes are being quarantined out of an absurdity of caution. If not for parents emailing other ones, we'd have no way of knowing what's going on in our school. And the great fiction you all seem to be telling yourself is that this makes total sense when it's mind-boggling. If one of my kids gets quarantined preemptively, The other one just keeps going to school. And I believe in risk mitigation precautions like masks and vaccines. And I believe if your kid's sick, they should be sent home and or stay home if they are already, showing symptoms. Our county has done an amazing job. 87% of people in over 12 have been vaccinated. We are not in 2020 anymore. The policies for school attendance should reflect that. You must put an immediate stop to these preemptive quarantines. You must put an immediate stop to sending whole classes home based on every symptom listed in a medical textbook.
Thank you. We have your testimony.
Thank you.
Next is Nikki Gilliam.
I am Dr. Nikki Gilliam-Posnack, and I am a parent of 2 elementary school children. I'm here to ask you to immediately rescind the new MCPS guidance on school quarantine and follow the accepted CDC guidance. Montgomery County has one of the highest vaccination rates, with 96% of individuals over the age of 12 receiving at least 1 shot. We also have mandatory masking. With these layered mitigation strategies, you can imagine my shock and frustration when 3 entire classrooms of students were sent home from our elementary school last week. Entire classrooms were quarantined because a single classmate displayed a single cold symptom. These young students did not have positive COVID tests. The students were all masked. To date, more than 1,000 healthy students have been unnecessarily quarantined under similar circumstances. A single classmate, a single symptom. This irrational policy needs to be repealed immediately. Over-quarantining healthy children violates the Maryland State Board of Education resolution to provide 1,080 hours of instruction with a teacher in a classroom. Single symptom quarantining of entire classrooms is unprecedented. It goes against the recommendations of the CDC, the Maryland State Department of Education, and the Department of Health. It is more restrictive than any other school district and more extreme than the quarantine process outlined by this very Board of Education on August 24th. If MCPS is actually concerned about COVID, they should, 1, require teacher and staff to be vaccinated, and 2, offer rapid testing in school or test to stay. Instead, MCPS is putting the burden of testing on parents. This is an equity issue. If a family chooses not to be tested or does not have the resources, an entire classroom of healthy children will remain in quarantine for 10 days. This extreme policy is not based on science, and it will lead to an unstable school year with countless quarantines for healthy children. Only in Montgomery County can children go anywhere and be anything they want to be except school children. We need MCPS to implement policies that provide continuous in-person education for our children. That is the definition of your job.
Next up is Nicole Brown.
I'm Nicole Brown, and I'm a mom of a 5th grader. I'm here today to ask you to rescind the single symptom quarantine policy. It hurts students, and it's inconsistent with the school commitment to provide 5-day-a-week in-person instruction. The policy hurts students. Already, the policy has resulted in over 1,000 cumulative lost in-person learning days. The harms from virtual learning are extremely high: academic, social, emotional, psychological. The policy breaks your commitment to provide full-time in-person learning and violates the state's full-time in-person mandate. It breaks this commitment because it's unworkable in elementary schools. Entire classes are quarantined, in some cases 3 in a single day at a single school, and it will unquestionably deny these students their right to full-time in-person learning. You emphasize that the health and safety of students is your #1 priority, and yet this policy harms students. The risk to elementary school students of harms from virtual learning is extremely high. The risk of dying from COVID, their risk is extremely low. And yet this policy sends the entire class home upon the lightest trigger, a single student with a single symptom. All this in the context of fully masked students and staff and a highly vaccinated community. COVID risk isn't measured only by cases and hospitalizations and deaths. It's also measured by days in quarantine. And right now, the single biggest COVID risk to elementary school students is school quarantine. The single biggest COVID risk to kids is school quarantine. This policy over-quarantines. It doesn't mitigate COVID risk, it multiplies it. Last year, we were near last in the nation in providing in-person learning. This year, put kids first. Rescind the policy. We have to educate our kids. We want to educate our kids. Let them learn. Thank you.
Next is Ryan Cheney. All right, coming up.
I am delivering testimony on behalf of Mr. Cheney. He is the father of a first grader in MCPS. Thank you to the school board for providing time to provide testimony. There are so many topics he wanted to discuss at this meeting, but with limited time, he thought it was best to focus on one. Where are the parents? Why are their chairs empty? Every empty chair in the room represents coward and self-censorship of the parents in this county. What will it take to get you to advocate for your children? There is a virus in this school system, and it's just like the statistics show, you've done your part to get vaccinated. You need to do your part to bring back quality to Montgomery County Public Schools. Every Montgomery County Public Schools. Every chair, every space they will let us occupy. We are failing our children. You're failing his children. And until you continue to show up, you are all failing. School board, Mr. Cheney loves his son. He doesn't think you want to hurt him. He needs you. He needs your expertise. Please educate our children in school. We know you're plenty capable. We believe in you. I don't believe in my heart that any of you are bad people. Please prove him right.
Thank you. Next we have William Zartman. Mr. Zartman? Oh.
Hi, I'm Dr. William Zartman. I thank you for the chance to... I'm still Dr. William Zartman. I thank you for the chance of being here with you and the invitation. I'm a professor emeritus at Johns Hopkins University, former director of the African Studies program, ending 61 years of teaching, 41 years here as a resident of Montgomery County. And our son has been through the Montgomery County Public School System with success. Despite the MCPS's claim that they are not teaching crude racist thinking, there is mounting evidence that this is a lie. The obsession with race has motivated MCPS, while facing declining national rankings, to spend nearly $500,000 on a worthless so-called anti-racial system audit. Judicial Watch has concluded that the racist and revolutionary claptrap of these documents should go nowhere near our school classrooms. Many parents in Montgomery County have protested the school administration and Board of Education's allowing our schools to be captured by an anti-intellectual and illiberal racist mob. We cannot tolerate that a school that judges our children by the color of their skin and encourages and instructs them to prejudge others by theirs, desecrating the legacy of Dr. Martin Luther King and trashing the civil rights movement accomplishments. By adopting CRT, our schools are teaching children that Black Americans should forever be regarded as helpless victims, incapable of success regardless of their individual skills, talents, and hard work, the very qualities that brought the 9 of you here to this position. An honest academic, traditional American education is the most important gift we can give to our children. A moratorium must immediately be declared to stop purchasing materials or conducting classes that embrace crude racist theory and the 1619 Project.
Thank you, Mr. Zartman. We have your testimony. I'm going to have to ask you to sit down, please. We have received one audio testimony submitted by Kelly Umanya. Could you play the audio, please?
My name is Kelly Umanya, and I am a mother of an MCPS 3rd grader and a sister to an MCPS 5th grader and 7th grader. I am also representing the community-based organization CHEER that supports families in the Long Branch community. I come to you not just to share my perspective and experiences, but to share the stories of many families that have been immediately affected by the policies put in place. COVID-19 opt-in forms were not adequately communicated to families. Many parents in our communities were not aware of this form. An opt-out COVID-19 testing approach will allow for better representation of MCPS students to be in the testing pool. However, this is not enough. In just the first week of schools reopening, 1,000 MCPS students and staff have been quarantined. Families are told they need to figure out how to get out of work, and if they don't have transportation, they need to take a bus to pick up their child, and then are notified to travel another 3 to 4 miles to get their child tested at a clinic and wait 3 days to get their results. During this time frame, they miss work and lose income. This is not a hypothetical situation. This is the reality of many families in MCPS. We need to offer school rapid testing so that this does not create another barrier that our families have to face to ensure that their child can receive quality education. We have also not received communication whether school-based health centers will be providing testing or vaccines once they have been open, which two have not. As a community health worker in the community supporting families who face a multitude of barriers in access to services, this gap in information from MCPS and Montgomery County of a much needed asset in the community provides even more barriers in accessing quality health services. We ask that you please consider evaluating these points. We need opt-out COVID testing forms, we need rapid tests at schools, and we need fully functioning school-based health centers where COVID-19 vaccines and testing can be offered as part of their health services. These are important assets for our families and our health workers that are on the ground to ensure that we mitigate any barriers in access to these services.
We also received 9 video testimonies. First up is Kia Anderson.
Hi, I'm Kia Anderson, PTA President at New Hampshire Estates and Oakview Elementary Schools in Silver Springs, Long Branch community. The leaders and staff at these Title I schools work tirelessly each day to ensure that every child, regardless of family background, household income, or home language, can achieve their full potential. The county's new COVID policy undermines our schools' ability to do this. With the needless widespread quarantine of students and staff awaiting the test result of one student with a symptom, the county has disrupted our families' rightful access to instruction and made parents and caregivers' childcare needs and availability to work completely unpredictable. The new policy opens opportunity gaps and unjustly puts the burden for closing them on already stretched schools and families. As an example, on Friday, September 3rd, nearly half our kindergartners, 3 of 7 classes, along with their teachers and families, were all in quarantine, although we have yet to see a positive case. It is not realistic to expect that so many young children with parents who work outside the home can fully participate in remote learning at a moment's notice. It is not realistic to expect families to access COVID tests quickly when there are no testing sites in our neighborhood, schools have no testing infrastructure, and county sites do not administer rapid tests. Please work urgently with DHHS, MCPS, and school and community leaders to 1, enable schools to administer rapid COVID tests. Possible barriers of cost and staff time seem minimal in light of the harm to families the current policy is causing. 2, expand planned pool testing to include all except those who opt out. 3, open a COVID testing site our families can walk to. 4, provide support for families with young students in quarantine. And 5, increase seats in the virtual academy. Some families may now prefer virtual for consistent access to instruction and predictable family schedules. Thank you for your time and consideration.
Next is Avery Donart.
My name is Avery Donner. I'm a 5th grader at Monocacy Elementary School. This fall is my first time back in school since the pandemic started. My younger brother and I have some fears about being in person during the pandemic because we cannot get vaccinated yet. I want to tell you about some of my fears and my suggestions about how we can make school safer. We are really happy that our school just started taking some kids out for lunch, and our principal is planning to get all kids out for lunch when she has enough staff to help. When our classes don't get to go out for lunch, though, my mom picks us up because it is not as safe as eating outdoors. I feel safer outside and wish that my school was letting us meet outside for breakfast and when it's rainy too. It would be really cool to use under a tent. Also, I'm in a class with 30 students, and I am worried about the air I'm breathing in because COVID is airborne. On Friday, 8 classmates of mine were sent home because one had a cough. We waited all weekend and found out on Tuesday that he did not test positive for COVID. It made me really anxious over the weekend, and I wondered when I could get to go back to school. I think it would be great if school nurses could test students in school so we would all be able to get the test quickly and be reassured. I am glad we're all using masks, but it would make me feel safer too if we would see that we have fresh air in our classroom. It would really help ease my mind and my mom's if our school district monitored CO2 to make sure there was enough fresh air. Well, these are just a few of my suggestions. Thanks.
Next is Jill Dash.
Thank you for the opportunity to speak. My name is Jill Dash, and my 2 girls attend Flower Valley Elementary. I'm here to encourage you to act with urgency to expand COVID-19 precautions in schools, particularly given high and rising cases in our area. MCPS's testing plan is too small and too slow. The fact that school started on August 30th and we are here on September 9th, and the testing plan does not even begin until September 13th is insufficient and unacceptable, as reflected by 1,000 quarantined students after 1 week of school. Our county has world-class scientists and doctors. We should be using the gold standard in testing, not the minimum set forth by the CDC. If the Los Angeles Unified School District with 500,000 students can test everyone, surely so can we. For every student who gets infected, that may be a statistic to governing officials, but for a family, someone's health may be in jeopardy. Learning is interrupted for the infected student and their classmates, and caretakers may be prevented from working. You have the tools at your disposal, including programs entirely funded by federal government grants. You must implement a better testing regime immediately. Other prevention strategies include masking, including making sure students have access to well-fitting masks and are educated on how to wear them properly. I would ask you to also consider mandating 100% masking on school grounds. Particularly with young children, distancing is neither possible nor realistic. I also ask that you examine your plans with respect to ventilation, distancing, and outdoor space, and provide transparency on how those strategies are working. I know that MCPS is trying to get these things right, but I ask that you reorient your thinking to be maximally aggressive so that we can lower transmission and keep kids safely in school.
Next is Jumka Gupta.
I'm Jumka Gupta. I'm parent of an MCPS elementary student, an MCPS alum, and a public health scientist. I'm here to underscore that the current MCPS COVID testing strategy is inadequate. By not bolstering the current plan, you will be making a policy choice that will fail to utilize all of our available public health tools towards reducing transmission among our school population and the greater community, as well as ensuring sustainable in-school learning. The current plan is opt-in, which we know from the public health literature does not yield high uptake. Taking a random sample of those who opt in is barely a testing program. A modeling simulation study conducted by a CDC-funded team in North Carolina, currently undergoing peer review, predicts that universal masking in the absence of weekly testing of at least 50% of students will result in 49% of elementary students to be infected by November 30th of this year. The simulation study corroborates what is already known. A layered, multi-pronged mitigation strategy yields more protection. The model predicts that when weekly testing of 50% of students is added to universal masking, infections are halved. We need an opt-out approach to testing. We need routine weekly testing of all students who have not opted out. And we need rapid antigen testing available within schools for symptomatic students. By implementing these strategies, you will be making a policy choice to lower transmission within our school communities and ensure continued learning within schools. Thank you.
Next is Ashwin Thermathikaru.
Hello, Board of Education, Dr. McKnight, and others listening today. My name is Ashwin Dharmadhikari, and I'm the parent of a second grader with an MCPS with a high-risk medical condition that substantially increases her risk of severe COVID. I am a pulmonary and critical care physician who has seen how COVID harms patients and destroys families. I am also a public health trained professional who has research and work experience in airborne infectious diseases and mitigation. I call attention today to the need for a safer in-person learning environment for kids with high-risk conditions. The MCPS reopening guide explicitly highlights several equity issues, but notably missing is equity for the medically vulnerable. Indoor instructional environments must be made safer for the most vulnerable kids in classrooms. The approach should follow the Swiss cheese model, illustrated in the written version of my testimony, which recognizes that no single layer of mitigation is sufficient and each mitigation strategy has holes, but together the chance of harm, in this case infection in the classroom, is reduced. The CDC guidance on reopening and mitigation is being implemented by MCPS with large gaps that leaves children with chronic health conditions at higher risk of hospitalization and death than their healthier counterparts. The current MCPS testing plan does not adequately detect who may be harboring COVID when entering schools. This allows kids with COVID to enter schools and infect others. Universal masking is very helpful, but comes with lapses and breaks in adherence. MCPS needs to test a far greater proportion of kids to help identify and keep COVID out of classrooms. Indoor spaces must have real-time ongoing measurements of indoor air quality to ensure that air turnover is meeting ASHRAE standards for spaces where airborne pathogens can be transmitted. MCPS must take substantially stronger mitigation steps now before we start having large groups of students in quarantine or see children in our system getting hospitalized or dying from COVID. At present, my child and others like her who have chronic health conditions do not have as safe a school environment as their less at-risk counterparts. MCPS must do better since every child's wellness matters. Thank you.
Next is Stacy Caper Duran.
Hello, my name is Stacy Durand. Thank you for your efforts to reduce the risk of COVID at school, but we must do more because the predominant Delta variant is 4 times more contagious than the original strain MCPS planned for this fall. My son is a first grader at Oakland Terrace, and he has a little brother who just turned 3. Both of them, especially my little guy, are months away from being able to be vaccinated. But if they catch COVID, they have a 1 in 10 chance of developing long-term health issues, such as shortness of breath, fatigue, brain fog, or other problems with their little developing hearts or lungs. That's unacceptable. We must immediately require our teachers who are teaching our kids in person to be vaccinated. Testing is important, but doesn't protect our kids like vaccination does. We don't have any choice but to send our kids to school in person, and that should be fixed too. We should provide a real virtual option that allows students to learn from teachers from their own school. The virtual academy deadline and requirements were too rigid. You shouldn't have to have a pre-existing condition to not want your child to catch COVID. And you shouldn't fall behind at your own school. Ours, for example, is halftime in Spanish, and that wasn't offered. When the virtual academy deadline closed July 2nd, our county's daily COVID case count was around 6 or 7, and our county was low risk for COVID. The situation now is very different. Our county is high risk for COVID and averaging daily cases in the 150 range. More than 500,000 children in the U.S. contracted COVID in 3 weeks just before school reopened, which is a drastic increase from earlier in the summer. Pediatric hospitalizations are up nearly 400% since late June, and every day there are horror stories in the news about thousands of school children having to quarantine because of COVID exposure at school. Please mandate our teachers to be vaccinated, and please let parents have a real virtual option until our children can be fully vaccinated or at low risk of contracting COVID. Thank you.
Next, we will hear from Annie Tolkien.
My name is Annie Tolkien, and I'm the parent of a kindergartner at New Hampshire Estates Elementary School in Long Branch. The new MCPS policy regarding quarantine for unvaccinated students disproportionately impacts members of the Long Branch community at Oakview, New Hampshire Estates, Eastern Middle School, and Rolling Terrace schools, who may not have access to healthcare or childcare and have higher rates of food insecurity. Many parents and caretakers do not have the capacity to stay at home from work during a quarantine for fear of losing their jobs. As a result, some aspects of the MCPS policy could unintentionally harm this community if supplementary services and supports are not put into place immediately. Both New Hampshire Estates and Rolling Terrace have school-based health centers. These centers are supposed to offer comprehensive care to students and families in more vulnerable communities. DHHS had promised the community that the centers would be open on the first day of school, but over a week into school, and the centers are not fully operational nor fully staffed. We need the board to work together with DHHS and Linkages to Learning to provide fully staffed, fully operational school-based health centers at New Hampshire Estates and Rolling Terrace, rapid COVID tests for the schools to be administered on site. We also need your support for a COVID testing site in Long Branch. And lastly, we need you to provide resources and supports for families whose children have to quarantine. 1 week into the school year, and 3 of the 7 kindergarten classes at New Hampshire Estates were under quarantine. While children were given virtual lessons, in my daughter's class, an average of 10 of the 17 students were present during those virtual lessons. And this is after school support teachers reached out to families to provide hotspots and tech support. This is highly problematic and just a glimpse of the loss of learning that these students will face without support from the board, DHHS, and MCPS administrators to address this inequity. Thank you.
Next is Elizabeth Petraglia.
My name is Dr. Elizabeth Petraglia. I'm a statistician, and I'm also a mother of 4 children. 3 children in MCPS. I've got a 6th grader, a 3rd grader, and a 1st grader. My comments today relate to MCPS's new quarantine policy that was released on Friday. So in my work, I do a lot of evaluation studies. We usually have an outcome evaluation component, which is basically, does this policy intervention move the needle on what we want it to change? The other critical component is a cost evaluation. So even if it does work, how much does it cost? And the first thing I was struck by when looking at MCPS's new policy is that it seems like there's a singular focus on one outcome, which is COVID positive cases, without any regard for the cost. And I'm talking about not just the financial cost, but cost in terms of, negative other outcomes for children, disruption to families, things like that. So organizations like the CDC, AAP, and nearly all other school districts in the nation have looked at COVID and looked at all the other, taken a holistic view of children and said, in this case, a less restrictive quarantine policy for the K-12 setting, the benefits of having a restrictive policy outweigh the costs. And as a parent in MCPS, I can speak to some of the costs. Last year, we ended up being quarantined from a pool test. No one ended up with a positive follow-up COVID test, so my children were unnecessarily quarantined out of school for about 7 days. And it was extremely disruptive to my family, to me, negative impact on my children's mental health and education. So I would just urge MCPS to reconsider the COVID policy, follow CDC guidelines, and really look out for the holistic well-being of all your students. Thank you for your time.
Our final video comes from Leslie Miles.
Members of the board, I am Leslie Miles. I've been a Montgomery County resident since 2002. When my family and I decided to move out of the city, we chose to move to the county in large part because of its progressive values and strong leadership in state and local governance. We are proud to call MoCo our home, proud that our county has committed to an 80% reduction in greenhouse gas emissions by 2027 and 100% by 2035, proud that our leadership understands that 2021 is a make or break year for avoiding the worst catastrophic effects of climate change. But these goals will be nothing but failures if we do not have a comprehensive, accelerated, achievable plan for meeting them. MCPS was instrumental in establishing these goals, and its emissions will have to be dramatically reduced if we are to succeed. Other school districts are moving faster and smarter than we are. They are using creative financing. They are recognizing that the expenditures we have to make to deliver services will not need to be higher in order to deliver reduced emissions, and they are taking aggressive steps to change their thinking, their purchasing, and their energy use. We have always been leaders, but we have fallen behind on the most important issue we face. I ask that we assert and act on our commitment and that we prioritize the thing our children will rightly blame us for if we don't. There is no more important thing we can do. Thank you.
This will conclude our public comments. The next business meeting of the Board of Education for public comment is Tuesday, September 21st. Sign-ups will open Tuesday, September the 14th. At this time, I'm getting there. At this time, I'm taking comments from our board members. I'm starting with Dr. Daka.
Oh, thank you for your testimonies. We are listening carefully.
A number of issues that were raised in the comments will be addressed as Dr. McKnight and her staff present information in the upcoming segments. And on the issue of staff vaccines, there is a new business item at the end of the board meeting presented by the board that will mandate all staff to be vaccinated and establish the timeline. But board members are concerned about the quarantine situation and what had come from the Montgomery County Health Department, and there will be a lively discussion in our work sessions.
Ms. Mandrowski.
Yep, thank you. I associate myself with the comments of Ms. O'Neill. I also had a question, though, about the virtual academy. When we were talking about, the opening of it and the enrollment for it, we had talked about the fact that because of the situation with COVID, and there might be, and the masking and all that, there might be families that would not normally want to apply for it, but that would be applying until they felt better about going back to in-person. Can you speak to the concerns about the having to have a pre-existing condition in order to participate in that?
Absolutely. Thank you so much for that question, Ms. Mandrowski. So yes, we've been talking about the Virtual Academy, and one thing I'll say initially about the Virtual Academy is this was an opportunity for us to provide our families with a option, given that we knew there would be extenuating circumstances that needed to be considered coming into the school year. And yes, we are in a very different place today than where we were in July when this entire process started. And so we've acknowledged that with our families and have done a number of things to address it. One, yes, we've opened up the window and allowed additional families to come in. We also are balancing, quite frankly, two settings to serve our students, the virtual academy and in-person learning. And we have all of our staff that we've hired that we have to accommodate students in both of those areas. And so when it comes down to switching students out and into the virtual academy, it really becomes a difficult switch, especially as we get closer to the opening of the year, because we have staff designated to serve in-person learning experiences and those in virtual academy. So when it comes down to those health requirements, we had extenuating circumstances outlined in the application so that our families would know exactly what that meant in the frame of what would be allowed into the virtual academy. But as we are a business of serving students and working with our families, I think it's important for all of us to continue to have those conversations with families. If there's a family who have a student who has a health concern and the family has concerns about how the environment in-person learning is going to look and impact their child, that's a conversation we want them to have with their schools, just so that they understand how the protocols may address those specific concerns that they have. So that's where we are with the virtual academy and the desire to have that ongoing conversation with families to meet their needs.
Yeah, I appreciate that very much. And I have questions about the rapid testing, but we'll discuss that during the presentation. So thank you.
Ms. Silvestri.
Just thank you, everyone, for your testimony today. I think that we can all agree that we want our children in schools learning in front of their teacher and to minimize the quarantine as much as possible. And so that will be a large part of what we're discussing today. But testing is coming to our schools, I guess is what, and that will help to alleviate a lot of the problems that we're seeing with the large numbers of quarantining. So we hear you, it's a problem and we're going to address it. Thank you.
Thank you. I also have one question. Well, actually, two. I didn't hear what school Avery was at, but I'm wondering if we could check that and provide any support they might need to assist them with outdoor recess, outdoor lunches. I'm not sure what the situation is there, but I'd appreciate somebody checking on that. And the other thing I just wanted to say is that we do have 100% masking policy in our building. So I had heard one of our speakers speak to that. I don't know what's going on at her particular school, but there is 100% masking policy in our buildings. Ms. Evans. Go ahead, Ms. Harris.
Yes, could we get follow-up on why the school-based health centers at Rolling Terrace and New Hampshire States are not yet open, and also a check on our other 10 school-based health centers to see if they are open and operating as expected with the start of school?
Yes, we did. I did note that as a follow-up. I did hear in public comment the remark being made that they were not fully staffed and did not have all of the components that they needed. But absolutely, we will follow up with DHHS and determine what the status of them all being open, but most importantly, being able to provide services that meet the needs of the community. Thank you.
Ms. Haluni.
Yes, I just wanted to echo what Ms. O'Neill and Ms. Silvestri said about minimizing keeping students out of the classroom while prioritizing student safety. As a student myself, I have peers, I have friends who have been quarantined and kept out of the classroom, so I sympathize with those parents, but I also want to say that we do want to prioritize student well-being and safety first. I did want to ask for a follow-up for Ms. Anderson and Mr. Rand. If we could just follow up with them, give them information on how to register for the virtual academy, especially at the end of those quarterly registration periods I know we talked about at our last meeting. That would be fantastic. Thank you.
Thank you. And I think one point that we never seem to bring up about the virtual academy is that we do have a cap on the number by the state, and that in order to increase enrollment beyond that number, we have to go back to the state. So with that said, let us move on to item number 6.
Ms. Wolf, may I just interject, because the issue about the health rooms, not just the school-based health clinics, but our health rooms, the school nurses, the health techs, are not MCPS employees. And the operation of those school-based health clinics, health rooms, the testing, all runs through the Department of Health and Human Services. The employees are MAGEO employees, not MCPS employees. And for us, it is a difficult situation navigating through those waters. Hence the reason, even about the test kits, that the board sent a letter to Mr. Elrich this week. It was a letter of help. We need help. And we're all in this together. I'm a grandmother. Brenda's a grandmother. I experienced my grandchild in a 14-day quarantine this summer in camp, and we're worried about what her school situation will bring over in Virginia. All of us want kids in school in a healthy and safe way.
Okay, thank you. So Dr. McKnight, I'll ask you to proceed with item 6.
Yes, thank you, President Wolf. I am thrilled that we are coming and having conversations today just about the very things that we've talked about. One commitment the board has spoken to, and I've said throughout this entire pandemic, is if we had thought that we would be in this situation a year ago, 18 months ago, but here we are, still navigating the pandemic, still navigating circumstances. We just spoke about how circumstances have changed from July up until today. And so as we prepare for that, we will continue to share with you the lessons that we've learned together, the feedback that we're hearing and taking from you to improve and make adjustments as necessary. And so we have a whole section of our meeting today to talk specifically about contingency planning and quarantining, where we'll address some of the specific questions that you have raised and we've discussed thus far in public comment. However, we are going to start the conversation today with just acknowledging that we just here a week ago were able to reopen a new school year and bringing back nearly 160,000 students. And I say that to you with true just appreciation, because it's been 18 months since we have been able to last do that. That's a very long time. And for the reasons we've talked about today, and we're going to continue to talk about, having our students in school, having in-person learning is a priority, has to be a priority, and it all has to be around the emphasis of how do we keep our schools safe. And that will be our commitment and our ongoing conversation throughout this year or throughout the time that we're experiencing this pandemic. And as we highlight the opening of schools, I do want to say it was an exciting day to bring back nearly 160,000 students. I personally and board members haven't been happier to see the buses roll up to schools, kids getting out, going into schools, and it was interesting to even see them get reacquainted with one another in a different way. And it just continues to acknowledge that this is a process that everyone's coming back into and reacclimating themselves to. But I've never been happier to see bus drivers pull up in front of schools and kids getting out. And it was an incredible feeling. And just the fact that we were able to open and we were able to address specifically what some of the needs were in our first week just speaks to a continuous mindset growth and how we'll continue to improve. So during the first week, members of the Board of Education, members of the senior leadership team, we had an opportunity to go out and visit a number of our schools. And so we saw firsthand a lot of the things that our schools had done to just prepare for the opening. Much of what we've been discussing here in board meetings, but to actually go out and see how some of those practices are playing out. What are some of the successes in those practices, and what were some of the challenges? And in the midst of us reopening the new school year, I must acknowledge that, again, we did experience some challenges. Yes, students were able to get into schools, we were able to open the door safely, but we did have some HVAC systems that we had to address the first couple of days of school. We had an individual school that had to close due to a water main break the first week of school. We had power outages. We were able to dismiss students early as a result of those power outages. And then we had a system-wide closure that we had to have on the third day of school in the first week related to just the remnants of a hurricane. And so, again, they were challenges, no doubt, but we learned from those challenges, and we strived to get better from those challenges, and that's exactly what we were able to do. And I just want to say thank you to our students, staff, and families, because as we worked through those challenges, we really had to depend on each other and think about how all of those challenges fit into the context of the pandemic. A power outage prior to the pandemic is very different now, because then it addresses air quality. So those were things that we had to take into consideration. But I must say that I'm confident we will continue to improve our processes. Yes, we also had longer bus waits because of our bus driver shortage, but we're going to continue to recruit and hire bus drivers as we have done over the past week, and will continue to do to make sure we're meeting the needs of those challenges. So today we're going to provide you information on our reopening of schools and our health contingency plan. The first portion of today's presentation is going to focus on reopening from the perspective of our principals and students. And so thank you all so much for being here. You are on the front lines there having those experiences. So we look forward to hearing from you specifically today about what those experiences are. And your voices do represent an obvious lived experience. We're pleased to have the principals of John F. Kennedy High School, A. Mario Lorderman Middle School, and Ronald McNair Elementary School here with us today to share their reopening stories, highlights, and challenges of the first week. We're also going to hear from 3 students who will share their perspective on the first week and what it's been like being back in school buildings full-time and having the opportunity to reconnect and reestablish relationships with others. So following this presentation, we will then have an update on operational updates and instructional contingency plans so that we can continue the discussion. So at this time, I will ask you to bring up the slide presentation, please. And I will turn it over to Ms. Rubin.
Yes, thank you, Dr. McKnight. Good afternoon to Dr. McKnight, our board members, as well as those who are watching us at home and those of you who are in person. I'm extremely pleased to have the opportunity for us to analyze the opening of schools. I'm reminded about our Prosper 100 framework and mantra that says open 5 days a week for instruction. And that's a key pillar for us because we've been able to achieve that with side-by-side support of our schools, our central services members, as well as our community leaders. And so when we consider where we were at this time last year, our ability to really be here at full capacity and offering a full instructional program to our students, I believe it's something that we really must take some time to highlight and celebrate. It really does exemplify resilience, teamwork, and a deep and abiding commitment to the work of education. Personally, as I walked the halls of schools last week, I did miss being a principal for a minute there. It was very nice. I was able to reminisce. But I saw students who were happy to be back in schools, be happy to be back in their classrooms, teachers and leaders, support staff working to make schools as safe as possible and really as close to what students remembered. But I also saw everyone wearing a mask, including myself, which was a reminder that things really were not as we remembered or left them. Many of us can relate to taking a trip or visiting friends or loved ones and having an amazing time. But at some point, you do want to get back home to the things that are familiar and the people who are familiar to you. And that is a normal feeling, as it is normal for us to want things to be as they were prior to COVID. Yet here we find ourselves more than 18 months later, still navigating the COVID-19 pandemic and the rise of the Delta variant. We have opened schools 5 days a week for in-person instruction, and yes, we have not done so without challenge or obstacle. Yet, I charge that in the face of those challenges and obstacles, you will get to hear today from some of our school leaders and our students about their experience returning to full-time in-person instruction and really the tremendous work it has taken to get us here. So with that, I am very pleased that we have our principals joining us here to share their journey of the opening of schools and how they and their school communities are experiencing it. So without further ado, I would like to pass it to Mr. Joe Rubens, the principal of Kennedy High School, to lead off the presentation.
Good afternoon, President Wolf, members of the Board of Education, and Dr. McKnight. I'm Dr. Joe Rubens, proud principal at John F. Kennedy High School. My goal today is to provide you with an update on our approach to the JFK reopening and our strategic reentry activities. And these are in no particular order. I'll begin with first our focus on our new students and our seniors. We had significant focus on getting our grade 9, grade 10, and new students acclimated to our building. Up to the first day of school, we offered tours of our school building to our families. We offered administrative support to our grade level parents and guardians up through pre-service week to help allay parent fears and answer questions regarding school day structure and COVID protocols. It was great to begin day one with our senior class, and there's now our traditional senior sunrise activity. It's an event outside on our track, and it was great to see the students safely gathered outside for the senior sunrise activity. On day one, our admin team, our faculty were present at every entrance, greeting students and helping them find their homeroom classroom so we could issue schedules. We maintained presence throughout the week, assisting students with finding their classes to ensure smooth transition back to in-person learning, and obviously this presence continues throughout the school year. We began making visits to our classrooms for grade level town hall meetings. Members of our counseling department joined us and will be joining us for those meetings. And essentially the focus or the goal of those meetings is to focus on our academic expectations, our behavioral expectations, and equally as important right now, the supports available for our students. Next, we concentrated on developing a sense of community. We implemented a new advisory period at John F. Kennedy High School this year called Cavs Time. We're the home of the Cavaliers. Cavs Time stands for Cavalier Academic Value Sessions. That time is used for our social emotional learning, SEL lessons, grade level specific college and career readiness activities, and to support our NYP and international baccalaureate learning. During week one, CAPS time actually met every day and focused on relationship building, establishing trust, reestablishing trust, and a sense of community. These activities included a student needs assessment. We also had a game of homes activity, which included having students explore their own sense of identity both in and out of school. Our cheerleaders and proms were great during week one. They're always great, but they assisted with welcoming students back to the building, getting them excited about our upcoming opener fall sports games, and our marching band even performed last Friday during lunch for our students. With regards to COVID protocols, after seeing the first week of school and the amazing amount of student interactions, it's now clear more than ever that school is such an important component for our students' social emotional growth. We had to do some reminders about masks, but overall students have been absolutely great with understanding the importance of wearing masks in the building. They've really done a great job. We're monitoring old habits because they are children, including the sharing of food and drink and things like that they've grown accustomed to, and especially for those students who are half asleep in the mornings who actually forget their masks. We keep an extra supply in our main office, and I actually even keep some in my pocket in a Ziploc bag for those students as we greet them as they're coming in. Something we should have implemented years ago, pre-COVID, is the opening of all of our courtyards for students for lunch. Students are excitedly taking advantage of the open air lunch setting. We're limited right now because of our construction project that's taking place at our school, but post-construction I envision opening more outside space for our students during lunch. They really have absolutely loved that. And for the COVID cases with students and staff that we have experienced, unfortunately, our admin team has jumped in with both feet and taken the task of conducting the tracing. And I will say that the seating charts that are in Synergy and the seating charts that our teachers have created have really assisted with this process. Finally, equally as important, there's been focus on our instructional priorities. On new student orientation day, we greeted all of our students in our graduation gowns and hoods as part of our Destination Graduation Initiative, reinforcing that though we are absolutely thrilled to have students back in our building, our main purpose is to develop inquiring, knowledgeable, and caring global citizens whose immediate sights are set on graduation day. We greet them in our graduation gowns because we want that to be the first and last image they see of us when they come to John F. Kennedy High School. Our admin team spent a lot of times in classrooms during the opening week to get a pulse of what was happening and to see where our students were. And in addition, our director accompanied me during some of those classroom visits. It was really great to see Dr. Sergo at our building. Moving forward, we want to continue to build on our best work, apply key practices and learning opportunities in new ways, and continue to do all we can to meet the needs of our students and families. Thank you for your time. I really do appreciate the invitation to be here and the opportunity to share a snapshot of the opening week of school at John F. Kennedy High School. And now I'll pass it to my principal colleague, Ms. Megan McLaughlin, to share updates from A. Mario Lorderman Middle School for the Creative and Performing Arts.
Thank you. Good afternoon, board members and Dr. McKnight. At Loiterman, we had a really successful reopening in the spring of 2021. So our instructional leadership team decided to reinstate the guiding tenet that led us through that time. Our guiding tenet of valuing and protecting the physical and emotional safety of our school community may seem simple, and yet it truly elevated what was most important to enable us to prosper in the new school year. With our guiding tenet in place, we began to prepare for the new year by analyzing student performance data and stakeholder voice data, and our collective analysis led us to solidify the shared belief that all members of our school community are capable of great success, and they deserve to be viewed through an asset-based lens. We collectively committed to developing asset-based classrooms at Loiterman that are inclusive and responsive by creating a physical environment that respects student learning preferences and is conducive for learning. building positive asset-based student-teacher relationships, fostering student engagement by promoting voice and choice, and establishing predictable routines and a gradual release of responsibility. We began our pre-service with the theme of connections before content. Since it had been almost a year and a half that we were all in a school building together, it was imperative that we took the time to renew our relationships with each other and with our students. In planning for our teachers' return, we designed their pre-service week to mirror what we wanted our students to experience when they returned. In other words, the main purpose of our pre-service was to support staff to meet our students' needs. We limited whole staff gatherings and instead scheduled smaller, more intimate sessions where teachers could form connections with their grade level teams and departments. We made sure that there were community building activities at the start of all meetings, designated time and departments to establish norms, and that we modeled forms of social emotional learning that enabled our adults to reflect on their strengths. The structure of our pre-service week provided us the model we needed to successfully put our students first and welcome them back to our building. From multiple student orientation sessions throughout the summer for all grade levels to our first week of school activities, we designed every activity and structure with the intent of alleviating any fears or anxieties our students and families may have about the safety of returning to school. Our PTSA created an Amazon wish list of items to help our teachers create calm corners to support our students when they need a brain break or a mindful moment during class. Our restorative justice lead designed weekly community circles to continually build connections between staff and students. And our fantastic main office team delivered large baskets of cleaning supplies and PPE to every single classroom space. To further support the physical safety of our students, we created an outdoor lunch rotation schedule that utilizes 3 of our outdoor spaces and enables us to keep track of the location of our students throughout the day. Many of our teachers have also made their classrooms available to small groups of students who want a quieter space or want an opportunity to receive support in a particular content area. We monitor the location of those students who go to classrooms for lunch by having our teachers submit a Google form each day. Finally, we reintroduced a dismissal structure that we used in the spring, where we dismiss walkers and car riders first, and then we enter bus numbers on a slide that teachers display on their boards. Once a student's bus appears on the slide, they're dismissed, and this process not only alleviates that stress that comes the first few days with trying to locate the correct bus, but it also significantly decreases the numbers of students crowding an area as they wait for their buses to arrive. While the first week of school did certainly present some unanticipated challenges, the collective strength of our school community and our district and our clear guiding tenet enabled us to quickly pivot and still be able to experience the joy of having students and teachers back in our classrooms. Thank you very much, and now I will be turning it over to Ms. Sherry Moses, principal of Dr. Ronald McNair Elementary School.
Good afternoon, Dr. McKnight, President Wolf, Board of Education members, and those in attendance. It is hard to imagine we are now in our second week of school. At Dr. Ronald E. McNair Elementary, the start to the 2021-2022 school year has been one where we are embracing the Leader in Me curriculum with an emphasis on our vision statement, where we are empowering students to grow into compassionate, independent, lifelong learners. Our staff examined Begin with Knowing Ourselves, Habits 1, 2, and 3, by identifying our core values to create mission statements focused on our vision. We knew that we needed to do so in order to avoid pouring from an empty vessel. At the core of our work was knowing we needed to build relationships with students. This began with our kindergarten playdates in the summertime, virtual school welcomes to allow parents an opportunity to view various areas of our buildings, our kindergarten welcome night, and of course our open house. During the first week of school, it was all hands on deck, with non-homeroom staff at arrival to welcome and assist our students with getting in the building and of course wiping tears. At dismissal, our staff was ready and able to assist our students with navigating their way home to ensure their safety. We knew that not only our kindergartners would be entering the school building for the first time, but many of our first graders were in that same shoe. So we provided additional para support, counselor support check-ins, and of course, administration support to those grade levels. We did not forget all of our other students. While our focus was on kindergarten and first grade, staff has already engaged in class meetings with that Leader in Me curriculum. It is through those conversations with our students that our students in our classes begin to coexist as one unit, basically a family away from home. We are in the process of holding our Q1 town halls, where we are utilizing webinars so that we don't commingle our students as much, but it does give us the opportunity to have some level of interactivity with our students and to ensure that we are reviewing how we soar at McNair, which is safe, organized, actively learning, and respectful students. Speaking of safety, we've had a heavy emphasis on wearing masks, washing hands, and social distancing. When discussing these expectations with our staff, we emphasize that this should not be a lecture. After all, we're in elementary school and it should be a fun experience. We encourage them to create challenges where students practice putting on their mask correctly, showing how to hand wash with videos, remembering to sing the birthday song, and utilizing skits to teach these expectations. While we are a large school, we have created outdoor seating right off of our cafeteria to allow for our students to eat outside. We have created pods within our cafeteria as a way of ensuring that grade levels are not or classrooms are not integrating with each other. And the tables are marked with different colored stars to assist the students remaining in their spots for social distance. Our students, though, are assigned seats on a rotating basis that is created during their class meetings where they discuss sitting with different students to continue to strengthen the sense of community in the classroom. We know that there are many more exciting things to come for our students, and while the challenges were there, our staff thrived during the time and welcomed our students the first week of school. I'm excited to learn and see all that our students experience as they soar towards success at McNair. I thank you for the opportunity to speak before you today, and I will now turn things over to Ms. Shella Cherry for the student perspective.
Thank you, Ms. Moses. Good afternoon, Board President Wolf, members of the Board of Education, Dr. McKnight, and the greater Montgomery County community. I am Shella Cherry, and I proudly serve the district as the Director of Student Leadership and Extracurricular Activities. Today, I am here with great excitement to introduce to you 3 students from across our great district to share their stories and reflections of the first days of school. While none of these students have met one another or heard each other's stories, you will note that they share similar themes across each one of them. They share their mixed emotions of nervousness and excitement for the first days of school. They also highlight the work of their teachers, staff, administrators, and even their peers for making their schools feel welcoming and safe with each passing moment. So at this time, I'd like to introduce to you Mr. Shelton Fontroy, a 12th grade student from Albert Einstein High School.
Good Board President Wolf, Interim Superintendent Dr. McKnight, and members of the Board of Education. I'm Shelton Fantroy, a senior from Albert Einstein High School, and I'm here to share my reflections of the first week of school. After my first week of school, I've come to realize that the reopening of schools after a pandemic was not only a significant change in our educational system, but also a time for change. As we progress to normalize our everyday lives as staff and students, we need to realize that we won't be back to normal, but we can make our new norms, working to provide necessary programs, technology, and funding to create equal and equitable opportunity for success for all of our students in our school system. It was hard to return to in-person learning after schooling from home for a year and a half and also having a stressless and peaceful summer. Plus, this was the first time that the county had opened its schools during a pandemic. My first day back wasn't like any other before. It was skeptical because of a COVID outbreak. I'm sorry, not because of crowded hallways, but my school offered necessary guidance and safety measures that relieved some of my fears. Throughout the week of my senior year, I felt the traditional school spirit in a moment of surrealness with hall marches, class assemblies, football games, homecoming theme, and struggling to find my classes. And as a member of my school band, it was different to experience practicing because of the face masks that we had to wear and bell covers over our instruments. I thought that when I got to school that students would neglect the guidelines, but almost everyone wore their masks and respected the boundaries of other students. And this made me proud because of the message that MCPS was spreading throughout the county and across the nation. Classrooms were not too overcrowded. Though hallways were a bit crowded, most of my fears will leave. Class assemblies and other meetings have stayed virtual due to safety guidelines that our school offered. And also, though teachers and students were very well maintained in their classrooms, on the first day, one of my teachers, they talked about the mask requirements and protocols that we had to follow if we had gotten sick or if we needed to quarantine from home. We learned about the routines for keeping our school safe. And a lot of my teachers have been teaching virtually for so long that many of them were excited to return back to school and teach to students, as students were to see our friends. One of my teachers, Dr. Williams, my sociology teacher, had led us through an icebreaker that caught my attention. It was called the snowball fight. And so this allowed each student to write 3 things about themselves. And it was an inclusive and interactive way for our peers and teachers to understand each other in a fun and engaging way. Where staff and students can go for anything ranging from mental health breaks and time to vent due to our newly established wellness classroom that we made for staff and students to have the ability to do these things if they're going through a mental health break or just need to talk about anything. And throughout this year, as we progress, it is important that we grow as a community, as a school system, to continue creating a safe, new and creative learning environment for all of our students and staff. It is important that as a school system, we respect our voices of our students and staff, and that's why this testimony is so important to me. And every other testimony that my peers and myself read is important to me. So thank you so much for allowing me to share my reflections of the first week of school with you all, and I will pass it on to my next peer.
Thank you so much, Shelton. I'd like to introduce to you Ms. Dylan Mogad, a 7th grade student from Hallie Wells Middle School.
Hello and good afternoon, everyone. My name is Dylan Mogat, and I am a 7th grader at Hallie Wells Middle School. My first day of school was primarily exciting. I was really anxious because it had been a very long time since being in a school building for me and a whole lot of other kids. The half-day school orientation helped me a lot. It prepared and gave me the feeling of what to expect. My first impression on the first day was pulling up to the school and seeing so many kids. Normally, this would concern me because we take COVID very seriously in my home. But I noticed everyone had their masks on, so I felt reassured by that. I also noticed teachers were everywhere, inside and outside the building. They guided us, answered any questions, and helped us a lot. All the teachers were also very outgoing and enthusiastic, which made me feel happy to be back at school. I was so happy seeing my friends in person after so long. Entering the school was a bit overwhelming because of how crowded and loud it was. The building was very big and I did get lost sometimes, but there were many teachers there to help me find my classes. We spent most of our time introducing ourselves to each other and going over regulations about the school and etc. This was helpful because it helped ease us into being in a learning environment again. Overall, it was such an exciting and kind of exhausting day. It brought back a lot of memories when times were normal. I'm looking forward to this school year, and I can't wait for our new normal to start. Thank you so much for allowing me to express my thoughts. Have a great day.
Thank you, Dylan. And at this time, I'd like to introduce to you Miss Maddie Nurse, a fifth grade student from S. Krista McAuliffe Elementary School. Maddie?
Hi, I am Madeline Nurse, a fifth grader from S. Krista McAuliffe Elementary School. Thank you for having me here today. I am happy to be back in school to get all of the help and support on my work from all of my teachers. The school staff welcomed us back after a long time away. Me and all of my friends are having so much fun getting back to normal activities like specials and playing at recess. I was looking forward to going back to the building to seeing all of my friends and my teachers. On the first day of school, a teacher came on the bus and instructed us where to go as we entered the school and how to get to our classroom. Our teacher reminded us about COVID safety protocols, and we are helping each other in the classroom to keep it safe. Thank you for letting me share my reflections today.
Thank you so much, Maddie. I wish to thank all three of our students for sharing their experiences with us today. And at this time, I'll turn it over to Ms. Wolf for discussion or questions.
Thank you very much. I really appreciate your taking your time to come here today to speak to us. I don't have any real questions. I just have an observation, and then I'll move on to my co-board members. And that is, it would have been nice to hear the perspective from a teacher also, I think. And so that might be something that you want to consider for the next time around. So I'm going to start at this end with Ms. O'Looney.
Great, thank you, Ms. Wolf. Thank you so much to all of our students, Shelton, Dylan, and Maddie, for coming, taking time out of their school day to be here. I know how difficult that can be, so I really appreciate that. I guess, I'm a student as well, so I can share my experiences and thoughts from my week and a day of school. I think one thing that we're really, really going to need to emphasize throughout this entire year is just adaptability and a willingness to change. I think in previous years, a lot of community members, students, families, teachers, staff found a lot of comfort in a routine and comfort in knowing what we were going to do day after day, week after week, year after year, and going back to that every single time. And this year, that's all going to change. I really want to shout out my administration at Richard Montgomery High School, Ms. Deeney, who's a brand new principal. She's done a really good job at adapting just this second week of school. We noticed that we had crowded hallways during lunch, so now we're doing scattered entries, dismissing one floor at a time, each section of the building at a time, making sure that administrators are walking around, really making sure that we're using all available space inside the school building, not just concentrating in the cafeteria, even though that's where students naturally tend to drift towards because, again, routine, and that's what they're used to. So just putting a real emphasis on adaptability from the administration side is something I'm really glad to hear from our panel here today and is really going to benefit our students. So thank you.
Ms. Harris.
Thank you. I wanted to first echo several things that Ms. O'Looney said. First of all, that it's so important that we acknowledge that this is not going to be a year of routine. This is going to be a year of constant vigilance and monitoring of what COVID and now the emerging Mu variant are doing for how we safely operate schools and being willing to adapt as we need to in real time, perhaps. And so that is, as out of some people's comfort zone, I acknowledge, and I wanted to appreciate as well what Ms. O'Looney shared and what you all have talked about too, about the very creative solutions that you are using to create school environments that are welcoming, that are places for learning and for recovery and feeling safe and welcome and valued, but also acknowledging the challenges. we need to social distance. We need to cohort. We need to acknowledge the reality that we're going to have positive cases, and we are going to need to be able to contact trace. So I appreciate some of these creative, the colored stars on the tables so students can identify where they're supposed to be, especially in our little learners. Those are great tools, and I hope that there are opportunities where you and your colleagues are sharing, you know what happened in school today, and boy, we didn't really, this is what we did, and sharing those best practices across the system, because I would guess that you're a great peer PLC, and so sharing those best practices and also the best practices that our students are seeing and adapting and sharing. So I thank you for the creativity and the adaptability.
Ms. Evans?
Yes. So I too want to thank our principals for being here today. I can definitely attest to what Dr. Rubens mentioned earlier. I have a student, a 10th grader at John F. Kennedy High School. So for her, it was like being a new student for the first time, and the staff, everyone in the building has done a great job in welcoming the students and helping them to make their way during this new way of doing things under the pandemic, right? So I have a question for Dr. Rubens. You mentioned that you've experienced some COVID cases at your school, right? And we've had parents or community members come and give public comments around quarantining. We know that our teachers are working hard trying to provide that instruction to our students who are at home. Can you talk a bit about the work that administrators are having to do with contact tracing? I don't think people really realize that, but can you just discuss that, what all that entails, please?
Yes. So it's certainly not easy. But our ultimate goal is we want to ensure that our students, our staff, our families are all safe and that they're being educated. I don't know how to explain it because each case is been kind of different. But I guess the best way to answer it is that it's become a part of the new normal. It's the work that has to go on in schools for us to continue to run our school buildings. I think that certainly the message that Dr. McKnight put out yesterday is welcome. Certainly we had our high school principals PLC yesterday, and Dr. McKnight presented there and kind of gave us a preview of that. We certainly welcome the testing that's going to be coming to schools. I think that will ease the job of it, but I don't know how to summarize it because we've just had so many different, I'll say we began last week with a student emailing teachers saying that they were positive, and it kind of freaked people out. And then after we scrambled and began looking at classroom rosters and looking at seating charts and looking at the closeness of students within those classrooms, it turned out that the student was not positive. And then I got a 5:30 Friday evening call about somebody who was, and that took a good deal of time Friday evening to contact all those families because we didn't want them to go into 4 days away of school, 4 days being away from school from not having information and us knowing who was vaccinated and who was not, and being able to make those decisions. So it is by no means easy work, but it's new work that we're having to deal with in this new quote unquote normal.
So then I guess my question specifically is, you have to call, as the administrator, all of the people that need to possibly go into
potentially could have been exposed.
Okay.
Yes, ma'am.
Right. Okay. And then what about how you're responding? You have to come up with a letter as well. You have to.
Yeah. So we have a letter. We have different letters that we send out based on different cases, and then I will say one thing that our teachers have been really great with is that each of our resource department teachers, our department chairs, have set up a quarantine plan for students that do have to remain at home to ensure that they're still receiving quality instruction. I hope that answers the question.
Yeah. So in addition to, I was trying to say, in addition to all the other duties that you have to do, contact tracing takes away from.
It is time consuming, but I think everybody understands it's where we are right now.
Okay. All right. Okay. And then I've been to A. Mario Lorderman, right? I had a tour. It was great to be able to see how you made outdoor lunch work for your students. I appreciate that. And I want to say that I hope that very soon we'll be getting over there to do a ribbon cutting to show off that magnificent performing arts facility. My husband and I, we walk our dog over that area, and I keep peeking in the windows like I'm dying to get over there. So I was so happy to be able to see, and it's so great. So I just want us, I know everybody can't come in like we normally do, right? But I would hope that very soon we can get over there, just a few of us, cut that ribbon and just acknowledge what is there for our students. It's a really great center. I drive past there and I see the lights changing colors, and it's just magnificent. So thank you for all that you're doing over there to ensure that our students are safe and that our performers are able to do something even during this difficult time, right? Where families can't come in, but they'll still be able to do something. So Principal Moses, thank you. It resonated with me when you said that everyone in the building began with knowing themselves, right? That's so important. I'm so glad your school has the leader in me. We had a brief contact with the leader in me at Harmony Hills Elementary School, but that was back in like 2009. Great program, a great book that they have for the kids. And so I really look forward to hearing more about the leader in me at your school. So I hope you'll come back and talk to us again after you've had that program for a year. Yeah, so thank you all again. And thank you to our students. It's always so great to hear from our students, and they're always open and honest about how things are. So just appreciate that. And so I'll leave it now to the rest of my colleagues to ask questions.
I want to thank you, Dr. Rubens, for talking about the contact tracing. I know that has taken away from a lot of your responsibility to educate kids, and hopefully that we will be getting some assistance from DHHS to relieve you of some of that responsibility. So thank you, Ms. Evans, for raising that, because I don't think people realize how we have had to pivot and pick up and do things that have been outside the scope of our everyday job responsibilities.
President Wolf, and if I may, and I should have thought to ask the other principals as well about your experience, because particularly in elementary school, Principal Moses, what has it been like for you? Like, I should have been asking you that question, so I'm sorry that I've come back to another question, but yeah, please tell us.
So when you think about the relationships, the conversations that we've had to have with families around it and making sure that we honor confidentiality, knowing that kids go home and talk, but it is definitely starting with the teacher's seating charts, with the color coding in the cafeteria. That as well helps us with identifying that in the cafeteria. And it does take time. For instance, an average of yesterday took an additional 3 hours of time just making sure the letters, the phone calls, making sure that we got them set up for our quarantine room the next day, and just answering parents' questions. They want to be reassured, but I do have to say that I've always said I'm fortunate for my community. We were in contact right up till this morning where it was we couldn't getting kids on, and my staff just being flexible in the midst of beginning map testing, meetings, planning, trying to still get the kids on. And in one instance, the parents had the opportunity to switch midday because we got the information in time that the results are negative, and they're like, we're doing great. We're gonna finish off the day. This is set up perfectly. And so there is a fine balance, but it does take time, but it's necessary time because if we aren't ensuring that they go into this emotionally set, then none of that time, none of that learning matters. So even when we have to take the students aside, we don't tell them that it was, oh, you are potentially quarantining. It's, you're going to a small group with Miss So-and-so so that you can do some learning before we get you home. So that it's just the nuances. And it's ironic because Leader and Me, we initially was like, oh, this is an SEL program, but so many of the tenets of Leader and Me and our core vision statement makes this work more bearable. It's not easy in the moment, but the core of making sure this kid's emotional well-being as we navigate this is important, especially for our youngest learners.
And you mentioned what'd you call the room? Is it the
So I call it the quarantine room. I know I should come up with a better name. It's only been 2 weeks. But honestly, it's really, they just know they're going to virtual instruction. They get on the Zoom. We have a whole school canvas. But for us, it was just the staff members know that we need you doing this instruction because my reading specialist, my staff development teacher, and even myself, we've gone in to make sure they're getting solid instruction at those pivotal points. So it's not just someone reading a lesson off. We have our Elmo working where we got manipulatives, the kids are in the books so that it's still curriculum instruction occurring and the kids come back feeling like they haven't missed anything and are too far behind.
All right.
And they are getting that instruction from their teacher. So it's not where it's a department approach. It's their specific teacher.
Okay. So again, thank you. I see on Twitter, not necessarily from our staff here or our employees here in MCPS, but just across the country where everyone's talking about the first week of school has felt like it's been like the first 2 months, 3 months, like that we've been here for such a long time. And I know the work is heavy. And my hope is that you all are taking advantage of self-care, right? That we allow you to be able to do that. I just ask parents, just our entire community, just to continue to give everyone grace, right? This pandemic did not come with an answer key, right? We are, in some instances, you don't know until you know, and so what I appreciate is that we pivoted to figure out what to do next to make it flexible and easier on people in the building as well as parents as well. So, thank you.
I too want to thank you for that description, Ms. Moses, because elementary school has probably been hit really hard by the definition of quarantine we've been using. But you said one thing that I appreciate, and I want to echo the words of Ms. Evans, and the word for me was flexibility. Thank you for being flexible. I want you to know that we do appreciate it. We hear you, we appreciate it, and we're out to help you manage this. So I'm going to move on to Ms. Silvestri.
Thank you. My question is about the instruction that is happening for students while they are in quarantine. And I know it's different for different levels, and it's different also if the whole class goes on quarantine. So I'd like to hear how you're managing that for small numbers, not for the whole class. And successes and challenges, please. And just to clarify, you have a physical room in what, just expand, that was a surprise to me, so maybe it's a virtual quarantine room.
Yes.
If you can just expand on how kids are accessing the curriculum while on quarantine.
So yes, it is a Canvas space on Zoom. And so the parents get a letter informing them how to access that space and their instructional times. So they do have the 60 minutes of math, 75 minutes of reading. They have science and social studies, specials, and then their lunch break. So it is a full schedule that mirrors their typical in-person day schedule. There is off-screen, on-screen interaction in those as well. So I realized when I said it, was like not the right verbiage to use in that moment, but it's a virtual type of instruction.
And what staff is delivering that instruction?
So we have a classroom monitor as well as our reading specialist, staff development teacher, and like I said, myself that has gone in to support and do that. Our teachers upload into our Canvas course the instructional plan, but the staff development teacher, reading specialist, myself, assistant principal, we go through it with that classroom monitor and do co-teaching throughout that time. So it's really mirroring some of that classroom instruction, because in a classroom you might have the paraeducator and the teacher in a symbiotic relationship of doing the instruction. We do that as well, just to make sure that with the math content that our staff development teacher is helping and assisting, is this the right strategy? Is this the right vocabulary? Watching the child model and show as they are working in their Eureka math book. The same with the reading. So it's really broken down and supported that they're not watching a video, they're not just doing sub-plans, they are getting a lesson for that day.
And in terms of your capacity, let's say you have kids in quarantine at every grade level, what happens then?
So that is a challenge, but in the quarantine plan master schedule, one person can interact with 2 grade levels at a time in the way that we did our schedule in our building, because there are some off-screen, on-screen times. So that person could be instructing a 1st and 2nd grader. It is if we got to all 6 grade levels that then we would be having to utilize our paraeducators to help supplement that as well. But as of right now, we are able to manage up to 4 different grade levels with just 2 people, the way the schedule is broken down between the live, off-screen, live, off-screen.
Thank you.
Mm-hmm.
You finished?
So ours is a little bit different from elementary school. So we have a confidential notification through our attendance secretary if a student is going to be away from school on quarantine. And our resource teachers are then notified about that. And the teachers within the department, we have a 7-period, 8-period day if you count lunch. And on the period, which is their IRA period, they then go in and go through the list of the kids and interact and communicate and instruct those students who are on quarantine. So they're getting virtual instruction while they are at home and not getting behind in the class. Obviously, nothing beats, I think, in-person instruction, but this way they don't fall behind. And there are some challenges. Obviously, if a student is in PE and is used to being outside and doing some activity, running around, things like that, there is a modified instruction that takes place if they are on quarantine. But essentially, that process ensures that the students are receiving instruction, virtual instruction from their teacher of record while they are away from school.
It's pretty similar at the middle school level. I think another key piece that we put in place is making sure that the first time on a student's, we're calling it coaching support time as opposed to the quarantine piece, is that they have a check-in with their grade level counselor in the morning just to make sure that they're up and they're aware of which teachers they're checking in with that day. But again, a similar structure to the secondary at the high school level where they'll be meeting with their teacher of record on Zoom.
Ms. Mandrowski.
So thank you very much as well for being here and the presentation and everything that you all have done to bring our students back into school safely, warmly, and without a lot of, hopefully, as much fear and anxiety, or as little fear and anxiety as possible, because I know that's not an easy task. My 2 issues really were addressed by Ms. Evans and just now by Ms. Silvestre, so I just want to say that I know how hard you guys have been working to be versatile and resilient, and we need to do that, and that the board wants to do whatever we can to support you. So I'm very hopeful that you'll get extra support with the contact tracing and all of that kind of stuff. The extra work I know is a lot, but thank you for what you're doing.
Ms. O'Neill.
Yes, well, I too want to thank you all. I know that when you began your careers in MCPS, you never thought that contact tracing, quarantining, COVID-19 would become part of your everyday vocabulary and educational practices, and unfortunately, it is. I know you alluded to the kids, you've already had experience with kids who are in quarantine, but could each of you share what your total student enrollment is, and like right now, how many kids you have in quarantine? I know, it's a day by day, hour by hour, and it's sporadic throughout the county, but could you just share that so that anyone watching this just sort of has, from your snapshot of today?
So we have about 1,000 students at Loiterman. Since the start of last week, we have had about 24 students go home, but those are students who self-reported, went to the health room, didn't feel well. Of all of those students, they have all returned and they are all fine. Of the 24 students, there were about 6 students who were considered close contacts to some of those students, because again, at the middle school level, we're fortunate to have 7th and 8th graders, a lot of whom are vaccinated. And of those 6 students, they were all able to return as well, because the other students had tested negative. I think, again, the contact tracing piece is about having a lot of people on call every single day. So we have administrators on a rotation as a contact tracing point of contact, our health room point of contact, our attendance secretary, and then a counselor. So everyone's ready to go every time something comes up, so that there's immediate communication with families. Student is supplied with Zoom links if necessary. And then we have to cycle back through that list every single day to follow back up to make sure that we're not having students wait at home too long if someone has already been tested. So I mean, those are our numbers at the middle school level.
All right, so our enrollment is roughly 780 students. The first week of school, we actually started on day 2 with 4 students that were accessing the virtual instruction because the parents were responsible, did not send their students in. We currently have 6 students right now accessing the virtual curriculum, and that is 2 that did go home for quarantining, and we received one of the results today.
We have about 1,850 students right now. We began the school year, but even before the first day, with 4 students who reported that they needed to not attend school at this moment based on their current results. And then throughout the first week, we dealt with, I want to say, between 10 and 15 cases, but that number dropped based on the guidelines for closeness and students being able to return back to the building. But again, it's a little bit different on the secondary level, only because a lot of the students are vaccinated.
So I'm just going to ask a question. I know that if you had a wish list to make your life easier, so I'm assuming, assistance with contact tracing and communication and testing on site. Is there anything else that we could do or advocate for you to make your lives easier?
The 3 that you just named would make everybody's life easier. That'll do it. Yeah.
And thank you. And 3, please, through your PLCs, please share with your colleagues that we understand and appreciate the hard work and difficult circumstances that all of you are operating in. And thank you for making school almost normal.
And if I can just add, I know the 3 things are definitely important, but we have not been doing this by ourselves. Our directors, MCPS contacts, we call, we get answers, we get support with our colleagues and everyone. So while we sit here representing our schools, that has been one of the positives out of COVID, is that the collaboration is there. It has improved. So we don't sit here doing this work alone. If I call up and say, hey, help me understand, am I doing this correctly? There's always my director, Mr. Blinsky, there's people that we can call for that help.
Thank you. Dr. Daka.
Yeah, I just want to thank you for talking with us today and showing what it's like in the high school, the middle school, and the elementary school, because you are representative of the kinds of principals that we have. We couldn't have them all come here to talk about it, but they have made these changes. And I'm so glad you mentioned the directors and Carver personnel, because a lot of people think, well, they don't do anything, but it's not true. Well, they do. I'm sorry. I'm not trying to insult anybody, but that's what we do here. I know Ms. Wolf mentioned flexibility, and that's really what you've had to do, and the ingenuity with which you have done it. And I know that social emotional information is important, and the kinds of things you've done. Just simply having staff meet the students at the doors so that they know where they're supposed to be and what's going to happen. And I know that you're concerned about all the health protocols, so I won't even go into that. However, I had such a hard time, and I used to bother Ms. O'Neill, said, how are they going to do outdoor lunch? And you figured out a way to do it. Maybe not everybody is out at the same time, but some are, and they are able to be far enough apart. Even in the cafeteria, you're keeping them distancing. And we have had questions about distancing in the classroom. I know that everybody is at least 3 feet apart. So when I was talking about social emotional connections before content, that was one of the things I heard, and that you're using in the elementary school, Leader in Me, and we heard about that recently from Ms. Rubens. Thank the students also for sharing with us their perspective, because they're the ones that are really important to us every day. We want to be able to really reach them and to help them to adjust to all the things that are going on, and it's very hard. And the quarantine instruction, thank you for explaining how you do that. It's remarkable that the teachers that actually have the students are going to be able to interact with them through the viral situation. Thank you very much.
Thank you. Dr. McKnight, you wanted to make a statement?
Yes, I did. So first I want to say to our amazing principals, thank you, thank you, thank you. I know they are 3 out of the 209 that we have in our schools, but their voices do represent the complexities that they have had to work through. And I thank you for your honesty and sharing up front what's working, but what some of those challenges are. We will, in fact, still have challenges, but we have a commitment to prosper and work through them in our commitment to opening the school year. And the more we learn and hear from each other, the more we can figure out how to solve some of those problems. I did want to say, we have been hearing from our principals about contact tracing. Yes, they didn't, this was not a part of the job description. They have been doing significant amount of work around contact tracing. One of the parts of this that we had to clarify in our work with DHHS was to also be very clear about the roles. Who can help support that contact tracing component in Department of Health and Human Services that can help ease the load on our school principals so that they can continue to focus on instruction and the well-being of students and all those other priorities that they do have. But as a system, I know Dr. Nixon, actually, they can speak to this. We just posted a requisition because in our need and assessing the need at Central, we know that Heather Dublinsky has been a savior. I know to our schools in so many different ways. I'm not surprised that they're clapping, because she is, when they say answering the phone and saying, am I on the right track? Am I doing everything? And then Heather's also on the phone with DHHS. This is how we work through all of this. But we recognize that we need additional contact tracers. Not anything we thought we needed before, but we learn. So we have contact tracers that we are actually advertising to help support this work. Dr. Nixon, can you speak to that for just a moment, please?
Yep, certainly. So we did secure funding with our budget office. Thank you, Ms. Dawson. And so we did post a requisition yesterday afternoon, and HR is currently screening applicants for contact tracing. And once contact tracers have been identified and hired, they do have to complete a 7-hour module training through Johns Hopkins University on contact tracing, and then Ms. Dublinsky will have a cohort of contact tracers to also train and deploy to our schools for support on contact tracing.
It's a start. Again, we have a very large school system, but it's about starting, thinking about what we can do to improve these practices so that we can have our principals and our teachers and our staff doing the things that they need to do. And we'll continue to, again, learn and develop and figure out how we utilize our resources to help that. So thank you.
Okay, thank you very much. We really appreciate your taking your time to come here today and talk to us. And keep up the good work, because I know it's hard work, but we're here for you. Thank you. As soon as they come up. Okay, Dr. McKnight, you want to continue?
Yes, thank you, President Wolf. And so here we are on item number 7 to discuss the health contingency plan. If you could pull up the slide presentation, please. I'll just start by saying yesterday I sent out a communication to our community and to our staff to just address some of the growing concerns that we learned from the opening of schools. So I'll say again, it's been 18 months. It's a long time. And we did something that we had not done before, which was to open all of our schools at full capacity with students, with changes occurring with the pandemic. There was a lot that we learned that we are going to improve, but I do want to celebrate that the number of students that we quarantine, while that number represents a larger number than we like, it still represented around 1% or less than 1% of all the students we were able to bring back. And with that said, we celebrate that, but we quickly then move to what do we do to address the 1% that did have learning disrupted for them during the first week of school so that we can learn and make some adjustments moving forward. And so I thank you for being here today and having this conversation around our health contingency plan, because this is a conversation that we wanted to follow up from our last board meeting to talk more specifically about some areas. Yesterday in the communication, one of the purposes of sending it out was to clarify the information about the quarantine guidance, to share with our community. We did have guidance that came out on August 13th. It was, different. There were a number of things that were there in terms of how a decision had to be made for quarantining close contacts of a student who may have displayed COVID-19 symptoms. And then I also just emphasized that there were state agencies that constantly said and directed school systems to work very closely with their local health departments. That's what we do. As educators, we're navigating a pandemic, and we are not health experts. So we have to rely on the information from those health experts to guide us into how to then infuse and support the educational structure that we value and want to have in place. And so I do hope that that was clarified in that communication. And then the most important part about that communication was, what will we do as a result of what we learned last week? There were things that we didn't know we would learn from the first week of school, but we must always learn. That's what we ask of our students, that's what we ask of our teachers, and that's what we have to hold ourselves accountable for. And so as we went through this past week, we've learned a number of things. With DHHS staff, we want to be more specific about how we are utilizing that guidance to define who needs to be quarantined, and being very intentional about how we do that across 209 schools within MCPS with our staff. What is it that we can do, and what information do we need to have to help support the contact tracing process so that we are quarantining those students who it is necessary to quarantine? And what does that look like in how we implement our practices, and take into the consideration things that we want to improve and build upon, given that we are still in a pandemic. Having students participate in regular activities, but doing that in a way in which we are considering distancing. I told my son personally, when you go back to school, respect everybody's personal space, generally. And so those were two areas that we really focused on in terms of how do we emphasize these components with our staff to help reduce variability. And then the third was working with our local health officer and the county government and getting their testing kits into our health rooms. That can answer the question. If a student does have symptoms, are they impacted by COVID-19 or not? And so those are the measures that we have taken that I am positive will help us make a right step moving forward to reduce our quarantine numbers and to value having our students balance having our system do two things. One, protecting the health and safety of our students and staff, which is a priority, but also balancing that with ensuring that we're providing a focus on in-person learning instructional opportunities for our students, because that is what we have to do. So with that, today we're going to provide some specific updates about that quarantine guidance, and we're going to talk about that in more detail in this presentation. There could have been questions that came out after we shared some of the guidance, so we want to spend some time to talk about that. We've been working with our Health and Human Services Department, as we always have during this pandemic, and really taking into consideration how we want to make some preliminary plans related to implementation of hybrid instruction and what that looks like should the state direct us to do something that reduces capacity in buildings. And that's a really real circumstance that we have to prepare for. So we want to share with our community what our planning has been and continues to be around those areas. We're taking a number of proactive health and safety measures to mitigate COVID-19 transmission and our students in health and safety in buildings. We've already talked about them. We remain wearing masks. I saw for myself, our students and staff have been champions in wearing masks in our buildings and acknowledging that it is everyone's responsibility to do so to keep everyone safe. We are continuing to have our staff required to be vaccinated or submit to weekly testing. And we're also continuing to do the screening testing for our pre-K through 6 students. As I mentioned at our last board meeting, we will always assess and think about what we need to do more of. We know that not all of our students are vaccinated at the secondary level, which we would hope that that would be the case. So we are also planning now for how we want to extend our testing beyond pre-K through 6. So just wanting to be very transparent with the community, these are things that we are continuing to roll out and take into consideration how we keep our environment safe and healthy as we honor the in-person instructional environment that we've built this year. We've also made some upgrades to our HVAC systems over the past week, and we are taking advantage of outdoor spaces. Had a chance to walk around the buildings last week and see some real creativity. And the students, quite frankly, love being outdoors. I think we heard one mention it earlier. It's almost like a different dining experience for them that, you know, they all just look forward to having. So we really appreciate that. We're also taking additional steps to keep our students safe, and I want to announce, and we're excited about doing this, that we are requiring that all winter and spring sport athletes be vaccinated. So in preparation for our winter and spring sports, we are communicating now with our athletes who have interest that we are going to require that they are vaccinated to participate in those sports. Those are high contact sports, and everything that we can do to mitigate the spread of COVID-19, we want to be able to do that and take that into consideration in our extracurricular activities. So where COVID-19 cases do arise, I want to say we are prepared to swiftly respond and share more about our outlined protocols. Students who are in quarantine, as you just heard, our first priority is that they continue to receive instruction. That's what our commitment has been. I want to applaud our teams, our design teams, our teachers, our staff, our central office staff, principals, everyone who've contributed to that process, because coming out of last year and coming into this year, that was the priority. We knew that until this pandemic ended, students would be impacted, staff would be impacted, but we want to stay true to our commitment, which is, if that is the case and someone has to be quarantined, how can we still provide meaningful instruction to them? That's what we're in the business of, educating students. And so how do we do that given the circumstances that we have? So most importantly, we continue to gather feedback. I appreciate every comment that has been made, every email that has been sent. Those are emails that we read we consider and we take into our planning stages of how we then come back and share what we're doing to update and evaluate how we keep our students safe. So thank you. And at this time, I will turn it over to Mr. Blinsky to kick off our information regarding our health contingency plan.
Thank you so much, Dr. McKnight. Good afternoon, members of the board, colleagues, and community. Last week, we were so excited as we welcomed over 159,000 students back into our schools and buildings. But we also watched as COVID cases increased both locally and nationwide. On August 30th, Montgomery County reached 100 positive cases per 100,000 residents over the past 7 days, moving us into a high transmission rate, a level of transmission that we had not seen since February of 2021. Over the past week, numbers have started to decline, and we have moved down to substantial transmission with 82 cases per 100,000. As we face a rapidly spreading Delta variant, in order to keep our students, staff, and community safe, it was important to realign mitigation strategies to further reduce the spread and transmission of COVID-19. To this extent, Montgomery County is supporting the guidance and recommendations made by the health officer, DHHS, and our school health services partners to send home unvaccinated students or staff who have had close contact with an individual displaying any of the following COVID symptoms: a fever of 100.4 degrees or higher, a cough, sore throat, difficulty breathing, vomiting or diarrhea, new onset of severe headache, and new onset of loss of taste or smell. If a student is sent to the health or triage room with one of the previously listed symptoms, school health services nurse and health techs clinically assess the student and, based on their findings, communicate a recommendation to MCPS staff regarding the need for the student and any close contacts to quarantine, pending COVID-19 testing results of the symptomatic individual. Continuing to use the CDC definition of close contact, which defines close contact as being less than 3 feet in the classroom or less than 6 feet during lunch and outdoor time, for a total of 15 minutes during a 24-hour period, regardless of mask use. Unvaccinated close contacts are identified and sent home pending the COVID test results of the symptomatic student. If the symptomatic individual tests negative or has an alternate diagnosis from a medical provider, the close contacts may return, and the student that is ill can return once they feel better. In the absence of a test or alternate diagnosis, all close contacts must quarantine for the full 10-day period. The quarantine of students who are symptomatic, along with unvaccinated close contacts, is in addition to the previously communicated guidance around quarantining students and staff who have had direct contact with a COVID-19 positive individual, and has expanded the number of students in quarantine. Next slide, please. At the end of the first week of school, 1,781 students were home due to COVID-related absences. 44 students had confirmed positive tests for COVID-19, and 55 students were sent home with COVID-19 symptoms. Of those 55 symptomatic students, 15 later tested positive for COVID, while 10 of the students tested negative, and close contacts were able to resume in-person instruction. Results and information on the remaining symptomatic students is still pending. Of the remaining 1,682 students sent home due to close contact, 884, over half of the total students sent home, were placed into an official 10-day quarantine due to direct exposure with a confirmed case of COVID-19. While the total number of students in quarantine and isolation is only 1% of the total student population we welcomed back last week, we recognize the impact that quarantine and isolation has on students, and we are implementing the following strategies to quickly assess possible COVID cases in school. Next slide, please. Beginning as early as next week, school health rooms will have rapid tests available on site for school health service nurses and health techs to administer to students who are sent to the health or triage room with COVID symptoms during the school day. Free rapid tests have been made available at no cost from the Maryland State Department of Education, and we are thankful for our partners at Department of Health who will assist in administering the test at our on-site school locations.
In addition to this test we already have in stock, we have ordered an additional 1,000 boxes of 40 tests each, so over 40,000 tests will be available in school and ready to use. We are confident that when combined with our current mitigation strategies, that on-site tests administered by our health professionals will allow them to make quick recommendations to MCPS staff regarding isolation and quarantine. In addition to on-site rapid testing, MCPS has advertised for 10 additional contact tracers to support contact tracing efforts in school to ensure that only close contacts, as defined by the CDC, are being directed to quarantine. Together, these efforts keep students safe and allow in-person instruction to continue for the majority of our students in the manner that MCPS has committed. I will now introduce my colleague, Ms. Diane Morris, Associate Superintendent, to share instructional models for students who are home due to COVID-related isolation or quarantine.
Thank you, Ms. Dublinsky. Next slide, please. I'm going to provide an update on our quarantine instructional plan. On Friday, August 20th, all school administrators were provided with the instructional commitments that schools were expected to provide to families of individual students or whole classes in quarantine. At the elementary level, each school created a school-specific quarantine plan that identified a schedule inclusive of live instruction, independent work, and off-screen breaks. At the secondary level, school teams identified the available instructional period for all staff that could be provided to the students according to their schedule-specific instructors. Additionally, school well-being teams were integrated into quarantine plans in order to be available to support and assist students as they navigate the feelings and challenges around being placed in quarantine. Instructional schedules were collected on Friday, August 27th for all schools to ensure completion and readiness for the first day of school. As students are identified for quarantine, schools connect with families and work with them to set up a schedule that is inclusive of the instructional commitments that were provided to the Board of Education on August 24th. I want to applaud our principals and school teams for being ready to go on day one. Next slide, please. The quarantine instructional approaches were designed through ongoing collaborative work with principals and teachers. As a result of the new information and real-time data on the number of students assessing quarantine, additional stakeholder input is being collected. The focus of these conversations is intended to examine potential revisions to the implementation models for instructional access for students in quarantine. At this time, I'd like to turn it over to Mr. Greg Mullenhertz, principal at Ashburton Elementary, who will share his experiences implementing the quarantine plan during the first week of school.
Good afternoon, everyone. I'll start by saying that the three colleagues of mine that came first did most of the heavy lifting, so I will try to be additive here about the experience. My name is Greg Mullenholz, and I'm the proud principal of Ashburton Elementary School. I'm happy to be here with you today. I'm 1,000 times happier to be in my building, in person, 5 days a week with my students. I appreciate the opportunity to share with you the experience of what it looks like in the schoolhouse around quarantine and continuity of instruction at Ashburton Elementary. Across the county, schools like Ashburton are doing everything we can to keep our students in the building learning in person. I'm fortunate enough that I have a great team to support me, and I'm sharing my experience with you today based on the needs of my community, the staffing available to me, and my set of circumstances. All schools in the system have had similar challenges they faced regarding quarantine, contact tracing, staffing an individualized instructional model, pivoting a class in quarantine to a virtual model, and maintaining the in-person instructional model in just these first 6 days. And while each school has its own set of complex circumstances, what I share here today is what it looks like at Ashburton. We implement a lot of the universal precautions, including hand washing, hand sanitizing, universal masking, assigned seating in the classroom, on the carpet, in the cafeteria. You name it, we're probably assigning students to it. Right now, 50 to 60% of my students have lunch outdoors every single day. There are no plastic folding tables left at any of the Home Depots in the area. That's how we're pulling that off. We are doing everything we can to keep our students in the building, but there are situations that require quarantining of individual students or classes to ensure the health and safety of all of our students and our staff, and therefore their continued learning. Ashburton is one of the largest elementary schools at MCPS. In just the first 7 days of the school year, we have had 5 students who are confirmed positive for COVID-19. These students are currently quarantined, as are another dozen students who have been in direct contact with a confirmed positive case in their household or elsewhere. As a result of this, we currently have 2 classes in quarantine. We have 12 students receiving individualized instruction while in quarantine, separate from their class. In total, we currently have 65 students in quarantine. We also began the school year with 2 teachers in quarantine. In the first 6 days of the school year, school administrators at Ashburton have interacted with DHHS staff 54 times regarding symptomatic children. Each interaction requires a collaborative diagnosis of symptoms and a determination of next steps, which could include contact tracing and quarantine of students. And each interaction takes time. Principals and their administrative teams have become the consultants for the health room, the lead contact tracers, mapping out the movements of students and determining the possible direct contacts of those symptomatic for COVID-19. School administrators are also covering triage rooms or health rooms to support the efforts of our DHHS partners. Every sniffle, stomachache, and headache requires our attention because we cannot operate on the assumption that this is something else. We have to treat each case with the same protocol and the same intensity so that we do not miss something and end up quarantining students unnecessarily. Ashburton is set to welcome back some of those students currently in individual quarantine as early as Monday. One of our classes is returning tomorrow. We cannot wait to see them, but it seems as we bring students back, more are added to that individual quarantine list. It is quite the revolving door. Administrators and teachers are also constantly monitoring email, screening for parent communications regarding COVID exposures, symptoms, and general illnesses. We follow up, gather information from parents, and then coordinate with DHHS about next steps. I meet with my attendance secretary multiple times each day to review absences and determine the need to contact trace. When possible circumstances arise where quarantine may be the end result, we do contact Heather Dublinsky, who I assume does not sleep. She has been available to me on the phone as late as 10:30, 11 o'clock at night, as early as 5, 6 o'clock in the morning. She seems always at the ready. We coordinate with DHHS around evaluating student symptoms and contact and determining if quarantine is needed. Every single situation is evaluated on a case-by-case basis. In most cases thus far, the end result has been students entering individual quarantine and not whole class quarantine at Ashburton. When we do quarantine a class under the advisement of DHHS, school administrators contact every family by phone to explain the situation and provide them with guidance on picking up their student. School administrators and a counselor meet with the classroom teacher and then the students to explain what is about to happen. When we want to make sure that students are not frightened, that they are reassured that what we are doing is to keep them safe and to keep them learning. I often tell my students I have the easiest job in MCPS because I only have to do 2 things: make sure that they're safe and make sure that they're learning. And I've assured them that that doesn't end when we have to quarantine them. When a student goes into individual quarantine, meaning there's been no direct contact with classmates, they enter what we at Ashburton call the virtual learning lab. We wanted to give it a fun name for the kids to really make them feel comfortable with it. Here, students receive individualized support from school staff other than their teachers, with teachers in the virtual lab often supporting students across multiple grade levels simultaneously. The virtual lab is staffed by a rotating group of ESOL teachers, special educators, paraeducators, reading initiative teachers, the staff development teacher, and the reading specialist, who sign up for shifts that ideally do not conflict with their need to provide services and supports to students who are in person, who are learning virtually as a result of a whole class quarantine. On a day where the numbers of students in individual quarantine are low, it only requires 3 staff members to run the virtual learning lab. As cases have increased, we have contingencies in place to deploy as many as 9 staff members per day to make this happen. When a whole class is required to quarantine, the learning shifts to virtual and the teacher of record remains that virtual teacher. In the K-3 classes, the homeroom teacher teaches all the subjects. The art, music, and PE teachers teach those subjects virtually, and we have a schedule that really reflects the typical student day. However, in grades 4 or 5, because of the presence of multiple curriculums for both literacy and mathematics, where it would require 1 teacher in person to instruct those students, it requires up to 4 teachers to teach a section of in-person literacy, a section of in-person enriched literacy, a virtual section of literacy, and a virtual section of enriched literacy. In fact, today I was scheduled to cover a 5th grade virtual math class as a result of quarantine, but I'm here instead. Luckily, one of our special education teachers volunteered to teach that class for me, and the kids are probably better off for that. Thus far, we only have one upper grade class in quarantine, but if there were to be a second, the number of staff members required could be up to 8. So far, we've gotten by due to the phenomenal work of our team at Ashburton and the supports that we've received at Central Office. It is a team approach and school staff, between school staff and those folks over at DHHS. It has not been easy. Principals are exhausted and spend the majority of their days contact tracing, coordinating with the health room in DHHS, and communicating with parents. And we're happy to do so if it means we get to stay in the building, in person, 5 days a week. It should be noted that this is only the 7th day of the school year, but since day 1, we have been running 3 entirely unique academic programs. We support students in individual quarantine, those who have pivoted to virtual learning under a whole class quarantine, and those who are in person. The staffing available to make this happen is minimal in the elementary schools. And when we have to bring in non-classroom teachers to support individual quarantine, they are pulled from supporting the in-person or virtual students. With the increased staffing needed to provide outdoor lunch and still provide support of the classroom, we are being stretched thinner and thinner. As the needs increase, this will only get thinner. This also means that principals and administrators are stretched very thin. I do want to say that the Ashburton parent community has done a remarkable job in helping us with this. I want to express my sincere gratitude to all the families in my community and across MCPS who have done 2 very important things. Parents have kept students home when they are sick, and they have contacted our office to let us know of symptoms, onset of those symptoms, and the results of any COVID tests or possible exposures. In doing so, they have helped us to avoid the unnecessary quarantine of whole classes. Quarantine is not ideal for anyone, and I want to thank the community for doing their part to keep our students in the building and learning as much as possible. Quarantine is not entirely avoidable, but working together has enabled us to minimize the need for it. In at least 8 cases in the first few days of school, if that ill child had entered the school, it would likely have resulted in a whole class quarantine. Again, I want to thank the parents for contacting us and not sending their ill child. In closing, I want to again express my appreciation for all the support we've had at the school level. I want to express my appreciation for the upgrades that MCPS is proposing around testing. And I also want to express my appreciation for all of the teachers in my building and across the county who are working tirelessly to make this work. Because of the incredible work of our staff and those who support us, we are here, we are in the building, and we are learning. I'm now going to hand it over to Jeannie Dawson, Chief of Finance and Operations.
Thank you, Mr. Mullenholtz. Good afternoon, board members, Dr. McKnight, and colleagues. I'm very pleased to share with you more information about the launch of our COVID screening testing program. Through the partnership with the Maryland Department of Health, MCPS has selected Scion Diagnostics as our state-approved testing contractor to provide individual asymptomatic COVID testing for students in grades pre-K through 6. MCPS staff and our partners at Scion have worked to begin testing in schools next week, beginning Monday, September 13th. Scion will provide full end-to-end service, which includes providing testing supplies, staffing, testing teams, and processing samples through the pediatric low nasal PCR test. On August 27th, families of students in grades pre-K through 6 received messages announcing the testing program with links to online consent forms. Additional communications followed on August 28th and September 1st to families of students in these grades. System-wide community messages were also shared with Dr. McKnight's community update on September 3rd. And on September 7th, and as recently as yesterday, September 8th, in an effort to increase participation ahead of our September 8th deadline to enroll students for our first phase testing. As a Maryland Department of Health requirement, Scion recently started individual site assessments with each school. These site assessments must be completed before testing begins. In most cases, these assessments can be completed virtually, but some may require a site visit. The goal of the assessments are to provide and develop an individualized school test plan, which includes location of testing, time of day, and other logistics. Schools will be grouped into phases for our testing rollout. To launch our testing program next week, MCPS selected over 50 schools to implement phase 1 of our testing program. The schools were selected based on the current COVID rates in those school communities, the amount of consent forms received, and to ensure equitable representation of schools throughout our district. Principals of these schools were notified last week and started working with Scion on the site assessment this week. All schools with students in grades pre-K through 6 will be scheduled in subsequent phases so that all schools are tested weekly. Schools will also be scheduled for the same time and same window of time each week for consistency. Testing will be conducted by Scion teams in 3-hour morning and afternoon sessions. This will allow teams to conduct testing at multiple schools each morning and afternoon. As phases continue to roll out each week, the number of teams will increase, expanding the testing capacity to include all schools with students in pre-K through 6. In addition, we are prioritizing pre-K through 6. However, we will test the consented population at middle schools as much as possible, as long as it does not reduce capacity to test 6th grade or students that are unable to receive a vaccination. Further, lab results will be available within 24 to 36 hours after collection. Parents, school administrators, and select MCPS central office staff will receive notification of test results. In the case of positive test results, parents will be contacted directly by the school and contact tracing will begin. Next slide, please. MCPS continues to encourage families to opt into our testing program. As I mentioned earlier, over the last few weeks, through community updates, we've done social media posts, and the MCPS website, we've promoted and highlighted the testing program and for the online consent forms for parents. We launched a page on the MCPS website as a resource for families to learn about the testing program and to provide links to online consent forms. All of these resources and forms are available in multiple languages. We also provided hard copies to schools for anyone who is unable to complete the forms online. As of late yesterday, we had received 23,237 consent forms, more than almost 30% of the pre-K through 6 population. Our community outreach will continue with a focus on promoting the testing program to schools with lower returns on consent forms and also in culturally responsive ways. These outreach will include direct messaging from principals via email and ConnectEd. Translations have been done in 7 languages, pop-up shops, communication through our pupil personnel workers and school counselors, working with faith-based associations, community partners, and parent leaders, and other stakeholders involved in COVID mitigation efforts. We hope that information sharing and promotion coming from trusted individuals at the local level will help garner more participation, making our testing program even more effective to detect and limit the spread of the virus. It's important to note that we are not doing pool testing like as in the spring. This year, again, each test will be collected and testing individually with no minimum testing requirement per school. One of the advantages, again, of conducting individualized testing over pool testing is that it eliminates the unnecessary isolation and quarantine of students that would have resulted from pool testing. As more families opt in, Scion will work with schools to adjust the testing and consistent percentage of consenting students regularly. We anticipate testing 50% or more. In some populations, depending on the amounts, we can test 100% of consent. Scion will be able to test at all schools every week. Scion will also randomly select students through an algorithm that ensures the percentage is consistent and testing opportunities are equal for all consenting students at their school. Our plans are to ensure equal opportunities for testing all consenting students. Again, our priority is to keep schools open and ensure that students and staff are safe. Ms. Wolf, we now take the questions from the board at this time.
Thank you. I'm going to start with Ms. Evans.
Sure, thank you for all the information that we received. It sounds like we need more than just one Heather Dublinsky, so thank you for all the work that you're doing to support all of our schools. So my question, I'm gonna go to Principal Mullenholtz, because I think you answered my question that I had. It was about the triage room. So, and maybe this question isn't for you, so who should be manning the triage rooms? I heard you say that administrators are doing that. Is that who should be manning the triage room?
So I don't know if it's a question of who should be. It's right now who's able to. And our priority right now is that when we have a health tech or a nurse in the building, that their primary function is to oversee the students. They do, beyond everything COVID related, they're administering insulin, other medications. We've actually worked with our administrative team, our counselors and others to handle most of the day-to-day health room stuff, if you will. If we have a student in the triage room, but we simultaneously have a student in the health room because there are two separate spaces, the nurse can only be in one place or the other. So we've called upon school administrators and others to do that, primarily because we have to keep our teachers in the classroom teaching. We need our ESOL teachers, our special ed teachers, where they're supposed to be, so the rest of us are kind of manning the fort during that time, if you will.
Okay, so that's not under the purview of DHHS to have support or staff in the triage room? Because my thinking is, and so some of our nurses are in more than one school, correct? Right? So there could be a time when the health tech is the only person in the building, correct? So let's just say we have another student that comes to the room and it's not COVID related. Shouldn't we have people in the triage room that are specifically trained to be able to administer help and support? And maybe it's not a question for you, but this is something that we need to talk to DHHS about. I'm really concerned that administrators are in the triage room. So I'm not trying to dump on you. I'm just saying that it's fabulous that you all are managing and doing what you can do, but it concerns me that we have you all in that room in addition to doing the contact tracing. Are we providing training to our staff if they happen to be in that room? Or do you have additional medical equipment to be in contact with students that could possibly have COVID-19? It's just we should have other measurements in place, and I don't think that our staff should be in that room staffing that triage room. That bothers me, it really does. So that was the point of my question. I heard you say that, and that was a question of mine, but you triggered me to say, what are you doing in that room? We should not be in there.
Ms. Evans, if I can jump in, that's one of the topics that we have on our regular meetings with DHHS. We are engaged in regular conversations with them. We've now set up regular meetings in addition as follow-ups. The way that they have it set up ideally is that if there is only one health room staff member that's available at a designated time, their plan would be that that staff member would move to the triage room, and then whoever is a backup staff member that goes to the health room in a normal time, so at some schools it might be security, it might be a secretary, it might be other staff members, would then staff the health room at that time. Now, different schools are working out things in different ways because school staff members have gone so far above and beyond, to be able to make sure that we can have all students back in the building 5 days a week. And so obviously what Mr. Mullenholtz is talking about, he mentioned a number of things that he personally and other staff at Ashburton have done to go above and beyond, but that's one of the topics that we will continue to talk to DHHS about, especially since many schools just have one person at all times, and even with the schools have more than one, obviously one maybe at lunch at a designated time, and then there'll be only one person in the building.
Sure, and I'm assuming it's you because other people may not feel comfortable to do that. I mean, we can't force our staff to do that, so maybe somebody would offer to help to support in that way, but we would hate to put people in that position to have to do that. So thank you for your comments. They're very honest, and I know during this time it's very difficult to come up here and say what the real deal is for fear of the community coming down hard. But, you know, I heard Dr. Rubens mention earlier is that this is becoming a part of what we do. And as Dr. McKnight said, you're in the business to educate, not to do this work. And so we want you to be able to continue to do that. So just thank you all for coming and talking to us, because we do ask for the honest feedback and the comments. And sometimes there's some hesitancy, but we need to be able to advocate and to help and to do more. And we can't do that if we don't hear what's actually going on. So just thank you for that. And then Ms. Morris, we talked about, and then that's my last question, you gave the plan for elementary and secondary instruction. So for secondary schools, is it pretty similar to what we did when we were virtual, like asynchronous, pretty much like the check-in is just kind of make sure you don't need help or you're not falling behind, or if there's a question you have, you can do that during that time when you check in with your teacher?
Yeah, so at the high school level, at the secondary level rather, the schedules consist of, so students have access to the materials on Canvas, and the teachers provide their administrators with their periods where they would be available so that a student can access their teacher of record on during their period, so that if they need to provide some direct instruction or clarification about an assignment or a topic, that they're able to do that. At the elementary level, we have, as Mr. Mullenholtz mentioned, we have teachers who are fully released, like staff development, reading specialists, who are providing that direct instruction in reading and mathematics. We are currently working, as I shared, the numbers are higher than anticipated. And we've been working through the fall design team since last spring on all of these things. And so I have a group of elementary principals, I'm meeting with them again this afternoon, where we're looking at what could be an alternative to the current plan that utilizes staff in a more efficient way, so that we're able to handle this without holding their individual staffs, because they can't use them in other areas. So that's what we're currently working on, and working through a plan to ensure that everyone's needs are being met, and again, that we're using our resources efficiently across schools.
Yeah, this is so hard, because I think about in elementary school, you need your staff development at all levels. You need your reading specialists, your math content, and so the more help and support we can get to make certain that we're not overly quarantining our students, the easier it'll be on staff, because this is just hard. And I heard Principal Moses talk about she was supporting, you know, our students in quarantine, and that just should not be the case. So for our county officials that are looking or that are watching, we just really want to be able to work something out so that we can make this so much better than what it is for our employees. So thank you.
Ms. Harris.
Thank you. I just want to start out by saying all of these issues have been a source of a lot of anxiety and confusion in our community. I've been, like all my colleagues, hearing from many families and trying to track and organize their concerns. So I have a lot of questions. I don't know how you'd like me to handle that.
If you could ask 3 of them now, and then we'll come back around.
Okay. All right. Thank you. So I will start then. I have a question. When we are talking about communication with family in the school, and I've heard from some families that they are not clear on how they are to report a case. So it's a student got a positive test, they're not coming to school, so they don't know to who, I mean, many families are saying they don't know who in their school is their contact and how they're supposed to report that. They also are unclear, or some are not getting the resources to access virtual learning if they keep the student home versus families who get that information when the students are sent home. So are we being consistent across our schools with the point of contact for families who need to report, and making sure that a student who is kept home versus is sent home is getting all the necessary tools they need to access learning?
So as we shared, we needed to make sure that we started the school year with the appropriate infrastructure for the shift to happen. So one of the things that we put in place was that all teachers would utilize Canvas for their materials. As I shared, we also saw great benefit in utilizing the wellness teams at the school level. And so the expectation is that when a student is either placed in quarantine or kept home, that the wellness teams would be that touch point for the student. You raise a good point in terms of when a student is sent home versus when a parent keeps them home. We still would expect that they would notify the main office, and then it would trigger that wellness team to reach out to share the Zoom links for the virtual classroom and to provide the expectations. So almost in a way, many of our schools have utilized what they're calling a quarantine packet, if you will, of information. But we certainly can follow up to ensure that that is consistent. That was the expectation that was shared, but that the materials are available on Canvas, but I'm hearing making sure that we're really digging down to ensure that the contact is end-to-end and that there are clear expectations, so we can certainly loop back. But it's really critically important for parents, if they're keeping their child home and they think it's for an extended time due to symptoms, that they would contact the school or a positive case to say, we need to utilize this, what are the steps that then would trigger the response?
And if there's one thing that you would want families to know about, if they feel uncertain about how they're supposed to do that contact with the school, what do you want to say to all families right now? You have to, and thank our families for doing what we are asking everybody to do, is stay home if you're sick. So you have a student who's COVID positive, what do you want families to do? Who should
Call
they?
the school. Call
Just the regular
call
number?
The school. Yes.
Okay.
You could speak to the attendance secretary, you could ask for an administrator. The response should be the same from all of our schools that would trigger this conversation. As Greg shared, he's reviewing attendance data as the principal, so he's staying on top of that, but call the school, the main office number, and that should trigger the response and provide the information that parents need.
And same thing, if they're keeping their student home and when they make that call, do they also ask who do I talk to about getting my student connected to their virtual learning?
If they could just share their scenario, because we know it's different, and if in doubt, call. Okay. We're happy to work through that with families to help them kind of figure out what does this really look like, but we really need to make sure that that call happens so that it triggers all of the next steps, because we want to make sure that there's continuity and instruction and that they have access to materials as well as their instructors. So call for sure, main office.
May I interject something, Ms. Harris, please? So I just wanted to be clear that this is for students who are quarantining, but we are not using this plan for students who are just either at home for another illness or just a regular absence. So I just wanted to make sure that that part was out there.
Yeah, thank you. The next question I have goes to our quarantining protocols. As we all know, it's caused a lot of concern and anxiety among our families. And the question I guess I have, especially based on what you said, Mr. Mullenholz, I am unclear how, given the contact tracing guidelines and the definition of close contact, and I've done a lot of looking and studying on these questions, how a student being sent home with whatever symptoms they've distributed would throw an entire class into quarantine. Is this a reflection of just us not being absolutely certain about where that student spent their day and with whom and doing what? How is one student going home throwing whole classes into quarantine?
So, Ms. Harris, I'm happy to answer that question, and Mr. Mullenholz can supplement from his experience being in the school. So, remembering that the CDC close contact definition is less than 3 feet in a classroom, less than 6 feet during lunch or outside, for a total of 15 minutes during the day.
Right.
So that adds up very quickly, especially in our elementary schools, as we have welcomed back full classrooms. Many classrooms were not able to implement 3 feet distance between desks, and so students are sitting less than 3 feet within their groups in the classroom. Additionally, they may have center time where they're working together closely, circle and reading time where they're grouped together closely on a carpet in front of a teacher, time during lunch when we are not able to implement 6 feet at all times due to spacing capacity issues, and of course times at recess where they're playing together. Also including times on the bus that students may spend together. So that 15 minutes of close contact adds up extremely quickly. And so in many cases, especially at the elementary level, there are times when the classroom, every student in that classroom is identified as a close contact and needs to be sent home for safety.
It sounds like we're tightening up our procedures with our DHHS school health room staff around identifying students whose symptoms justify a quarantine. My question too is, in the breach, right now we do not have the capacity for in-school testing. So how are we supporting families in obtaining the COVID testing that they need to have, either to facilitate their own return to school and also the elimination of quarantine for large numbers of fellow students?
So any student that is sent to the health or triage room with COVID possible symptoms is assessed by the school nurse or health tech, and if it's determined that their symptom is not attributed to any other cause or illness, they are sent home with what is called an L4 form. And the L4 form defines for the parent exactly what steps need to be taken in order for the student to return. And in those materials is information about accessing COVID-19 testing through the county sites and other available sites. There are times when our families have not been able to access those sites easily, so we have worked closely with our Office of Student and Family Engagement, our PPWs, our parent community coordinators, to support transportation to get students and families to the testing site when we're able to. We are thankful for the on-site rapid testing that will occur and hope that will make it even easier to access, but we do encourage and counsel families who have students with symptoms to be able to access and go get their students tested as quickly as possible.
And then the families are to report or provide the test result to you in what format? What are they asked to do on the back end to get return to school or get their peers out of quarantine?
So the L4 form has, the instructions on either obtaining a negative COVID test or an alternate diagnosis by a doctor. The back side is for the doctor to complete, and so it needs to be signed by a doctor before a student can return. In the event a student is tested and it comes back positive, as Ms. Morris stated, we want parents to contact the front office and the school to inform them. But if they receive a negative test or an alternate diagnosis, that L4 form is returned to the front office or the health room upon the student's return, and then we can notify the rest of those contacts that they're able to come back into the classroom.
Okay, so we are really trying to support families. We've heard concerns that families simply aren't getting their students tested, with the result being whole classrooms having to remain in quarantine for the entire period of time. So we're trying to support those families in making sure they have the resources to get the test and they know the importance of and are supported in returning whatever information they need to the school.
Absolutely. We have seen some delays as there has been obviously this increase in cases over the past month, with longer wait times to process the test. So where we used to be able to get results even for a PCR in 2 to 3 days, we are seeing it take up to a week for the labs to process those results. So that is contributing to some of the longer times that students are out in quarantine. But our families, we are so thankful that they are, cooperating and getting students tested so we can safely have kids return to school if possible.
Yeah, thank you. It's a big job. And the last question I have at this point goes to our testing. So we are looking to operationalize and have available in our schools diagnostic testing. And then I guess what I'm wondering whether we have a plan in place, and this might go to you, Ms. Dawson or Dr. McKnight, to take advantage of the state's K-12 COVID-19 testing program, which supports schools including with a dedicated supply chain of tests to provide both in-health room diagnostic and PCR testing, which would obviate the need for our students to have to obtain that on their own.
Dawson, you can follow up, but absolutely, we definitely do have an interest in that. In our initial conversations with Department of Health and Human Services, we actually started out with they were going to provide the PCR test because we know that's where we get the most accurate data. But we also said, in order for us to protect and have a really good idea of protecting the interests of the students, but knowing if the symptoms really do mean there is a presence of COVID-19, the rapid test would serve that purpose. So we're actually so they still have the PCR test available to us as well as the rapid test. So that idea of getting the initial information and then the confirmation is exactly what we're looking to line up in this whole testing protocol.
Yeah, because I really have been through this document in great depth and detail and can't encourage this system enough to fully take advantage of this opportunity. I know these guidelines came out on June 30th because it is going to be a huge service to our students and families. And also, it's a secured supply chain, so the scramble that we've had, test kits, and also stability and what those tests are, saliva, nasal, which manufacturer, they're all different. So assisting our health room staff in not having to learn how to use a different kit this week than we did last month. It provides a lot of stability that I think is also very key in helping us to be very efficient. And yes.
Thank you for that, Ms. Harris. And Ms. Dawson, let's definitely look into that because what we learned about this pandemic is to have a set of testing kits and a number of other things for a long period of time is probably the best way for us to think about this, just not knowing exactly how much time we will need to test students, not knowing much longer we're going to be in the pandemic, if there's another variant coming or not. And so we're definitely interested in getting that and looking into that and figuring out how that may provide some consistency to our protocols that we're establishing now. So thank you.
Yeah, and I understand the Maryland Department of Health does specific every other week technical assistance calls for all the LEAs that are participating in their testing program that I've heard are they're very practical, very helpful, and lots of good guidance and support on an ongoing basis for the LEAs that are participating in the state program. So good resource for us.
Right, and I will add that is one of the things that we have talked to our vendor about adding is testing in all schools using this test, the PCR test, once we get it rolled out a little bit more to all of our students that are unvaccinated pre-K through 6.
Yeah.
So that is the next step as well, but I will look to that.
Yeah. Thank you.
Ms. O'Looney.
Yes, thank you. I first want to thank all of you and everyone behind the scenes who is putting in hard work and long hours to make this happen. My first question, I believe this will go to Ms. Dawson. So currently, when a student is notified of being close contact with a positive case or someone who has symptoms, that notification only goes to the parents, correct?
So in this testing program, each parent would get a result. If it is a negative result, they will have it sent directly to their email. The positive results will actually come to MCPS first so that we're able to call that parent and then begin a contact tracing process.
The reason I ask, I was wondering if it would be possible to maybe instruct or guide schools to contact students as well, because I'm thinking about students whose parents don't speak English, students whose parents have long or unpredictable work hours. I had a student contact me recently. She said she got a call from the school saying that she was in close contact, and the only reason she was able to understand that she needed to go into quarantine and get a test was because she was there to translate. So I'm thinking about students like that. I think it would be really helpful, just as an extra measure, to just send an email to a student.
I think I love the idea. I don't know about the privacy issues we'd have with that. The one thing is, because we're dealing with students that would be under 12 to start, but as we roll that out, we would be with our high school students as well. The other thing is that we do have translation. We have translation lines, and we're able to translate
for all parents when we're talking to them. So that would be part of our process, is to be able to translate to the parent in whatever language it is.
Even if it's just for the contact tracing element, I think it could be really helpful.
Okay.
A second question I have is actually something Ms. Silvestre brought up at our last meeting, and that is, do we have a target number for how many students we need opt-in consent forms from in order for our testing procedures to go as smoothly and be as accurate as possible? Is there a goal we have in mind?
100% would be our goal. Originally, when we were looking into this, and Maryland talks about it too, 10% or more. Now, 10% is not enough as far as we're concerned. So we are looking at about 50% really with our numbers currently. And in some schools, we'd be able to do 100% with the amount of consent forms. But again, we're really pushing out to our families and pushing out to increase the amount of forms that we have in every possible way. And, you know, we have to be culturally responsible to this because we've got such a wonderfully diverse community, and we need to use every avenue to reach our families. We are working with Ms. Rubin's department, and certainly with our school and family community partnerships, but also, with every partnership that we can reach, and with our PPWs and parent community coordinators. We really have to drive that home, because that's the only way we're going to increase the numbers. And our goal is to increase those numbers significantly so that we're able to really get the amount of testing that we need. So when we look at what is being currently said in the CDC and the vaccinations coming out for students, we're seeing October, November, it being introduced, and we don't know exactly when things will be firm in those areas. So until that happens, we need to make sure we're putting every effort forward to increase our numbers every day. And just like Dr. McKnight said, we are learning every day, and our goal is to get better every day. So any ideas that you have about outreach, because you've got some great ideas, we will take too, but know that we are pushing hard.
I appreciate that. Just hearing that 10% number and knowing we're above that is really helpful. Just one last thing, is there a timeline for when we can expand screening tests to the secondary level? And any idea of when that will happen?
So that's a great question. Originally, and as we're moving forward, we see really the beginning of October is when we can push to the high schools. We're trying to ensure that we're really getting to our under 12 population significantly. And like I said earlier, even though we have the 6th grade in the middle school level, if we have the capacity, we're not going to turn down grades 7 and 8. We will just include them naturally. We're including everybody every day. It's growing every day. So we will continue to do that.
I honestly think that we could start sending out those opt-in forms to secondary schools as early as now. Even if we aren't starting the testing program until October, it doesn't hurt to get a head start on opt-in numbers. So
Absolutely.
Thank you so much.
Dr. Daka.
Yeah. I just have a question about 82 per 100,000, 82 COVID cases per 100,000, and where do we get the 100,000? I mean, who are they?
So that is a Montgomery County metric for all of the residents in Montgomery County. That's how they determine the level of transmission within the county, is they look at the number of cases per 100,000 residents over the past 7 days. So right now we're about 82 cases per 100,000 residents in the past week, which puts us at a substantial transmission level.
Okay. And you also mentioned 1% of the total population, the total county population? Is that what you're saying? I don't know where, 1%, you did say that.
So I mentioned 1% as it related to the number of students that we had home in quarantine or isolation after our first week of school, which was 1% of the total number of students we brought back into buildings.
Okay, that's a good one, because we certainly have had questions about the whole classroom going out, or, you know, this is getting bigger and bigger. 1% out of 160,000 is really, you're doing a good job.
Ms. O'Neill.
Yes, well, 1% out of 160,000 may not seem like a lot, but if it's your child, that's a significant problem. And, you know, we've heard from parents not just about the lack of learning, principals and staff are working hard to have contingency plans in place, but, you know, there is the social engagement, the mental health issue, and also I really worry about children being at home alone because parents must go to work. So, you know, parents are very upset about our quarantine and isolation policy or rules, you know, that came down from the Department of Health and Human Services, that it is more strict than the CDC, more strict than the Maryland State Health Department guidance. How does it vary? I mean, you know, I do know that parents want their children safe, but, you know, it's sporadic, and I am really worried that as we move into October and we really start with the cold and flu season and even, you know, allergy season, hay fever, whatever, the issue about runny noses. I mean, young children, you know, I worked as a preschool teacher, they all had runny noses like almost all the time, you know, differentiating. But what is making the perception in our community that our restrictions are more onerous, more burdensome, more strict than sort of the gold standard of the CDC?
So one good piece of news is that a runny nose is no longer a reason to send students home for suspected COVID. So we are able to keep students with runny and stuffy noses in school. So the CDC, and I just want to read a bit directly from the definition of close contact from the CDC website. Close contact through proximity and duration of exposure. Someone who is within 6 feet of an infected person, laboratory confirmed or clinically compatible illness. So clinically compatible refers to individuals who have symptoms of that illness, even if they have not been officially diagnosed. So when the Maryland State Department of Health put out their guidance and put out a very clear decision aid for health departments and school systems to use in making decisions about quarantine and isolation, in the section regarding students who display symptoms but have no positive tests and no alternate diagnosis, they do not require students to quarantine until there's a confirmed positive test. Given the partnership that we have with our Department of Health and our health officer, it is important for us to work collaboratively with them and to take the guidance as the health professionals that they are. And given the transmission rate that we have been in the past few weeks and the number of students that we have that are not able to get vaccinated due to their age, it was felt that it was safest to prevent any further transmission of COVID by having those students who have had close contact with someone who is clinically compatible to go home pending the results of that symptomatic student. So that's the major difference, and Dr. Gales, in collaboration with Dr. McKnight, released information yesterday where he explained that the primary difference between his guidance and the state is that he recommends, based on our transmission rates and the number of unvaccinated children we have under 12, is that we have any close contacts of symptomatic individuals go home until we can definitively say that they were not in contact to someone that had COVID-19.
And just to clarify, if I can jump in, I'll read, there is a sentence in the letter that Dr. Gales had sent to Dr. McKnight that was linked in Dr. McKnight's communication yesterday that really summarizes what Ms. Dublinsky did a very good job explaining. The sentence reads, "Our guidance differs with the state guidance in only one area, what to do with students who have been in close contact with a symptomatic student who has no negative COVID-19 test result, no known COVID-19 contact history, and no alternative diagnosis to explain their symptoms."
Mrs. O'Neill, I did just want to clarify, because I was reading from the CDC definition. We know that there is an exemption for K-12 students within the classroom that defines their close contact within the classroom as less than 3 feet. But it is still having that contact with a laboratory confirmed or clinically compatible person of illness.
Thank you. I mean, I just felt we needed to put it out there clearly because, you know, there is a level of upset. And as I said, you know, my granddaughter this summer was exposed to COVID, tested negative on day 5, and the Fairfax County rules, she was still excluded from her camp for 14 days, and it created a problem for my daughter's work. And I know this is going to be a challenging time for our families. Everyone was so looking forward to 5 full days of instruction, and it is really something that we all have to worry about and work to try to keep our kids healthy and safe and in school. On the screening tests, I mean, I have to say 23,237 students who've opted in for that. I mean, that's probably, what, 12% of our students?
30 of the K-6.
30% of the K-6. You know, it's still, I mean, every test is, I view as a very important screening test. So, you know, we just have to continue to communicate, and I'm with Ms. O'Looney that I think it will be important as well for secondary students to be included, given that there are breakthrough cases occurring in the community in general. And the other thing is the process, if a child is sent to the health room, when the tests are available there for a screening, what is the process? They call the parent to see if they can be tested?
For the screening test?
In the health, you know, once we have the test in the health room.
For the rapid test?
Yes.
So if a student presents with COVID symptoms in the health or triage room, they will be clinically assessed by a school health services nurse or health tech. And the test, because it is a nasal swab, does require consent to administer that test. So students under age of consent, 18, their parents would be contacted by the school health professional, as they would any time when a student comes to the health room ill, saying your student is here presenting with symptoms. May I administer that test? And we're working with our partners and our general counsel to clarify how that consent will occur, so we can make sure that we are testing as many students who come into the health room with symptoms as possible.
Ms. Mandrowski.
So thank you all. Sorry, this is kind of getting a little long, but I appreciate your patience with all of our questions. So I'm not sure 100% of how I want to do this order, but a couple of things. First of all, in listening to our 2 elementary school principals, I'm curious as to whether or not you feel that it's, you know, I've loved hearing everything that you're doing, but as you mentioned, you know, you all are going so far above and beyond, everyone's already stretched thin. Do you feel that this is sustainable for the school year?
So I don't know that it's at this current rate that it would be. I, again, appreciate the recommendations that are being made about rapid testing, because I think that does relieve some of the burden there. I think as we get further into it, you know, Ms. O'Looney talked about adaptability earlier. You know, we as a system are going to have to be adaptable to the needs. Each school is in its own different set of circumstances in terms of the numbers of students that are in individual quarantine, the frequency with which a student may be accessing the health room. So I think in the long run, I don't know that the current pace very much is, but I also think that some of the changes that are being made at the system level are going to be helpful in that area.
Okay. Yeah, and I'm hopeful as well. So personally, I still think we should be an opt-out, and I know we've discussed this before instead of an opt-in, but I'm curious if you could just explain to me again why other areas are able to be opt-out and we can't.
Well, I'll start with the participation that we have to be in with the Maryland Department of Health. The grant program requires really in the state of Maryland for us to be an opt-in participation in order to be part of that process. In order for us to work with state-approved contractors, for them to provide the tests here without us going out to attempt to secure a private contractor in some way. The individual tests that we are doing, when we've priced that with outside contractors that still required opt-in, it was $100 per test for an individual. We were looking at almost, if we did every single student, it would be almost $850,000 a day to do a daily test. So we were still running into the aspect of doing opt-in, even for outside contractors. I know there was one system that was brought up, and they actually, because our local systems, including Prince George's County, Howard County, even Fairfax County, Baltimore City, Baltimore County, are all doing opt-in forms. The one system that was referenced earlier at a previous meeting, they actually aren't doing asymptomatic tests like we are. They're doing symptomatic tests and diagnostic tests. So it's a completely different structure for them.
Okay. So we have other forms that we send home at the beginning of school years and at the beginning of each school year. And for some reason, I feel like there are some things, and I don't know, maybe it's the vaccine thing just for kindergarten. Can't place exactly what I'm thinking of, but are we not able to say your kids will be quarantined if you don't check this box, even if it's just for them to return a nope, don't do it type of form? I guess what I'm trying to say is, if you want to have in-person learning, you fill in this form. And it doesn't necessarily mean that you have to fill it in saying that you're opting in, but you just have to respond.
Well, for the testing, it would be when a student comes to the health room, I would liken it to this. When a student comes to the health room and receives health services, we have to contact the parent.
Mm-hmm.
If we're going to give any kind of testing that would be health-related, you have to contact the parent. You have to get that permission first, especially when you're dealing with minors. But the way that we were also looking about this, and also for Ms. O'Neill, when we're talking about trying to get just more people opting in, when we look at different forms that we use, it's really, again, about the outreach and just helping people to work with online forms, as if we switched from our free and reduced price meals forms when we were doing everything hard copy and we made the switch. It took the outreach and schools working with us to reach out to parents. And we finally got that in such a great response, so where people are using online more. I really think this falls into that category where we have to reach out significantly more to our families to help people be able to do the online, to work with multiple languages. I just firmly believe that is what it will take in order to increase the numbers.
Ms. Dawson,
Yes.
if I might add.
Sure.
So, as Ms. Dawson has indicated, the state law is requiring us to obtain the opt-in permission from the parents. This law has been applied to the Maryland Department of Health vaccination testing program that we are participating in. I don't know of anything that would permit us to exclude a student from participating in in-person learning by not returning the opt-in form, if I understood your question correctly. I think that in the spring, when many jurisdictions still had the hybrid form and we weren't operating under the MSDE requirement that we have in-person instruction available for every student 5 days a week, I think that that was a strategy that was used, but now that the state MSDE has mandated that we are open for every student, I know of no basis that we could exclude students for not returning the forms.
Oh, okay. Well, then, I'm just curious, do we have like a biostatistician or somebody that we're working with to help determine what the sample size is that would be necessary to reduce the disruption of outbreaks and quarantining and things like that? I'm just curious, I'm asking mainly in terms of community's concerns about whether or not this 30%, which in likelihood is a majority of people who are already vaccinated because they've been able to go through the process and everything, do we feel that that's adequate?
Cyan Diagnostics is the company that we're using to implement the testing, and they are made up of a bunch of scientists, health experts, epidemiologists, laboratory experts. So they will be following scientific guidelines to make sure that we are testing accurate and sufficient percentages to identify cases and reduce transmission risk in schools.
Can I just ask a question following up on Rebecca's? Aren't we only using them in the elementary schools at this time to draw the sample?
Oh, so then they wouldn't be.
That's what I'm just asking you that. Is this Cyan Diagnostic? This is in the elementary schools. So none of these students are vaccinated, so I think that's what you were missing
Yes,
there.
right. So it's pre-K through 6th.
No, I understood that. I didn't think that she picked up.
Yeah, no, I
that
didn't.
None of
Thank you
them
for-
were.
Yeah, thank you for clarifying that. So my last thing, and this might sound like a big thing, but I know we've talked about it extensively, but everybody processes things differently, and I process with, if I ask you a question, and just a real short, like yes or no type of answers almost, but what are the changes that, because I keep thinking that I understand the changes that are being recommended and what it's gonna, but then somebody says something and I'm like, that doesn't sound like what I thought it was good. What's Monday gonna look like? So, I mean, we have rapid test kits currently, right? You mentioned something about 1,000 kits during the presentation. And we haven't been using them, so I'm just curious.
Heather, you want to?
We do have, Department of Health has rapid tests that they are going to make available to school health services, health rooms, and triage rooms. We have also ordered from the state an additional 1,000 boxes, and each box has 40 tests each, and those should arrive, late next week or early the week after. We've already confirmed that with the state to send us those tests. So what we are hoping to happen on Monday is that when a student goes to the triage room and presents with COVID symptoms, that they will be assessed by the health professional, the nurse or the health tech, and be administered a COVID test after receiving consent from the parent, so we can quickly determine if that student is positive or negative and make quarantine and isolation decisions based on that result.
Okay, but you're doing that as a rollout, not everybody's, it's not
Correct.
gonna be everywhere?
Yes, we wanted to say that because we won't have enough testing kits on Monday to be in every school. Our priority is to put them stocking our elementary schools first, of course, because those students represent our unvaccinated population, but then expanding to all of our secondary schools as well, just as, the other testing that we were saying we were expanding. So it absolutely will be a rollout. And what's important to note as we focus on this rollout is, I think Dr. Gales he did reference this in his letter, the training of the DHHS staff, to make sure that they are utilizing these tests and utilizing them in the circumstances is a part of what they are focusing on doing now so that we can be prepared for that next week. So I think next week really will be a part of rolling it out, and we'll see more of it being available in our elementary schools, as that is our first priority, but then expanding into secondary schools as we get more tests in. But we had to start with elementary.
Okay, and so once we do that, you'll do the rapid test, the kid comes back negative, nobody has to go home, right? I mean, so it just should eliminate a lot of this quarantining.
That is exactly the purpose.
I'm just trying to clarify, because.
That's right.
Okay.
If a student has a symptom, and we are unsure about what that symptom means, and there has been no exposure to COVID-19, that test comes back negative, then yes, at that point, we do not need to quarantine that student or others around them. Prior to us having the testing, then it truly is a guessing game or them having to independently test and then let us know. We'll be able to get that information immediately.
Okay, I think that's going to be huge for us, but then, so the other testing, the random testing, if you will, not pool testing, the random testing, that's just on top of in case you're just an asymptomatic person,
Yeah,
correct?
that's correct.
Okay, and so, and it's going to be more specified, so that way we know if it comes from a specific class and it's not like the whole, or a specific student?
Yes, it would be an individual specific student.
Okay. One question and follow-up to Ms. Olini's question about the outreach, the phone calls and stuff. What if you have a student whose family doesn't speak English and you leave a message for them on their machine and they don't know how to translate it? So you don't hear back from them.
If we know the language of the family, we are able to translate that directly to the message, and we would be
And we have that information.
leaving a message to say to call us back. Yes.
Okay. Okay. I think that's pretty much it. Like I said, I really just wanted to make sure I understood what the process is going to look like for Monday in terms of what we're doing. And I appreciate that they're doing the instruction for our healthcare workers and everybody in terms of, like, so for example, I have a lung issue, so I have diminished capacity for breathing. So this is, makes my heart pound a little harder and everything, trying to breathe like that. And I don't have COVID, so if somebody were to, if I were to go to the health room as a young person, I would be sent home, and it's just been very concerning that people are being misdiagnosed or whatever for the symptoms, because there are a lot of similar symptoms for other things.
Ms. Silvestri.
Well, I think everything's been asked. But, and I think Ms. Nadrowski kind of hit on the issue when public comments ended and I said, testing is coming and that's going to help with the quarantine. I think that her question kind of reiterated what to me is one of the most important takeaways of this meeting. So just for the viewing audience to get that message, bear with me here. And so if my neighbor asks me, what is MCPS doing to reduce the large numbers of children in quarantine, what do I tell her? We are going to start doing rapid testing so that, if you could, just so that the people who are watching right now can hear this, how we are going to slow down or eliminate this excessive quarantine and only quarantine the students that really, really need to be quarantined.
I can answer that, Ms. Silvestri. We are stocking our staff rooms with rapid testing kits. We're continuing with our individualized testing for pre-K to 6, and then we are planning for expansion of that into our secondary schools. And DHHS is working with their staff to determine all of the things that need to be considered in implementing this language around who needs to be quarantined and appropriate contact tracing as they adjust to the new language given out on the 13th. Within MCPS, we're doing the same. We're looking at our classroom practices. We're thinking about how we take consideration around distancing in our in-person experiences, and we're paying attention to who the students are who are interacting with one another. So if we do have to do contact tracing, if there is a positive case, now that we have tests, we can target specifically who is impacted so that we are not having to quarantine large groups of students.
I don't know if I can say that to my neighbor. I don't think she's going to follow all that. But this is what other districts have called test to stay, right? So we're testing students so that they can stay in school and not have to go home and quarantine. And if there is a positive case, and I'm a close contact, and I do have to quarantine, am I able to get tested 3 to 5 days after my exposure, be negative, and come back to school without doing the full quarantine?
Yes, and so that's the beauty in the testing kits within the school. If there's someone who is exposed, who is displaying symptoms, we can test them. If there's someone who's exposed, who's not displaying symptoms, yes, they can actually test on their own And when they're able to share that they are not COVID positive, they can return to school.
Dr. McKnight,
follow up that?
Can I just clarify one point?
Yes, please.
If an unvaccinated individual has been in close contact with someone who has a confirmed case of COVID, that person has tested positive on a COVID test, their close contacts that are unvaccinated do have to complete a full 10-day quarantine to reduce any further transmission based on their exposure.
You can't get tested to
come back early. At this time, it has been advised by our health department. The CDC still recommends a full 14-day quarantine. And again, these are individuals who have been directly exposed to someone who has COVID and they are not vaccinated. So they have been exposed. They could be carrying and produce symptoms of COVID anytime between 2 and 14 days of exposure. 14 days is still the safest amount of quarantine. We recognize the impact that had last year and reduced our quarantine period to 10 days. Further reducing it to 7 days has a substantial transmission risk between a 7 and 10-day quarantine, even with that negative test after day 5.
Thank you for clarifying that, Mr. Blinsky. That is for our unvaccinated population. And I appreciate you clarifying that because we are following 2 guidances. One for our vaccinated population and one for unvaccinated population. But thank you for clarifying that because that is particular to our students who are unvaccinated. And so there, and again, why you see the higher impact for our elementary students because that's our unvaccinated population.
And for the unvaccinated elementary school students, does masking have anything to do where the close contact is actually happening? It sounds like it doesn't.
So masking is only taken into consideration for students who are in a classroom setting if they were within 3 to 6 feet. So if students are 3 feet, 4 feet, 5 feet or more in the classroom and they're wearing a mask and one of them tests positive, that's not considered a close contact. If they're in the classroom and they're only 1 foot apart, 2 foot apart, or less than 6 feet during lunch and recess, if that time adds up to 15 minutes throughout the day, that's a close contact.
Okay.
And Ms. Sylvester, if I could just jump in to respond to something you had mentioned a moment ago about the test to stay. Test to stay means, has been used to mean a variety of different things, and obviously in this particular case, we're talking about potentially using that terminology test to stay when somebody has symptoms and takes a rapid test in the health room. I know that there's been a lot of discussion in emails regarding the Massachusetts program regarding test to stay, which in that particular context, the state is offering schools an option where students who have been exposed come into the school and get tested each day of their exposure. That is something we have discussed with our Department of Health and Human Services. That is not something our Department of Health and Human Services is recommending at this time, but we will continue discussions with them. Their primary concerns were that the students, based on their information on the program, were coming into the school building each day to be tested and potentially, then exposing other people when they came into the building if they took the bus to get there or other things. But it's a continuing conversation with our Department of Health and Human Services in terms of how we can do everything possible to, first and foremost, keep schools open 5 days a week safely and reduce the number of students who are in quarantine.
I just want you to restate for clarification, my clarification. You said that if a student is wearing a mask and comes in close contact with someone who tested positive, as long as they're wearing the mask, they're okay? Did I misunderstand that?
They're only okay if they're between 3 and 6 feet. If there is 15 or more minutes of contact at less than 3 feet, or combined with any contact of less than 6 feet at lunch or recess, regardless of mask wearing, that is considered close contact.
I'm just trying to understand how so many ended up in quarantine in elementary school if you had the mask on.
So when students are 1 to 2 feet apart, even if they're wearing a mask, if they're 1 to 2 feet apart, as they often are during centers and reading circles, that's close contact, even if they're wearing a mask, if it's more than 15 minutes, which adds up very quickly as we know our students are eager and excited to be back together.
Okay, thank you for that clarification. And I had one other question. You indicated that you were hiring contact tracers. Did I understand the number to be 10? is this going to be a centralized office type of effort? Because we have a lot of schools, so
Yes, it will be a centralized effort, but a centralized effort that is going out and working directly with schools. The best example is what you hear our principal say about Mr. Blinsky, but it's only one of her. So she's actually talking to all of these schools this regular, I think as Principal Mullenholt say, 6 o'clock, 9 o'clock at night. And so it basically is an effort to be able to create more of Mr. Blinsky's so that our schools have more access and they can get the information quickly as we manage this. So we'll be working, they will be centralized, but working with schools directly to help carry the load of some of the work that they're doing.
My last question is, and this is for Mr. DeAndrea. You had indicated that there would, maybe it wasn't you, but I wrote down there was only one deviation that we have, and that is how we're defining close contact. Well, it's that one deviation that's causing everybody to end up in quarantine. So what I'm trying to understand is, what are the other districts doing?
So across the country, there's a wide variety of different standards that are being applied in terms of quarantine. In the state of
You're in Maryland.
In the state of Maryland, there's the Maryland State Department of Health guidance, and then in this case, there's that one additional, piece that I read from Dr. Gale's letter. And so the State Department of Education encourages local school systems to follow the direction of their local health departments. And so we have consistently throughout the pandemic followed the guidance of the Montgomery County Department of Health and Human Services, which is using the guidance from the Maryland Department of Health and Maryland State Department of Education that came out on August 13th. But there's one piece, one deviation that they have said should be implemented, and they have worked with, obviously, the 209 school health rooms to recommend that across the school system.
Well, I understood that part of it.
Okay.
I was just trying to understand why we have one deviation and no one else does when that one deviation is causing the quarantine issue. And if we just decided that, we were going to accept the support and recommendations of the health department, that's okay too, but it's that one thing that's really resulting in the quarantine.
That one particular item definitely has resulted in a significant number of students in quarantine, because the state guidance says, if somebody has COVID-19 symptoms and there is no known exposure, then close contacts don't need to quarantine. In this case, our local health department, Department of Health and Human Services, said that they should quarantine if, based on their clinical analysis, there's not some other reason for that. Now, with having rapid tests available, that should have a significant impact. And so I think we will quickly start to see the impact of having rapid tests in health rooms on the overall quarantine numbers once those become available.
Well, yeah, I understood that could fix the problem. I was just trying to understand the problem. But my last question goes to the slide number 4. And I just want to understand the numbers on this. So, students sent home with COVID symptoms, 55. Positive cases, 44. Are those 44 in that 55?
No, those are separate.
Okay. Okay.
So
Okay. That's
44 cases were students who had taken a COVID test and had returned as positive. The 55 students were ones who were initially sent home with symptoms.
okay.
As stated, 15 of those 55 later tested positive. So we took immediate action, and 15 classrooms were prevented from being further exposed to COVID because we sent those students home when that individual had symptoms. There were 10 classes where the student tested negative, and we quickly brought all those classes back into the school, and the rest were still waiting on information.
Thank you. Ms. Harris, you had some further follow-up?
Thank you. And I think I'm going to ask first just for a couple of follow-ups. And one I think goes right to what Ms. Wolf was saying, and that is we were getting some recommendations from our health department. And as many of our colleagues and our constituents have noted, the guidance from Dr. Gales does differ from state guidance and CDC guidance when it comes to the definition of when somebody who's symptomatic and you're looking at identifying contacts. But also, Mr. Andrea, you just mentioned that you've already discussed the Massachusetts model of test to stay, which is a way of keeping kids in school by letting them take a rapid test every day if we know they've been exposed, as long as they're not symptomatic. And you said he's not recommending. So one of my follow-up requests is, can we make sure then that when we get these recommendations, that we get a justification that makes sense to us and that we can use to answer the questions of our community who deserve to understand why what we are choosing to follow as guidance from our health department is having the impacts that it is. Because I know a fair amount about public health and I have my own questions. So if we could just ask that verification, that justification, so we all understand the why and not just the what.
Definitely. If I might interject, if you don't mind. So in this particular case, you know, it's the start of a conversation. We will continue to have these conversations. But the justification that was given in our initial conversation was the concern about, based on their information about how it was working in various school systems in Massachusetts, was that the students would get themselves to school one way or another, take a test in the health room when they arrived at school, and the health department's concern was that ultimately the students are taking the bus or whatever other way, going in with other students in the morning, potentially exposing others if then they're about to go to the health room and then take a test that could end up being positive. So that was the justification that they gave, but that is something that we're going to continue to have conversations with DHHS about.
Because there's a workaround for something like that.
Mm-hmm.
And one of the other follow-ups is, I know we talked about, Ms. Dawson, you said you'd kind of look into this Maryland K-12 COVID-19 testing program. As I've reviewed it and done some digging, it does seem to be a soup to nuts to supply school health rooms with training and a steady supply chain of both PCR and rapid tests and all of the associated technical support on an ongoing basis. So could we, as a follow-up, get an understanding of, is this something that MCPS wants to take advantage of? And if not, why not? Not saying that everything works for every system, but it does seem to be a very comprehensive resource that's currently available to us, so we don't need to reinvent the wheel. And then the third follow-up goes to, we've gotten a lot of questions, and my colleagues have mentioned this, on what other systems are doing when it comes to testing, opt-out, and that sort of thing. And Ms. Williams, you mentioned that there's a Maryland law that requires consent regardless of the testing method. So one way I believe DC has gotten to opt out testing is they're using a non-invasive method. They're using saliva collection instead of nasal swabs. And indeed, we've had a lot of buzz about the Baltimore City program, which I think is more not so much an opt-out, but you must select to either be tested in the school or be tested somewhere else, and your ticket to school entry is a test. So you get it in the school or somewhere else. But would it be possible for us to get, for our information, a kind of a comparison of what other systems are doing, so we can see, answer questions of community, but also so for ourselves we can understand if there are maybe some things that we could adapt or learn from some of the other protocols that are being employed to get, because we've all said testing as many people as possible is one way to keep our schools safely operating.
Certainly, we can, am I on? Yes, certainly, we can provide that. Some of that information, we have spoken directly with the District of Columbia. I have, other members of Ms. Dawson's team have spoken directly with them. And let me speak to Baltimore City, because that's the easiest. Baltimore City is using the terminology opt-out differently. They're not running an opt-out program. And the language that they are using that said, if you wish to participate in the in-person, that started when we were in hybrid, when they had the option of telling the students, you have to stay virtual if you don't choose to opt in. So they're not doing anything really any differently than what we are doing here. And we have, I can provide some additional feedback to the board, but we have had direct communication with DC and have an understanding of what they're doing. They're operating, their age of consent, for one thing, is much lower than it is here in Maryland. And they are working with a provider who has agreed to not to assess the liability differently and therefore not require the opt-in. And so we can provide a more detailed analysis, but I assure you that we've had those conversations internally, and I'd be happy to provide additional information.
And I think another thing, I mean, a lot of people are urging us to look at these other options, but what I'm also equally interested in is, you know, they may look good on paper, but I want to know what's the operational side. So what is it?
Concerned with that we just, you know, in discussing the DC saliva approach.
Yeah, I mean, in Baltimore, if you haven't done your test and you didn't test at school, you didn't bring in a test, as somebody standing at the door and saying you can come in, you can come out. What we want to know what it looks like on the ground before we say this is a great option for us.
Right.
And then when we're talking about consent, and I'm wondering if, based on some of the conversation here, one hook to get more families to opt into testing is, as Mr. Glinsky, you said, somebody comes in the health room, we have the rapid testing capacity, they'll make a call to the family. But if you've already got consent on file, that would cover both if you're opting into this screening testing, but also if you show up in the health room, you need your rapid test. So am I correct that one consent should cover both forms of testing?
That's the position that we're taking, yes.
So maybe that's a hook. You know, if you want your kid to be able to get a rapid test if they get sick at school, sign this form. I think that might be helpful.
A great idea.
And then we're looking at expanding our screening testing comprehensively, as Ms. Smandrowski and other colleagues are saying. We're seeing a great deal of breakthrough. More testing is better, including all the way up K-12. I also, and this is just a concern, and maybe you can talk to the Scion folks about this, but I have concerns that maybe weekly's not enough when we're dealing with the Delta variant, which is about an average 4-day incubation period, which means that people are potentially infectious 2 days after exposure. So you could have a pretty big window of time there where somebody's infectious, but they haven't had a test. So again, I'm not an expert in that area, but maybe we could ask our Scion colleagues, is it even possible to do more frequent testing than weekly? Yeah, and I'm done. Thank you.
Okay, Dr. McKnight, do you want to continue?
Thank you so much to the team, Principal Mellenholtz, for taking time out of your day to come and present, and to MCPS team. So we're going to transition into the last few slides of this presentation. I'll invite Dr. Moran to come up, and this is on the hybrid model planning.
Oh, I know you're not going to tell me not to do this.
She said if you could ask it after the...
Huh?
She said if you could ask the question after the...
No, nobody else has had to do that.
Judy said,
Okay, I have to do this. I feel a need to do this. I was not trivializing the effect or the traumatic effect on parents when a child has COVID. I was trying to emphasize that the number is small here, but the newspapers and NBC in particular, I don't watch ABC and CBS, have said, oh, it's over 1,000 in Montgomery County, and how terrible it is, and it's a very negative kind of response. And it would be worse if our staff was not doing all the things they're doing, which are being criticized even today, about how strict we are and we're not doing what CDC says, and how do we have the right to do that. So I feel really strongly that I had to say that, and that's what I was trying to get at. Maybe I should have said all of those things before I said anything about the 1%.
thank you, Dr. Darker. Now, Dr. McKnight, you can continue.
All right, good afternoon, members of the Board of Education and Dr. McKnight. We've heard from Ms. Jeannie Dawson and Ms. Heather Dublinski about what we need to be prepared to do as we accommodate the ever-changing landscape. The introduction of a hybrid learning model that will successfully integrate the resources of MCPS, while acknowledging the requirements of students, staff, and community.
Thank you. I sound better. Thank you.
The introduction of a hybrid learning model that will successfully integrate the resources of MCPS while acknowledging the requirements of students, staff, and the community will be critical. I'd like to provide a discussion about how MCPS might be required to implement a hybrid model, what the components of that model would incorporate, and the criteria associated with the implementation of that model. Since the spring of 2020, we have engaged in an assessment of our implementation of hybrid learning. From the conclusion of last year, we have been preparing for a critical part of our contingency plan, the hybrid model. The implementation of this model will only occur if the Maryland State Department of Education determines we must shift to hybrid learning. However, it is critical that we engage in the planning and the preparation process to ensure we are ready to rapidly shift to hybrid should the state determine so. A key component of this planning process is establishing a deep understanding of the characteristics of each individual school. To understand the landscape for planning, we engaged in a strategic analysis of each of our 209 schools. This analysis included each school's student enrollment, classroom spaces, staffing resources, and in the 135 elementary schools, class sizes driven by system guidelines for Title I, focus, and non-focus schools. All of these pieces of data were examined through two potential reduced capacity ratios: 15 students to one teacher or 18 students to one teacher. This analysis also provided insight on the in-person rotations that would need to be used to fit the capacity limitations for our buildings. The analysis also reveals that to be able to support the model, schools would need to be flexible in reassigning students to teachers. To develop our recommended model, we have collaborated with a wide range of stakeholders, including SEIU, MCEA, and MCAP representatives. More specifically, teacher and principal representatives from the elementary, middle school, and high school levels. A key piece of their feedback was around the utilization of a 3-day, 2-day rotation versus an A-week, B-week rotation. A 3-day, 2-day rotation would be defined as an A group coming for in-person learning on every Monday and Tuesday, and a B group coming in on every Thursday and Friday. The groups would rotate back and forth, receiving in-person instruction on Wednesday. For A and B week, as you recall, they would alternate each week to receive in-person instruction. Next slide, please. On this slide is a comparison of the findings of our analysis of implementing a 15-to-1 student-to-teacher ratio versus an 18-to-1 student-to-teacher ratio at all 135 elementary schools. It is important to understand the unique characteristics of our elementary schools as a context for this analysis. I offer you our elementary student enrollment shifts from 134 students at one individual school to all the way to 900 students at one individual school. As you know, our elementary schools differ greatly, also in number of teaching spaces and class size guidelines. I want to emphasize the class size guidelines as they play a pivotal role in this analysis. In Title I and focus schools, in pre-kindergarten through grade 2, recommended class sizes are 18. In non-focus schools, in pre-kindergarten through grade 2, recommended class sizes are 24 at kindergarten and 25 at first and second grades. Next slide, please. Secondary schools can capitalize on the ability to use virtual learning to reduce by half the number of in-person students. School leadership teams would need to review the best ways to assign students to A and B rotations to ensure that across the master schedule, classes are at near half capacity to allow for more distancing during in-person participation. In our engagement with stakeholder groups, the feedback supports bringing students in 2 days a week on the A week and then 3 days a week on the B week for that group of students. This keeps students alternating between remote learning and in-person on a more frequent basis than the model we used last year, where students alternated by week. We anticipate using a combination of in-person instruction and virtual learning for students. A key tool to keep students connected to the daily instruction, regardless of if they are attending class virtually from home or if they are in person, is the Canvas platform. Our schools and teachers have developed a strong repertoire of utilizing Canvas for consistent communication and student engagement with the content. And teachers will be able to utilize in-person class time to provide individual support to students. Next slide, please. We know it is imperative that we consider the students that need to be prioritized for in-person instruction 5 days a week with a classroom teacher. The identification of these potential groups is grounded in not only the historical rationale for the benefits of them being in person, but also current achievement data. Listed first is all our students that receive special education services. This is followed by our ESOL Level 1 and Level 2 students at all 3 levels. We next will be potentially prioritizing students in our primary grade levels, given the necessary access due to developmental age and fundamental learning. This is followed by recognizing the importance of transition at our grade 6 and grade 9 students, ensuring that they are becoming acclimated to their new school buildings and provided with the social emotional support to successfully transition. And then finally, grade 12 students who are at risk of not graduating. At this time, Ms. Wolf, I turn to you and the board, and Dr. McKnight, for any questions or feedback.
Thank you. If you put your light on, if you have a question, I can call on you. Board members, if you have a question, put your light on. Ms. Silvestri?
I just want to reiterate that this plan would only take effect if the Maryland Department of Education mandates distancing guidelines, not the county, but only the state.
That's absolutely correct. And the purpose of engaging in the analysis early is last year, as you know, this took place in December, and as of August, we know what our schools are able to do and have begun to build out, the framework should we have to make this shift.
Ms. O'Neill?
Just a comment, piggybacking on Ms. Silvestri's remarks. Many of us were Girl Scouts at one point, and the motto is be prepared, and this is the be prepared, but God forbid. So
Correct.
Unless the MSDE tells us we have to do this, that's the God forbid.
Correct.
Thank you. Ms. Mandrowski?
I just too want to clarify, the 5 days per week in-person learning, each group on here that's listed on here would be given 5 days a week in-person learning
That's correct. That's what we are.
at each school.
Every school across all 3 levels, correct.
Thank you.
Ms. O'Looney?
Yeah, is there a reason there's a binary choice presented here of 15 and 1 and 18 and 1? Are these just illustrative examples, or are these like actually the options that we know will be presented with?
So that's a great question. One of the things that we're just looking at to start and build this framework is understanding that it would be we'd have to reduce capacity. We don't know specifically what physical distancing requirements might be put in place with hybrid learning, but what we do know is that when we look at our classroom square footage across the school system, and specifically in our primary grade levels, 18:1 gets us to 3 feet. So if we can get to 3 feet, just given what was just shared by Ms. Dawson and Mrs. Dublinsky, we know that that would eliminate the need to quarantine. 15 feet would take us to 4 feet. So those are the reasons that we ran those numbers. The other part is the historical context and the lessons learned of last year. We know that many of our buildings can accommodate 18 students in the primary grade levels just because of their much larger class spaces and get further distancing. And that was under 6 feet. So that's the significance of those 2 numbers. The other significance for you, Ms. O'Looney, is the fact that 18:1, and I think it's important we distinguish this when we talk about hybrid learning. 18:1 at our Title I and focus schools is their actual classroom guideline, right? So we're sticking with that guideline. They're at reduced class sizes already. And so at both those levels, they would then not be in hybrid learning. I think that's important to mention too. So when we talk about our primary grade levels, they're not being in hybrid learning. They're coming in 5 days a week in person. So it's important to distinguish that. The ratios would lie then in the intermediate grade levels.
Thank you so much.
You got it.
Thank you. Ms. Harris?
Yeah, thank you, Dr. Moran. Nice to see you. Just a couple questions. And I appreciate that we're sharing this now, because one of the things it emphasizes is this would be a plan required if we have to move back to really being very vigilant around social distancing. But social distancing is still a really good tool for us to be using as much as we possibly can in our schools. So when some of us were in schools and saw those lunchrooms and we're like, oh my goodness, social distancing, we should still be doing it as much as we can. One comment is, so the schools are working now to identify how they would use their space should this become necessary, and we are accommodating the whole groups that you mentioned, grade 6, grade 9, 5 days a week. So that's included in what the schools are doing right now, is how they would, because they wouldn't keep people coming in and going to their same classes because they wouldn't be social distancing.
So just to clarify, your question is, are they distancing already within?
No. Are they thinking now about how they would be reallocating the use of their space if this plan goes into effect? And we're looking at those whole grade levels, grade 6, grade 9.
So I would tell you right now that our leaders and our principals are outstanding, and one of the reasons they're outstanding is because they anticipate things, right?
Yeah.
And unfortunately, they anticipate things that would be as unfortunate as having to shift to hybrid learning. Many of them have already engaged in this work, and we have been meeting with all principals at the leadership levels that represent the different PLCs, and we'll be getting this in front of them in the next few weeks so that they can begin to brainstorm and think about, what we should do. This would also therefore eliminate the time lapse that took place last year in terms of having to shift to hybrid learning. We'd have a plan ready to go and be able to move rapidly.
Yeah, and I think that is so important. And getting to what Ms. Silvestri started out with, reemphasizing this is a plan in case we need it and we are informed that we must move to a more socially distanced method of operations in schools. So that gets me to, it's important, we've got these plans to, and I'm going to just suggest that we work really closely with our partners and our allies to communicate about this, because I think it's a tricky thing. You want people to know there's this plan in case, and we're ready in case, but you want to also avoid messaging that people who might not read the fine print or be paying as much attention because they're very busy, think when they see the message it means that we're doing this. Mm-hmm. And so working with our partners, our community organizations, our allies, and messaging this right so that people know we have a plan ready to go, and making sure that students know, for instance, what cohort they would be in, how that's going to be done in a school. Is it by alphabet? Is it however? But also in a way that ensures people that this is just a plan in case, and when they hear about it, it's not something that we are operationalizing.
It's a great feedback, and I think this presentation also is going to initiate those partnerships and utilizing them.
Yeah. Thank you. This is so important.
Thank you for coming in and presenting and getting us thinking about this quickly. So we're going to have a presentation on this again when? To follow
We'll bring it back in October 5th meeting.
Okay,
to
great.
follow up. Thank you so much,
thank
Dr.
you.
Moran.
At this time, we're going to go to break, and we will be on break until 4:45. We're now up to item 9. So I'm going to ask Dr. McKnight to proceed.
Thank you so much, President Wolf. Today we are going to present to you Facilities Management and Real Estate Strategic Plan. So I'm going to go ahead and just turn it over to Mr. Seth Adams so that he can begin our presentation. Thank you.
All right, thank you, President Wolf, members of the board, and Dr. McKnight. So we're here to change gears a little bit. I know this morning had a lot of conversations about current state, but for us, we also want to talk about future state as well. We certainly don't want to lose sight of where we are within our overall capital improvements program. So today, we want to start to share some of the ideas, concepts, strategic initiatives that we intend to implement as we move forward. With me today is Ms. Veronica Hill. She is the Director of Maintenance and Operations. And what I would say is Veronica and I have had the opportunity to come up through MCPS together. You know, when we first started, we would talk about the what ifs. You know, what can we do? What are the things that we can do to make Department of Facilities Management better? How can we impact the full school system? So I'm very excited today to have Veronica here with me to share some of the ideas that we would like to present from a facilities management perspective. So if we go to the next slide, I just want to frame this a bit for everyone. We actually have a great opportunity here to start thinking very differently about our facilities and our work around the built environment. You know, we have a perfect opportunity with Dr. McKnight as we start to think about Prosper and how that fits within the framework, maybe outside of the school setting, outside of the academic school setting, but realistically into that built environment setting. So what we're going to talk through today is really just to give a sort of a background of where we are, talk about our inventory, how we're going to take advantage of that, and then really start to talk about some of the regional focus areas, think through how we partner with other county agencies, how we start to think strategically about, you know, the county as a whole and where we as a school district fit within, you know, some of the initiatives that are out there. And obviously then start to really dive into some of these initiatives that, you know, we want to start to think about today as we start to enter into our CIP season. So next slide. So again, just to give a little bit of a background, you know, the infrastructure that exists. We obviously, we all know the number of schools. We talk about the number of schools that we have. We know, you know, what we have from a day-to-day school operation perspective. But we wanted to highlight the fact that we do have significant other inventory out there. We have inventory from infrastructure. You know, we have inventory that, you know, exists from a materials management standpoint. We have inventory that is in different places that is set up to support the schools and support families. And we have to acknowledge that. We have to acknowledge that exists, and we have to acknowledge that we certainly need to start thinking about that space a little differently as we move forward and start to take advantage of it in ways that we probably have not taken advantage of in the last 50 plus years. One of the things that we would also talk about is as we start to think about next steps, we all know the challenges with bus parking. We all know the challenges with our warehouse and storage facilities. We have to understand that. We have to acknowledge it and start to think about how do we resolve that. So next slide, please. And this is a powerful slide for me. While it doesn't necessarily, it's kind of hard to see, we wanted to show you just an idea of where some of these facilities are. Some of them are not in places where we'd want them to be, obviously, and then some of them are. You know, but the point of this is we have 450 acres of developable land out there. You know, whether that be your properties that the county owns or property that we own. We have buildings, 45 sites that have buildings on them, and we have 17 properties reserved. So when we start to think about everything from our community resources, we start to think about, and getting a little ahead of myself here, but we start to think about the blueprint. We start to think about different initiatives as a school district. We start thinking about our infrastructure. You know, this is space that we have to start thinking about. But as Veronica would say, and I'll turn it over to you.
So while this might feel like it's a lot of space, we have to acknowledge that many are not under our own ownership, and the majority of the closed schools have not received the attention, the care, and the funding needed to properly maintain them.
And that's going to be an important part of our conversation when we talk forward and from a funding standpoint. Next slide, please.
So again, diving into enrollment. Enrollment is always going to be a big part of our CIP and our conversations about how we approach this. What we do know is that, from a development standpoint, we know there's some hot pocket areas within the county that are going to be developed. We know that Bethesda will continue to develop. We know Clarksburg is going to continue to develop. Gaithersburg, Germantown, there's significant planning around those areas for homes and other development. Rockville, White Flint, Silver Spring, White Oak. These are all areas that you will start to see in the next several CIPs, plans for either new schools, additions, or other accommodations as we start to think about as families begin to move into these areas. One of the things that we also highlight, and this is more from a county data benchmark standpoint, but we will still see a growth in this county of population. They're predicting a growth of exceeding 1.2 million in 2045. So what we've seen over the last 10 years, 15 years has been an unprecedented 20% growth, but we still see in projecting 15% beyond that. And that's not small. I mean, that is not something that's taken lightly as a county, as a school district, as we think about what comes along with that growth. So we definitely wanted to put this up there and make sure we have this in the context. Next slide. Other areas, and again, this is, we heard a presentation from our MCA president this morning about the blueprint and about how we're going to start thinking about early education, how we're going to think about CTE, how we're going to think about special ed, how we're going to think about supporting families, ESOL families, differently. And that's all in the blueprint. And we are starting to think about that from a facility standpoint. So when we are starting to gather more facilities back from the county, you've seen facilities such as Parkside, you've seen conversations around Kensington Elementary, you've heard about some of these buildings that we intend to bring back into the school district, and we fully intend to start thinking about developing them into spaces to support the blueprint. We may be a bit ahead of some of the funding that may come from the state, but we can't afford to wait around. We need to prepare from a facility standpoint, because as that funding starts to come in from an operating standpoint, we need to be prepared. I don't think any one of us want to be in a place where we're saying, well, hopefully in the next year or two we can open up a school to support this. We need to be prepared for that. That is part of our planning moving forward. Next slide. And the other influence that we need to discuss is transportation. We're going to have a few other slides today. We're talking about Clarksburg. You're going to talk about some other functions that are possibly limiting. But we do know that transportation is going to be a big part of our county moving forward. Everything from when Purple Line comes on board, BRT, the 270 transit plan, Vision Zero, bicycle and pedestrian safety. How does that all fit into what we're going to do as a school district? Very, very important. It's going to be very important from when we start to think about boundary studies. It's going to be very important when we think about the schools of the future. It's going to be very important when we think about some of the programmatic functions that we start to bring to the forefront. And for us to partner with county transportation, to partner with the county and understand where these hubs will be and how we will take advantage of it is going to be a factor moving forward. Next slide. And again, when we think about where we are from a post-COVID perspective, the next few slides are going to be market trends. I talked about where we are as a almost like stars aligning for us as a facility group to think about spaces differently. Two things that are going to jump out are the residential market is definitely one that we have to pay attention to. I think we're well aware that we as a county fare better than most in the country from a residential housing. We also have to acknowledge that residential market is one of the key sectors in this county. And as that stands as a key sector, development will be a big part of the county initiatives, and with development again comes school capacity challenges and the need for us to think about facilities. The other piece I want to flag is the commercial industrial side. That obviously is sort of the opposite, right? So we're seeing trends where office markets are increasing. I know as a board you've seen initiatives come from the county about, hey, let's use office buildings for schools, let's do some of these sorts of initiatives. The fact remains though, that commercial and industrial functions are not schools, but we can take advantage of the fact that they are in decline and there are vacancies and that there are opportunities there. And that is what we're going to start highlighting in the next few slides. Again, just to show you some of the trends, this is again the population, completely understanding the fact that it is going to continue to grow. Next slide. And these are trends that we're pulling from publications that are out there. Next slide, please. But just essentially starting to show the supporting evidence of why now is the time for us to act differently when it comes to commercial buildings and industrial buildings and how that fits into our portfolio. Next slide. Another part of our work, again, I talked about this from the perspective of Veronica coming up to the school system and really thinking about the school district. You start to look at some of the history that we have as a school system, particularly from facilities. I would say there's definitely areas that we need to spend more time and focus on. We have to acknowledge the fact that we have facilities in our inventory that have historic significance. We have to acknowledge, as Veronica said, that we have a whole portfolio of buildings that have not received the care and attention that they so deserve. One such building is the one that we're in here today. Certainly, when we think about, the school district, we think about, even the building that we're in, what have we done to care for this building? What have we done to care for the history and understand and recognize the history of this building and treat it as such? So I think that significance is going to be important. And I'm going to turn it over to Veronica to talk through from a building, from a facilities management perspective, what this means and what are some of the opportunities that exist for us. Next slide.
Okay, so I'll walk you through the history of the first black high school in Montgomery County. Built in 1927, replaced in 1935 by Lincoln High School on Stone Street, then moving to its last site in 1950 as Carver Educational Services Building, which currently houses our superintendent and our Board of Education. The 1950s also included construction of 4 modern brick elementary schools. Over the last 70 years, Carver has transitioned to a primary central location for administrative functions. Maintaining this facility means working around restrictions as it is designated a local historic district. Over the past 5 years, the Division of Maintenance and Operations has responded to anywhere from 500 to 700 work orders per year just for this one facility. Next slide, please. So the school building holds, for me and for many, a critical symbolic relationship to education in buildings like Carver, which are right now considered to be some of the most endangered historic architectural structures. It's been stated that attending schools like a Rosenwald school in the past put a student at the vanguard of education for Southern African American children. The architecture of the schools was a tangible statement of statement of equality of all children, and their programming made them a focal point of community identity and aspirations. Our investments matter. It is important to recognize the significant role a building plays within the overall framework of a neighborhood and a community. So how does all of this fit into our current school system's PROSPER frameworks? We simply do it by applying and following our current core values.
Next slide, please. And I want to highlight what Veronica just said. Our investments matter, and we've talked about that before around neighborhoods, right? As a neighborhood, you drive by a school, you walk to a school, its condition represents the investment in that neighborhood. This building represents an investment in a community. And for us, our conversations over the years have we done what we can do to understand the significance? And it's easy to sit here and talk about it. It's a whole different story to talk about what are we going to do. That's one of our mottos in our office is less talky, more walky, right? So let's put these conversations into action and figure out what it is that we need to do. And again, next slide. Oh, I'm sorry, go back. I didn't know we already changed. When you think about it from the Prosper standpoint, there's three initiatives that really resonated with us. This Educate for Equity, reinvesting in our communities, reinvesting in a building like this, reinvesting in understanding the Lincoln Center, understanding the different facilities that we have in our portfolio that act as either offices, storage, or other functions. Does that make sense? Again, when I start to think about tying together, we have a commercial industry, you have an industrial industry in the county that has high vacancies, and we're still using historically relevant school buildings for those purposes. So does it make sense to start thinking differently? Again, allowing our funding decisions and actions to represent our commitments. Again, that portion of are we going to have this message, but what is the actions going to look like? Our CIP allows us that opportunity to start thinking differently about that. Renewing relationships. I heard this morning with MCA talking about the blueprint. For me, that's one of those opportunities, right? That's a relationship as a facilities management we have not necessarily fostered over the years. We have a lot of things in common in terms of how do we take our educational buildings to the next level? How do we serve our staff members who obviously serve our students? Primary goal is to serve our students, but along the way, these relationships matter. So for us, renewing those relationships, understanding that there's key stakeholders that exist that we need to continue to have conversations with, and there's a whole lot of other stakeholders that we have yet to communicate with that we need to start reaching out to. And then obviously the big one for us is plan for this future. We think about our work, we think about a sustainable future. A sustainable future means a lot of different things to a lot of different people, but for us, sustainability is going to be at the forefront. Understanding that our decisions are going to have lasting impacts on the students that we have in our system, and students have yet to come into our system. So thinking differently about things. And again, understanding our role as a school district in the economic development and prosperity of this county. That is a big part of our strategic plan, and making sure we align ourselves to take advantage of where we sit, from that perspective. Next slide. So again, talking through some very specific initiatives. We have facilities. We want to start thinking about creating early education centers. We want to start thinking differently about supporting our special education. We want to start thinking very differently about supporting our CTE programs. We know that there's areas of this county that we need to focus on, and within our initiatives and within our CIP, we want to start investing and preparing for that. We want to start transitioning our office functions to office buildings. Let's move office functions out of school buildings into vacant office buildings, and let's move school functions into the school buildings we have. To me, that is the most fundamental common approach. We can reinvest in our schools, we can reinvest in our programs, we can reinvest in our communities, simply by putting the right function in the buildings that we already have, and or take advantage of spaces that are vacant and readily available. Start thinking very differently about buildings like this. Can this building become a community center, a resource hub? Again, the blueprint, it talks about having resources for a variety of different families. You start to think about this also being the location of where the possible BRT intersection of Veers Mill and 355 transit will be. Those are all part of discussions, and I think this is a perfect example, a perfect building of how we start to layer over all the elements that we're talking about. The blueprint, our continuing the excellence that we have in a school district, building off of those elements that the county is ready to invest in from transit. It's all right here and perfect opportunity for us. We obviously have to focus on our infrastructure capacity around the bus fleet and warehouse and distribution. That will absolutely be part of our CIP. We hope that the bus fleet will be certainly shouldered, that burden shouldered a bit by the county, and we're going to continue to pursue that, but we will start to see movement on that. And a big one for me too, reinvesting in communities and create a historic preservation planning program. We do not have, at the moment, a historic preservation element within our portfolio. And to me, that is a very important one, to understand the significance and the relevance that we have in this county, and to start, again, to show the communities that we are prepared to invest in their community, in their neighborhood, in their culture of this county. One that you've all heard is P3 opportunities. We have a tremendous opportunity to start thinking about P3s, which are public-private partnerships. Those are opportunities where, you know, public economic development can fund different school elements. They can fund different school buildings. They can fund different aspects of our built environment, and that can be part of our portfolio. That is all part of economic development. It's all part of investing back into our business communities and being a true player in the overall economic development of the county. And the last one too is extremely important, but embrace these sustainable built environment initiatives and aggressively pursue a reduction in our carbon footprint. And through that, we will be pursuing a sustainability plan that we hope to bring to the board very soon. But that will be a big part of our 5-year goal, and one that we feel that is vitally important to our students. We want their students to be a big part of that plan, and for us, that is our opportunity to make a huge difference in this county and in this school district. So with that is the end of our presentation. I know there's sort of a lot there, and we went through quite a bit of material, but I did think it was very important for us to start foreshadowing some of our CIP discussions, and some of the things that you will start seeing on consent and you'll start seeing around policy is all part of our overall strategic plan. So with that, Ms. Wolf, we'll turn it back over to you for discussion and questions.
Okay, thank you. I'm going to start with Dr. Daka.
I know this is off the wall. This is a historic building, and I know all the concerns that you have, and that the hub is going to be nearby. Can we get windows for the cafeteria and room 100, well, section 100? I know. We have to deal with Rockville on that. But anyhow, think about it.
So that is a great question, Dr. Daka, in terms of the exterior of this building. You know, we have not invested in the exterior. It is historic, and it does involve an investment. One of the things that I would strongly say to this board is that, you know, some of our limitations to what we have been able to do in this building have been around the functions that exist in this building. You know, so for example, you know, we have an aging building that requires a significant amount of work. However, at the same time, we have critical functions in this building: board office work, we have superintendent office work, core chief office work that really allow little downtime to this building, little opportunity to close the building for months at a time to possibly invest and do some of the work that we were talking about. So as part of our initiative, as part of our plan, is again to start thinking very differently about this building, to start thinking differently about the functions in this building to allow us to make the investments that you referenced from an exterior perspective.
Ms. O'Neill.
Yes, I think it's important to have this strategic plan, to look at our closed schools, to look at some of the properties, the land that we own, because in my 20 plus years on the board, there have been times that I've thought, I wish boards had made other decisions. And I know we're going to talk about Woodward, but at one point in time, after Woodward was closed, it was eyed to be the police department in Bethesda, which they actually built a new police station in Bethesda. But, you know, you can't recreate land. And as the county continues to grow, you know, it is going to be important, and I totally am on board of moving office functions to office buildings. There's a glut of unused vacant office space, but really preserving opportunities for future boards so that they have the luxury of having choices to make and not having to scramble or say, if only that board had done X and Y.
I don't really have anything to add.
Go ahead, Ms. Mandrowski.
Sorry, I was going to say, I don't have much to add. I do appreciate the inventory, the look at the inventory. And it will be interesting to see what we can do with some of these buildings, like you were saying, in terms of making them more of an investment in the community than just being a building. So thank you for your work on this, and we'll keep going.
Thank you. Ms. Silvestri. Ms. Evans.
Yes, no, I was going to say thank you to Seth as well, Mr. Adams, for the review of our inventory. I don't know if everybody really know, the review of our real estate. I don't know if everybody knows what all we have and what we could do with that. I like the idea of possibly turning this space into like a community hub, right? This is sort of, I don't know if it's a central point, but it sounds like it could be easy for families to get to, whether they live up county or down county. So it would be great for our community to utilize this space in a different way, right? So this was just very helpful, and look forward to hearing what more we can do, and really how quickly we could change this space up. That's something that's doable for us. Yep. So thank you.
Ms. Harris.
Yeah, thank you. I'm really, thank you to see a kind of a strategic master plan coming out of facilities that is so comprehensive in scope and vision. Who we are, where we want to go, looking at the realistic needs of our system, and the focus on, let's build buildings that mean something, and let's take care of the buildings that kind of honor our past. So I guess the question I have is, given this new vision and the comprehensive nature of it, which means that it has impacts for everything else that the county does, when everything we're growing and developing and the transit ways, and it requires a true partnership between the school system and the county. And sometimes the relationship between facilities and the planning board and the county planners has been a little, fractious and contentious. And, in looking at this new vision, is this an opportunity for us to kind of hit that reset button and say, have this new comprehensive vision for what we want to do and how we want to do it, and let's work, together and collaboratively to make this vision real across the county. And maybe work more closely together on all of our projects. I think it tends to be more of a kind of a tag team. We do so much, and then we go to the planning, and they say what they want to say, and then our facilities folks go back, and it tends to be more one after the other, instead of a comprehensive work together, so that we kind of come to solutions at the same time. Big, long question to say, is this an opportunity to kind of restart that relationship?
Very much so, and we are looking forward to that conversation. One thing I would say is that some of the tension exists because of past planning practices, past zoning practices. We even talk about the blueprint. We've talked about the slides of very focused areas that have concentrated poverty. All that is not of a school district's doing, right? We are supporting those challenges. So for us, a big part of continuing that conversation and building that relationship back is having a deep understanding of how the Board of Education, how the school district fits within the county planning process. Where do we exist in understanding what the issues are, how we solve some of those challenges from a school district and how others can be partners in solving those. But also understanding that it's not an overnight fix. Also understanding that one zoning plan or one master plan does not change the past 100 years of zoning and development in this county. So we've done a lot of homework research of how to build relationships between school districts and planning boards. And that fact remains at the forefront, is that there has to be acknowledgement of what the challenges are, has to be acknowledgement of where we are headed as a school district, what our initiatives are moving forward. And then we can have some really deep conversations about how we fit into that, and how we can help influence, and how we can be a partner moving forward. But that truly has been missing, and we're hopeful that these types of initiatives will start to allow for greater, deeper conversations rather than just the onesie-twosie school sites that sometimes create contentious challenges.
Yeah. And I so appreciate that, because I think one of the things that's going to help is, the schools are an integral part of the county. And if we come together with a comprehensive vision, planning, sustainability, schools, and how we all work together to achieve that, I think it might ease some of those tensions, especially as we're coming to work together more. And one other question I had, so you talked a lot about historic properties in our inventory. So, and I don't want to get too far ahead, but are we looking at potentially looking to treat those historic properties as historic properties and do some restoration?
Yes, very much so. That is a big part of any community, is the history and respecting that history through architecture and the built environment, and that's what we intend to put forward as a key initiative.
Okay. All right, thank you.
Ms. O'Looney.
Thank you so much for the informative and comprehensive presentation. In terms of this building, it's really incredible that we get to be surrounded with our history all the time, but at the end of the day, if the business that we're doing here is ultimately degrading or not helping the historic preservation of this building, then I think we should rethink what we're doing. So I appreciated all the insight. Thank you.
I too want to add my thanks for the presentation, and I'm glad to see that you really thought about how to incorporate some of the history of this county into this strategic plan, because I think so much of history has already been lost in this county. So I'm very glad to see this. I'm also glad to see that the Northeast Consortium is on the list for an early childhood center. I never miss an opportunity to remind you of our needs in that part of the county also. So thank you, and we look forward to seeing some of this implemented soon.
Thank you very much.
Anybody else have any further questions? No, thank you. Okay, let's see. We are at item number 10, Dr. McKnight.
Thank you, President Wolf. So today we are going to come back to the board and talk about a project update as it relates to Woodward High School reopening project. We've been talking about this project for a while now, and given some of the changes that have occurred over the past year, Mr. Adams and the team will just talk through some things that we are need to share with you as it relates to the update on that project and some considerations. Mr. Adams, I'll turn it over to you.
Yes, thank you again. Hopefully you don't get tired of me. I think this is the second of 3 presentations. So, but yes, we wanted to bring back the Woodward High School project for the next round of conversation. This is obviously, as everyone knows, this is a critical project for both the Down County Consortium, for WJ, and then the school district as a whole, as we start to think about programming and what ultimately, what students attend this building. One important aspect of our work is understanding where we are in a construction market and understanding where we are as it relates to the state of Maryland, MSDE, where our funding exists with the Board of Public Works and the IAC. This project is one that, unfortunately, it is being built at one of the highest construction market times ever. So with that, we've understand the critical nature of the timeline, and we've had to make some very tough decisions around value engineering, around making sure we maximize state contributions, making sure that there is very, or there's great efforts to maximize every dollar spent. Not that we don't do that on every project, but when you're in a situation where you may be short $20 million on the project, you have to obviously look at it very differently than what we have in the past. So with me today, I have Shiho Shabosky, who is our school architect, who also was the project manager at the beginning of this project. She has very intimate knowledge of where we are, and she's going to help walk us through some of the changes and challenges, and just to give you an update of where we are. And ultimately, at the end, look for your approval to move forward with the project as we're presenting today. So next slide. So again, just to give you a little bit of background, this is a phased building. So phase one, just to remind everyone, is the construction of the heart of the building. It's the primary aspect of classrooms. Just to remind everyone, we did design and build this with an arts infusion model, so it's going to look differently. But ultimately, phase one is to allow Northwood to reside in this building as a holding facility while we build Northwood. So phase two ultimately is that next level of work, which we will start with community meetings very shortly. And we will come back from a CIP perspective to look for funding for phase two. But phase one is what we're talking about today, and from a change perspective. Next slide. Again, I'll just go very briefly over this. We have continued to have community engagement. We are meeting regularly with neighbors. We're meeting regularly with parents. We're conducting larger community meetings. Obviously, a school of this magnitude, everyone has a stake. Everyone has, objective, and our goal is to balance those objectives and really come up with a good compromise that works with parents, staff, neighbors, and the community as a whole. So this engagement has been pretty exhaustive, and it's going to continue for the foreseeable future, but just wanted to give a little bit of update. I know you've heard some emails from neighbors about the work that's already started, and we are meeting with neighbors. We're also having larger meetings to update and just to provide these frequent touch points along the way. Next slide. And I'm just going to say a few things, and I'm going to turn it over to Shiho to walk us through. But just to remind everyone, phase one was intended to focus on the building. It's intended to provide the amenities needed for Northwood, but it does not include that phase two work, which is our athletics, our stadium, some of the arts elements that we want to build, and an auxiliary gym. That phase two work, where you see on these slides temporary fields, is going to be part of our continuous conversation around community engagement. So I don't want anyone to see temporary fields and think that we're not going to build permanent athletic facilities. We just needed to show from a phase one perspective where we left the project with you all from a design standpoint, and then as Shiho starts to walk through, showing you what we've ultimately had to peel back a little bit from this project as a whole in order to stay within affordability. So with that, I'll turn it over to Shiho, and we can jump to the next slide.
Hi, so for the updated plan, we have to remove the two structural bays, which means one bay is about 25 feet, and then we are removing about 50 feet of the building in the center of the building portion. And then so by doing that, we are reducing about 36,000 square feet of the building area, and then the student capacity will be 2160.
So that's important. We are recommending a reduction of student capacity from 2,700 to 2,160. This 2,160 is that sweet spot with the state in terms of their cost share. We've gone back and looked at our enrollment projections. Yet again, that's a constant process. And we feel this is a good number in terms of phase one. Does not preclude us from building more capacity in phase two or building future, But that was a core function of this value engineering, was to reduce the capacity from 2,700 to 2160. And obviously, as Chiho has described, the structural and changes that have come along with that. So we're going to walk you through floor by floor what that has looked like, just so that the full transparency, you know exactly what we're talking about. Next slide, please.
And then, so this image is you are seeing from the old Georgetown Road side, and then the right side is actually the south side of the site. And we are not moving that south side of the building, and then you see the red bar, two red bars, and that's each one is 25 feet, and we are removing those sections, and then squeeze the north side of the building toward the south side. So we will have more space on the north side of the building for the future addition if it's necessary. Next slide, please. So this is the view from the field side. Again, 2 bars is the structural base, and we are moving the north side. Next slide, please. And so this is the ground floor of the building, and the right side is the north, actually, and then there is a gymnasium on the north side, and then south side is a dining area. And we are not touching the north side or south side, but we are removing the middle portion of the building. So actually the courtyard became smaller, but we still have a same size of the dining area and gymnasium, and you will see the upper floor for the media center, which we are not touching. So for the core capacity will be 2,700, again, for the future. Next slide, please. And then, so this is the first floor, and the west side, which is the upper image. There is a main entrance on the northwest side, and then the left side is a bus loop entrance. And the pink area is a fine arts, and the green area is a classroom areas. And we are trying to blend in all different programs into different portion of the building, but kind of blend in throughout the building. So those programs are kind of mixing in the building. Next slide, please. So this is the second floor, and the north side, there is a large media center, and again, like pink, green, and the light green areas, they are all like mixing throughout the building. Next slide, please. And so this is the third floor. Again, so all the classrooms and the supporting areas are all like scattered throughout the building. Next slide, please.
So again, to reiterate, and the reason why that we need to show this presentation to the board is there's 4 resolutions that will be in consent. You know, this reduction in square footage, as you can see, has been very thoughtful. It's amazing what the team has been able to do in a short amount of time, but they preserve the ability for us to grow this building to that full 2,700, but have reduced it in a way that has pulled out certain classrooms that would essentially add up from an educational specification to that 2160 number. You know, what's going to be important in that conversation is, even with that significant reduction in square footage, we still are asking for a supplemental appropriation for this project that will be part of the consent items. So I just want to stress to you that this was not done in a way that was thoughtless. This was done in a way to be able to continue forward with this project, because we know it's a critical project, but done in a way that preserves our ability to still do everything that we've talked about in the past in the future, should that funding exist. So again, from a where we stand perspective, you have a resolution and consent that would award the contract to allow us to move forward and meet our completion date, but it is based on the reduced scale and design that we're showing here. We have started that conversation with the community around this reduction, and so far there have been very little concerns other than making sure that they understand and are a part of that phase 2 conversation. And and everyone certainly understands that during phase 2, if there's strong advocacy to build more capacity, that opportunity exists. But in order to continue the project on its same construction track, this is unfortunately what we have to present today. But the beauty of it is the same architecture exists, the same positive elements that we've incorporated over the course of the design all exist. All we're doing is strategically pulling out classrooms, which ultimately reduces square footage and ultimately reduces that capacity number. Next slide. So again, just to reiterate, we will be back on this project. I think we've presented 4 or 5 times, and we will have many more to come. But unfortunately, this presentation and a resolution to allow us to continue is the one that we're presenting today in order to keep the project on its schedule, but at this reduced capacity. And I know that's a lot to show and a lot to present in a short amount of time, but as the Director of Facilities, I'm strongly supportive of this approach. Again, I think that completion date is critical, and we will have a building and capacity and program that's going to meet the needs of our students and our communities. It's just really acknowledging the state of where we are in a construction market and a state of Maryland cost sharing scenario. We're trying to optimize everything in order to move forward. So with that, we will turn it back over to you, Ms. Wolf, for any questions and conversation about the resolution.
Thank you. Does anybody have any questions? Ms. O'Neill?
Yeah, so, I mean, my question is related to we're reducing the capacity to 2,100. It's got to meet the needs of Northwood for the years that it's there, and then for the greater Bethesda community, Walter Johnson, and whatever other areas it pulls from. I mean, does 2,100 fit the need of Northwood, or will Northwood need portables on this site?
No, we have also been very conscious of Northwood and understanding its capacity, and what we are showing here is the ability for Northwood to go into this building seamlessly. We still have to talk through fitting out very specific classrooms for Northwood while they're there. We talked about the dance studio and other functions of Northwood. But as it stands right now, and as projections show, Northwood can move in certainly with no portables at this capacity.
And I know there's a lot of concern with the neighbors, and I know you were meeting with them. I mean, they've continually had concerns about stadium or no stadium, but also about the tennis courts and basketball courts and all of the athletic stuff. So, I mean, is that resolved with the neighbors or not? And I know they're not on the same page necessarily as the PTA. So I realize that's a conversation in phase 2, but it is still a conversation that's happening right now.
Absolutely, and you are correct. The work of phase 1 did and does include tennis courts and the 1.5 basketball courts that you've seen as concerns from the neighbors. What we have said is that, we certainly are still open to modifying and massaging this design through phase 2. What is yet to be determined is our ability to take advantage of that Edson Lane property. There's no resolution on our ability to encroach potentially on that property, and that will determine the final layout of the fields. And what we have said is that final layout will determine a lot of our potential and opportunities to move things around and to try to find ideal state. But you are correct. On one side of the site, neighbors may not want or desire basketball courts, but if you move to the other, it's the same feeling from those neighbors. So trying to find a space that makes sense for everyone is going to be part of that phase 2 discussion, working within the constraints that were presented.
Ms. Mandrowski?
Yeah, just a quick question. I'm assuming the intention is still that this will be a school of performing arts, kind of like the Magnet High School. And in listening to what you're saying, my concern was about the reduction of like the black box and the reduction of the things that are going to make that school be, the premier place for those students to go. It sounds like you can add this stuff back in later if it's available or possible. But things like the black box and stuff like that, have you talked to the community? I don't know how you would, once that's done, isn't it just done?
Well, so a big part of phase 2 is this vision of the fine performing arts program differently than what we have currently. So, building off the momentum, and it was great to hear the positive feedback on Loiterman, but building off that momentum of, you can have spaces that serve multiple purposes, and help a program thrive. So that conversation is going to continue. Really, what we're talking about here is just the reduction in the size of a black box. And I know we've had a lot of conversations about black boxes over the course of many years, but we are not reducing it to a size that's not usable or functional. We're essentially just reducing it in square footage and thinking about how we then create more flexible square footage in the phase 2 work. So I know when people hear reduction in size of black box or reduction in size of performing an art space, they sometimes raise flags and nervousness, but I know we had lots of conversation on Loiterman, and I think we've proven that we can build really functional spaces that are very flexible, and that's what we intend to do. So yes, it's a reduction in size, but it will still maintain its ability to function that we started out with.
Okay, I wasn't worried about it not being able to be functional. I was more just, the classrooms are something we can put in as an addition, but I just don't want to see any aspect of what's going to make it the location that we're intending for it to be diminished. And when something like a theater or whatever it might be is built, it's hard to, unless you build a whole new one, to add on. So I just wanted to make sure that that the arts community and whatever was good with what we're doing.
100% agree, and I would also add, Shiho was the sort of the mastermind behind the Loiterman space, so we're in good hands when it comes to performing arts spaces, and she has given it her stamp of approval as well, so I feel good about it as well.
Okay, Ms. Silvestri.
Your question sparked a question from me. The program has been decided for the school? There will be a magnet there?
No, I think we're a little ahead of ourselves in saying that it's a magnet, but there's an arts infusion concept that's there, and we're really excited at the next meeting to bring back the curriculum folks that will share the vision for that space. But we've been saying all along, terminology is very important with this particular project. So, magnets and other terminology that we're used to is not necessarily the case here. But I don't want to speak for my curriculum, colleagues, but they are prepared to come back and talk to the board about the vision. Absolutely.
Ms. O'Looney.
Yeah, I just had a quick question on whether this and the changes that have been made are going to affect the timeline. I know the original plan was to have Woodward open in 2023 for Northwood students and then open as its own school in 25. Is that still the plan?
Assuming the board approves the consent item for contract, absolutely.
Thank you.
That is the goal, yes.
Ms. Harris.
Yes, thank you. I really do appreciate the attempt to really bring what we're trying to do into alignment with our fiscal landscape here. So I'm just going to ask a question kind of on the bottom line side. So we're looking at design modifications that are going to reduce the size capacity of the building, to bring us in line to maximize the state share of our school construction funding. We're doing, in the consent items which you mentioned, shifting some funds, $1 million from remaining funds from completed projects to this one. So overall, with those modifications, maximizing state share, and this $1 million addition, bottom line, how much money are we saving with this, a new approach to the Woodward site?
So the initial budgets and bid documents showed this project about, I think it was closer to $18 million over budget. So this is bringing it back within budget. The supplemental appropriation is strictly for contingency purposes, knowing that you need contingency. That is the reason for that, but we essentially reduced that cost by close to $18 million in order to continue forward.
Okay, thank you.
Okay, so as I understood it, Mr. Adams, you need a resolution. Can you frame that resolution for us that you want us to vote on?
So yes, the resolution is to approve the current plan as designed, and the reason for that is that the plan that we presented is what we are, the consent items represent. So the contract approval and consent represents the plan that we presented today. So ultimately, we would need that approval to approve that plan moving forward.
Move approval.
Second. Are there any questions? All in favor, raise your hand. That's unanimous of everybody here. All right, thank you. You're gonna, Dr. McKnight?
Yes. Mr. Adams, this is our last presentation. We can go ahead and continue, and the next discussion is on Clarksburg Cluster Elementary School Number 9 project.
Yeah, so thank you again. This is the presentation for Clarksburg number 9, and this is a follow-up to our planning board hearing in which we received what I would say is an unprecedented denial for the project. With me today is Gary Mosesman. He's the Director for Design and Construction for MCPS, who can walk us through the specifics of our plan as well as what has been requested by Park and Planning. But I would start out and just frame this for you all. This is a tough conversation. This is a tough decision, and I say so because there's a law, a policy in place that requires the planning board to review all public agency projects under their mandatory referral process. I don't think that law was ever written with the intent of a denial. I think the law was written around this notion that you provide comments, and they provide comments in the context of master plans. They provide comments in the context of the community zoning aspect. Obviously, there's safety and pedestrian and bicycles and everything else that comes with that. But I do think this is a challenging conversation because I don't think anyone ever envisioned asking the Board of Education to overturn a denial from the Planning Board. That is not something that anyone on our side was ever thinking we would get to that point, but unfortunately we are here. And for me, it's very important for us to outline why we feel very confident in bringing to you a recommendation to continue with this plan. And to me, that is important, but it's also important to acknowledge that there is conflict, there is challenges in what I would call opinion of how we build schools, and it's something that we're going to have to obviously continue to talk about. As you've seen in some news articles, that they are also recommending denial of our Stonegate project, and we hear that we understand that Southlake will be following close by with the denial. And I think the context of those denials is important. The context of the denial for Clarksburg was under the Clarksburg Cabin Branch Master Plan, as well as bicycle master plan and pedestrian. To receive denial under that same context in different communities, in different master planning areas that are very different, does start to feel like this is more of an opinion of how we should build our schools versus one that fits within the context of zoning review and master plan review. Not to say right or wrong, I think it's just facts, and one that we're going to have to contend with as a school district and you as a school board. One thing that I do want to really highlight and stress is that we build for students. And I'm going to say it again, we build for students. When we think about elementary schools, we build thinking about that 4 or 5-year-old being dropped off from a bus, from a car. We think about that 4 or 5-year-old navigating a building. We think about, the staff that we have and how they supervise those students. We think about, unfortunately, events like Sandy Hook and how we think about our school design and how we lay out our school buildings so that never happens again. So I would say that's how we approach this. We do not approach that lightly. We lose lots of sleep thinking about these designs. We think about every nuance of how we design a building and how a student, age appropriate, sort of scale appropriate, will view those buildings. So everything from parking lots to where the administration is located, how a family enters a building if they're late for school one day, how a family enters a building and navigates a building for, let's say, an IEP conversation or meeting. All of that is important. And I think the other part that's very important is the context of our union associations. There's a lot of elements within our designs that are very much tied to some of the desires that allow teachers and administrators to effectively function in our buildings. So we don't take this lightly. This is significant for us, and yes, everyone would love to just to do things different, to hide parking, so that all you see is a building that stands out as a civic presence building. But the fact remains, we are building and we are designing for our students, and it has to be age and scale appropriate, and it has to fit within all of the criteria that we need to think through from a safety, security, and operational standpoint. So I talked a lot about just framing this up, and I think we can skip through a couple slides and dive right in and have Mr. Mosesman start talking through where we are, what we're recommending, and what the planning board would recommend. I would also say just the final thing here, and this is important for a lot of reasons. This project is built within the overall Clarksburg master plan. The master plan called for multiple elementary schools to be built as part of this development. We are working through that, and I think it should be acknowledged that the Board of Education and the school district have really moved mountains in order to stay up and keep up with the pace of development up there. And I say that because this is, again, a project that's a repeat design. It's done for a variety of reasons, cost, you name it. But primarily one of the reasons it's done is the coordination with the developer, which started back in 2006. So this is not a new project. This is not a new 2023 project. This is a project that has been on the books, per se, from a county planning perspective for close to 10 plus years, 15 years. The other aspect to it, and I know you've heard a lot about the challenges at Clarksburg Elementary at the moment. This school would be open today if we were funded per the Board of Education, per your recommendations to build this building. So I think that's also powerful in understanding where we are in the context of this community and this school. This school would be open if we were able to get the funding that we've asked for from a Board of Education standpoint. So I think that's powerful because this isn't a 2023 issue. Right? This school would be open today if we received our funding. And I think that's important when we think about it in the context of an opinion around a school design. And should we stop? Should we pause and make modifications to this design? We will not open this school on the current schedule. And I think that's unfortunately a stark reality of the situation, one that none of us really want to necessarily have to make that decision, but it is the reality of the project. So again, with that framing, with that background, I'm going to turn it over to Mr. Mosesman to walk us through. We can jump 2 slides, please. One more.
Great, thank you. Yeah, that framed it very well, I think, and I just want to start with, I am an architect by trade of over 28 years, and over 20 of it in school design, and definitely the designs, I've worked all over the county, all over in many jurisdictions within the state of Maryland, and the plan that we've developed here is consistent with good construction, good school design from safety aspects as well as security aspects, as well as the experience of a student at a school. And I think that's what's important also is, like, as Seth had mentioned, is to keep in mind that these schools are built for our students. They're also community buildings, but mainly the importance of an elementary school is what is our students' experience of coming to a school site and experiencing a school site? What's that scale? What's the importance of a civic presence versus what's the experience of a student, a psychological experience of a student entering a school for the first time, multiple times? And what's the scale of that school like entering the school and as you experience the school throughout? So a lot of thought goes into that, as well as the security and safety of students, like Seth had mentioned about the administration locations, et cetera. So onto the preliminary plan approach. This was the plan that we originally presented, the plan that has been developed all along. We have definitely worked with planning board and some of the comments that we were able to address. So we do have the school cited the way it has always been shown in the plans to be cited, with a separation of bus and car loop and the administration at the front of the building. Adjacent to the building, to what I believe is the south side of the site, yes, is the adjacent park, the community park. Next slide. So, is that the next slide?
Next slide, please.
Thank you. Once again, some elevation looks of the elevation of the building, of the entrance sequence of the building, and kind of imagining being a student entering a school of this scale and this size, and what that experience is like. But we've definitely addressed the materials and elements of the local community so that this facility would tie into with the local adjoining properties. Next slide. Another view of the building from another vantage point. Once again, just seeing what the school looks like, the scale and context, and the relationship of the fields and the school. Next slide, please. So this is a slide looking from Bryant Park side of the building. You can see the relationship of what our current design is. That's the side of the school where the kindergarten and lower grades are located at, and so the relationship to the parks and the ease of access to the parks with no real interruptions of parking or any other type of circulation. And that will come into play later on as we look at some of the recommendations of the planning department. Next slide. And some of the comments that we had about the civic presence, we elevated the elevation or the look of the gymnasium. That's what you're seeing here in the elevation is the gymnasium. That's what you're going to see as you experience coming down 121 Clarksburg Road. So you're going to see a little bit something different than what we've done in the past. We acknowledge the need to show a little bit more civic presence to the building, and being respectful to that comment, we've upscaled or improved the elevations of that side of the building to address that comment. Next slide, please. Another view of the experience. This is coming along Clarksburg Road, and along Clarksburg Road, if you've been out there, it is an elevated height. It's not flat, and it's not on this utopian belief that everything is a flat surface. There is grades that we're dealing with out here, and it's something that we had worked with the developer on the grading of the site and recognition of that of the site planning. Next slide, please. Once again, another look, elevation from the new entrance side, coming from Clarksburg Road, looking back at the facility and the entrancing sequence and the parking. Next slide, please. So some of the comments, by the planning board was that the building should be iconic and orientate towards Clarksburg Road and should be fronted by a very open and civic plaza facing onto a street. Another comment was parking should be out of the way and to the side or rear of a building. Additional comments were, next slide, please. The school should be sited near the intersection of Clarksburg Road and Bryant Park Drive to engage the public realm and create a civic presence and gateway into the community. The main entrance to the school should be on Bryant Park Drive. So just in context, next slide, please. Looking at the planning board sketch, you can see they've in essence flipped our site and placed the building facing Bryant Park Road Drive, which is the other drive on the backside of the planned preliminary plan. And you can see that there's very little room for an entrance sequence for cars or bus to drop off students and parents to drop off their students, and have really moved everything to the side of the building, which is not really consistent with the experience that we want our students to have entering in a facility. Separates it from the administration sequence with parents dropping off, separates it from the students entering into a building and experiencing what it's like to come into a front of a school, especially we're talking about the first-timer kids, our most youngest group of students coming to a building, and what should that experience be like of them entering that building. And I really keep driving that home because I think it's very easy to say civic presence is important when you really don't think about who are our real end users of this building, and it's our students. Next slide, please. Another concept plan, same thing, shifting the plan down the site along Bryant Park. But I think what's important to mention also is we don't own that property that's along Bryant Park. That's actually owned by the Home Association. About a 15-foot wide length, almost along the whole length of Bryant Park, is not MCPS's property. So we don't have the luxury of just going ahead and moving our building onto the neighbor's property. Next slide, please. So just like I had mentioned earlier, the elevation change, the plan has been designed with that in mind, and the idea of moving the building to Clarksburg Road would literally elevate our building approximately 15 feet, which would then require a lot more grading, a lot more earthwork, and a lot more cost. Property adjacent to Bryant Park Drive is owned by the Home Association, like I had mentioned. And then developer grading aligns with the MCPS preliminary plans, like we had mentioned previously. That's what we have worked with the developer on the mass grading and preparing the site for this footprint. And we can go back and look 2008, I believe, and see that this building has always been sited in this location. So this is consistent with the vision of that community.
So with that, that's our presentation. So we open it up, Ms. Wolf, to discussion. But ultimately, the request of this presentation is a resolution to again allow us to continue with the design as we have provided to you and as you have approved during the preliminary plans presentation.
Dr. McKnight.
Yes, thank you so much, Mr. Adams and Mr. Mosman, for this presentation today. One other thing I'd like to mention about this project is the community has been very involved, and I know the team has been out, gotten feedback from the community about these plans, and we also want to be able to honor their voices in this process. Take into the consideration, yes, some of the feedback that's been given, but we also want to honor that that's been a big part of how we build our projects, having that community input and involvement, and so that is very much represented in the plan that has been presented to the board. So with that, we would like to bring forward a resolution to you recommending that the board continue the Clarks Bay Cluster Elementary School Number 9 project as designed and approved by the board at this time. Therefore, be it resolved that the Board of Education approve the continuance of the plan as designed to assure the Clarksburg Cluster Elementary School Number 9 project maintains all safety, operational, and programmatic goals, standards, and requirements. And be it further resolved that the Board of Education approve the continuance of plans as designed to ensure the critical completion date of August 2023 be maintained. And it be further resolved that as a copy of this resolution, it is to be forwarded to the Montgomery County Planning Board.
Move approval.
Second.
Is there any discussion?
I wanted to make a comment. I just want to say thank you so much, Mr. Adams. I want to call you Seth because you're I just like you, Seth. You listen to us, and although sometimes some of the things that we may want you to do might be a bit challenging, in various projects, you try to go back and make adjustments and make us happy. My colleagues and I, we took a bus trip up this way to look at this. You know, you look at these plans and what you see here versus what you see in person is something totally different. So what I didn't know is that that property, that 15 feet or however much, was not ours, but that is like right up against the house. I mean, literally, you walk a couple steps and you're right in somebody's front yard. And so I'll just say this, my colleagues and I, we are all about building relationships and collaborating. I would love for us to take our meeting on the road with the planning board and take them on a trip to see these sites, because we went around to all the schools in the area to see how we try to keep it unified. But the way that the current plan is, our preliminary plan is, it just works so well for our students, as you said. We're building these buildings for our students. I just want people to understand that, right? So I appreciate some of what they said, and I felt like you made some adjustments, right? But if we could somehow, because I'm disturbed that Southlake could possibly be denied, Stonegate, our schools need their buildings, right? And so the best way, I think, going forward, is we talked about this on our bus trip, is to have a discussion, have a bus ride, and kind of talk it through and kind of show them, because it helped for us to be able to visually see what it looked like and where, you know, everything would be set up. And so that's what I just say, that if we could figure out some way to take our partners on a trip, on a bus ride, it would be helpful. Because what we do want to do, I don't want to look as though we're going against the planning board, right? But it's in our purview that if we think this is what our system needs, that we go forward. But to prevent that in the future, I would like for us to get together, have talks, and see this, right? So just thank you to you both, right? But it was hard to call you Mr. Adams today. I know we're in a professional setting, but I just feel like you get it, you know, and that's what we need. We need somebody to go to sleep at night, thinking about what we're doing to make sure that we don't have unintended consequences for our students. So that's all I wanted to say. So thank you.
And I just want to say ditto, because we took that bus trip, and I do think it would be very important, not only for the planning board to see that road, especially during a drop-off time, but for the county council to also have a bus trip up there. I saw Ms. Harris, and then I saw Ms. O'Neill, and then Ms. Mandrowski.
Thank you. And I do.
Turn your light on.
I do take seriously that we're being asked to overturn a planning department decision here. So the first question I have goes to what was contained in your memo. There's a community meeting coming up on the 15th. What is the purpose of that in light of what the resolution is calling for today?
So the purpose of that meeting is again to reiterate and show with that community where we currently are. We, as Dr. McKnight said, we've spent quite a bit of time working in that area of the county. I would say, though, however, there has been a lot of new residents moving in. So for us, it's really important to, again, revisit and show what we're constructing. Also, and be able to describe that, again, this is a plan that exists at Little Bennett, at Wilson Wims, at Snowden Farm, at Gibbs Elementary, and to talk through why it works, how it works, and if there's any questions, make sure they are fully understanding. So that's the intent. Obviously, we would have loved to have the meeting a bit earlier, but the 15th is the date that sort of fit within the current calendar, and that's our intent, is to present the planning, the preliminary plans presentation, and obviously take back whatever decision the board makes today.
So it sounds like it's mostly informational, but there's also an opportunity for community input.
Correct, absolutely.
Okay. And could we pull up a slide 4 and then slide 14? I have a couple questions. So when I look at this, and Mr. Moses, and then you were talking a bit about how maintaining this design and this site organization is important for the experience of the learners. when I look at this, though, this is my concern as a, thinking this is an elementary school and as a disease and injury prevention person. There's a lot of vehicular traffic, which in the primary way that kids in elementary school, so small kids are approaching the building. And I'm looking from one of the comments from the planning board was to shift that vehicular traffic so it is not in the primary egress entryway that students would be moving into the building. And it does look like from the visual you showed of the neighborhood, we should anticipate a fair number of walkers because there's so much residential right across the street. So why is having all of that vehicular right in front in the main entranceway instead of oriented in a way that those little kids aren't having to traverse the way that we're going here?
So there's a couple reasons why this makes sense. As you can see where that big red arrow is, there's a large area which essentially the schools use as a staging area for arrival dismissal. But when you think about walkers, that's a corridor, to that school. Essentially looking at that cross street into the mouth of the school as you would possibly look at it. The other important aspect, and it's kind of hard to see from this, but if you zoom out, the residents are you have that large park right behind the site. So everything north that's walking, we have walk paths to the building from the other side of the community. And on the south side where you see the PM and noon side, we have the ability to have crosswalks and have students, as they cross the street, have a direct line to the front of the building. The other part is being really strategic about where our buses are and where our parent drop-off is. Buses and the bus lane is very controllable and safe. Where we worry is with the parents. The parents are the wild card when they're talking about drop-off. So understanding where that fits in and seeing how that sort of nestling that down towards the park and working with ultimately the school administration once they're appointed to work through that flow is going to be really important. The other aspect, and again, this is from a safety perspective, having where the visitor parking, having where that entry is, and aligning that with the administration office is absolutely critical. We do not want to have vehicles be able to enter our site. We've had that, and it's one that we want to move away from. But enter our site and have zero eyes on a visitor as they come to a building. So making sure that visitor parking is at the front of the building, making sure ADA parking is at the front of the building makes a whole lot of sense. Here on this site, there are some constraints, as Mr. Moseman talked about. As you go towards Clarksburg Road, you can see those little lines. That represents a big slope. So the further you go, the bigger the retaining wall, the more earth movement you have, and obviously, added cost and expense. So for us, this was the ideal scenario and configuration to keep kids safe that walk, to keep kids safe that come by car, and keep kids safe that come by bus.
Okay, and as I look at that, those red dotted lines, is that the easement or whatever of the homeowners association?
That's the limits of our property, so
okay.
Yes.
Okay, and I'm just going to ask it because I want to know. So, again, there's no, for safety of these little kids with all these cars, no way that any of this vehicular traffic could be somewhat shifted so that the main entrance is not the place where all the coming and going of vehicles is.
Well, I think with all due respect, you kind of do want your vehicular traffic to be at the front of the building. I think as you start to branch out and move parking on the side and rear of the building, you create scenarios where people come during the day, they have no idea where the entrance is. Again, they're wrapped around the building. I think for us too, the scenario of extending parking and wrapping further around the building gets parking and cars closer to recess. We want to keep the recess and any vehicular traffic far away from one another. So again, I think when you Are there ways to always improve a design? Absolutely, 100%. You can always tweak and modify. But for me, this is a time-tested, safe design. And the further we deviate from this, we start to create additional challenges at a school that I fear that once it's in operation, will be very difficult to manage by the school administration. And that's the last thing we want to do, is create a site and a operational condition that's going to be a challenge to a school principal and a school administration in the future.
Yeah, okay, thank you. And I do agree, from what you've said, we're in a tough point, and we really do need to find a way to come to some consensus with planning instead of getting all of our projects denied. And so we're talking about the new vision and welcoming that. It'll be interesting to see how we can maybe hit the reset button around some of these conversations.
And the last thing I would just add on this, I think the vision of this being 100% walking is, we have to obviously understand that that's not the case. This school, while we have not done a boundary, does serve Clarksburg Elementary. That this is within that Clarksburg Elementary zone is one of the largest school boundaries that we have. So acknowledging the fact that kids will be on buses, that they will be dropped off by cars, and making sure we accommodate for that is still very important for us. Even though we would love to have as many walkers as possible, we have to obviously plan and acknowledge that.
Yeah. Thank you very much.
Ms. O'Neill.
I appreciate the efforts of the planning board and their role and their ideals, but I also believe that there's a reality of what it takes to have an appropriate school, safe operation. Lynn, I'm not sure that you were I guess you were away when we took the bus trip, and did you go with it? No, okay. If you see the site, and you go and you see, we saw Wims and Snowden Farm maybe that day. It's the repeat. You know that this is the way this school should be built, how it should be sited. Where Clarksburg Road is, like, oh my God, the grade, and this is the appropriate plan. And I appreciate the efforts to make a more civic-oriented building with the design on the gym, but seeing it is believing, and I am 100% in support of the changes that you've made, and that this is the appropriate placement for the school for safety reasons. And while there will be walkers, the experience of the traffic jams at our schools last week with parent drivers, it is a reality that bad weather, pandemic, we're going to have parents driving kids to school, even in neighborhoods where there should be large numbers of walkers, and we've got to make the efforts. And this, to separate bus and car traffic, pedestrian safety, and I would encourage you to go visit Wilson Wims, Snowden Farm, Gibbs, where we have done this building before, and the safety enhancements. And, in the post-Newtown Sandy Hook era, we're living in our reality. And I totally agree with Ms. Wolf that perhaps our planning partners and council members need to take the same kinds of tours that we have and see the realities of what we need to do to protect our children, to build functioning schools. We know that we have schools in some neighborhoods, like Woodland, where, oh my goodness, how it was ever built is not appropriate. And this school should be built where we planned it.
Are there any other comments? Ms. Mandrowski.
I just want to say, kind of associate myself with some of this, but, we've had many conversations about the idea of us going out there. We talked about it even on the bus tour. I do think that that's something that we really should try and do. I also think that we need to continue working in the front end of when the planning board is making plans, developing master plans and stuff like that, so that they know that we need to have a say in some of that stuff. My main question was really about the meeting, the public meeting, and I was kind of disappointed when I read that it was going to be after we were doing this, because it kind of almost feels like, I mean, is this going to stir some sort of community concern as well? Because are they going to be able to understand that this is designed specifically with their feedback in mind, and that's why we're continuing to follow through? Okay.
And we certainly acknowledge that, but I think it's also an opportunity to also further enhance it. So I do acknowledge, I mean, we very much respect our planning colleagues.
Yes.
Chair Anderson is a brilliant mind, and one that, you know, we value his feedback. So I think too, meeting with the community, should we move forward with the plan as is, we can still talk about, you know, some of the ideas and concepts incorporate. So it's not a lost opportunity. I think it is still actually a great opportunity to start building some of those.
Okay, I really appreciate your openness to that too, and hearing, because I loved what you said about the fact that people are constantly moving in, and you know, people who participated before. So it's always good to continue to involve the community as much as possible. So thank you for your work on this.
Okay, we have, did you have? Oh, we have a motion and a second on the floor. All in favor, raise your hand. And that is unanimous. Thank you. Okay, we're up to item number 11. Does anybody wish to pull any items? Ms. Harris?
Item 11.3 and 11.6.
Are there any others? Okay, can I get a motion to move 11.1, 11.2, 4, 5, and then 7 through 19?
So moved.
Second.
All in favor, raise your hands. And that is unanimous. Okay, Ms. Harris, 11.3.
Yes, I think that was the one that was coming back to us
Yes.
from the last meeting. And yeah.
Hi, yes, we've come back, and I believe Scott Murphy is in our virtual audience so that he can speak to the apprentice program and provide some more information.
Yes, I'm here. Hi, everyone. This is Scott Murphy, Director of College and Can you hear me?
Yes.
Okay, this is Scott Murphy in the Office of Curriculum and Instructional Programs, joining you remotely. 11.3, the apprenticeship programs. Actually, the title is a bit misleading. This is the TAWS program that some of you may already be familiar with. This is the Transit Academy for Working Students. This serves 11th and 12th graders who have jobs, and provides an alternative junior and senior year to high school. So these students are working, and the TAWS program provides them with online coursework, case management, and then career readiness opportunities like apprenticeships and career preparation as they transition from high school graduation to post-secondary. This is, I think, the 4th year of this program. It is expanding this year simply to serve more students. This is part of our learning recovery plan, anticipating there will be more students that we could serve. And so this is an extension of previous work that we've done with this program.
And thank you, Mr. Murphy. So with the Transit Academy and the Children's Guild as the contractor, are they providing all instruction for the course content that the students are receiving, since they're often virtual, and to accommodate their work, or is it other services?
Yes, the students, when they're in the TAWS program, they no longer attend classes in their home high school. So they're typically within 2 or 3 credits of graduation, and they take their courses through TAWS. That is typically an online blended course that's offered through the TAWS program, not with MCPS employees.
Thank you. And you said expanded. I think I read last year's press release on the program, and I think there were about 30 students in the program last year. Do you have updated numbers for us for this year?
This expansion would serve at least 100 students.
Okay. Thank you very much.
Okay, and the next one is 11.6. Go ahead, Ms. Harris.
Yes, this is one that I wanted Mr. Adams to have the opportunity to share a bit more about, since it's a fairly significant transfer of funds and shifting of CIP priorities.
So yes, this is a significant consent item, and it really is a function of our current construction market and the fact that we are struggling to maintain our projects moving forward with the current budgets. One of the things, and we've briefly talked about it before, is the notion that we would continually revisit as we're moving forward to make sure we do everything possible to keep projects moving forward. One of the elements in our most recent review is that when we look at the 7 projects that are getting ready to start, there is not enough money in our current budgets to do all 7 as is. And sort of the miracle we were able to perform on Woodward does not exist when you think about elementary schools and the work at those schools. So as such, when we are looking at the DeFeef project, which was a dual purpose project, the project was obviously intended to focus on the aging infrastructure of DeFeef, but it was also building in significant capacity to manage growth at Rachel Carson Elementary School. One of the things that we have been monitoring and watching is the fact that Rachel Carson Elementary School growth is declining. They're still over capacity, but it is declining. And therefore, in this climate, we feel it very prudent to take a step back, revisit this project. We fully acknowledge there's aging infrastructure that we have to attend to at DeFeef, but when thinking about increasing the capacity significantly for a school that may not need it, and then when you look at the surrounding schools that also have available capacity, is this the right decision in this fiscal climate at the time? And therefore, we are recommending the board to consider a delay of this project, which would involve a transfer of funds, a supplemental appropriation into 6 other projects. That transfer would allow those 6 other projects to continue on the schedule, and it would allow us to take a step back and revisit the scope of the DeFeef Elementary School project.
You have any further questions, Ms. Harris?
No, I just wanted to, be very clear that postponing DeFeef allows us to keep the 6 projects that Mr. Adams mentioned, which are Burnt Mills Elementary, Clarksburg number 9, Southlake Elementary, Stonegate Elementary, Woodland Elementary, and Poolsville High School, moving forward on time, which is an important part of why we're doing what we're doing.
All right, can I get a motion to move 11.3 and 11.6?
So moved.
Second.
All in favor, raise your hand. That is unanimous. Thank you. We're up to item number 12, which is for information only. Can I get a motion to move items 13.1 and 13.2 in block?
So moved.
Second.
All in favor, raise your hand. That is unanimous. We have one new business item, which is a COVID-19 vaccination mandate for Montgomery County Public School employees. We're committed to protecting our students and doing everything in our power to create and maintain the conditions that support in-person instruction. The pandemic has recently grown worse with the spread of the Delta variant. We believe that vaccines provide not just protection for the individual, but are essential to community safety. To this end, we would like to introduce this resolution as an additional layer of protection for all students, and especially for our youngest and most vulnerable populations. So I'm just going to read the resolved paragraph. And that says, resolved that all staff employed by the Montgomery County Public Schools, MCPS, provide verification that they have received at least the first COVID-19 vaccination by September 30th, 2021, and verification of the second shot be submitted no later than October 29th, 2021, unless staff request an exemption based on a medical reason documented by a medical doctor. If a medical exemption is granted, the employee must submit to regular COVID-19 testing as required by MCPS. I'm also going to ask that our usual practice to have new business resolutions lie on the table until the next board meeting be waived. We can waive this provision with unanimous agreement of the board when all of us are present. Can I get a motion first to waive the provision so that we can move forward?
So moved.
Second.
All in favor, raise your hand. And that is unanimous. Thank you. Now can I get a motion to move the resolution forward?
So moved.
Second.
Is there any discussion? Ms. Mandrowski.
I just want to, I'm supportive of the resolution for the purposes discussed. I just want to, point out that it can be concerning about whether or not we'll end up losing staff. It's our, we're already stretched and shorthanded and struggling to find people. And if you could just speak a little bit to what we can do to ensure access and support for all of our employees in getting the vaccinations. I think we discussed, things like going to the bus depots and providing vaccinations stuff there, and support for the filling in the attestation forms as well.
Absolutely. I am happy to address your question, Ms. Mandrowski. So we've had a number of vaccination clinics set up over the last couple of weeks, focused specifically for our staff and students. We also have another one coming up here in just a few weeks. So we will continue to hold those vaccination clinics and work with DHHS and other partners who've been providing that to us to ensure that our staff members have every opportunity to receive the vaccine and that doesn't become a difficulty for them to have access to it. So we will continue to do that. Your point raised about taking into consideration staff, we will work with our association and others to determine exactly what it is that we will need to do to implement this resolution and have our staff vaccinated, and those who do have the exemptions, determining the best ways in which we work with them and keep them as a part of the workforce, but most importantly, highlight that we want to keep our schools and offices safe.
Great, thank you. I just want to clarify, because it sounded like you said our organization, but you mean all three of our organizations?
All three of our associations, correct.
Thank you. Okay, thank you.
Ms. O'Neill.
I think this is incredibly important. Dr. Nixon, where are we in the vaccination rate for MCPS employees?
So what I can share, and I can share these statistics by association. For our McCap-McBoa, our administrators, currently we have 750 vaccinated, 16 unvaccinated, 3 partially vaccinated. In our SEIU, we have 4,844 members vaccinated, 267 unvaccinated, and 35 partially vaccinated. In our MCEA, we have 12,815 vaccinated, 335 unvaccinated, and 69 partially vaccinated. We have still roughly around 6,000 staff members that we have not heard from yet. We continue to send out daily reminders for the attestation. We have our ERSKI help desk and our technical help desk on standby to assist any employees that need support with either uploading or support with finding out where they can go and receive the vaccination. We also recently had 4 vaccination clinics at our MCPS sites, and we will continue to partner with DHHS to make sure that we have vaccination clinics accessible to our staff members as well.
Thank you. I just want to say, we're in a business about children's education, and to that end, we have to do everything we can to make sure that we have a healthy and safe environment, and our children under 12 are not eligible for vaccines. And, you know, we need to do everything we can as a community to stop the spread of COVID and to protect our youngest learners. And so, you know, I believe that this is the appropriate method.
Thank you. We have a motion and a second on the floor. All in favor, raise your hands. That is unanimous. Thank you. Item 14 is for information only. And now we've come to the end of the meeting, but before we close, I want to close this meeting the same way that I opened it. As you remember, I started out by recognizing the lives that were lost in 9/11. In Montgomery County, we lost 11 people. So we'd like to have a moment of silence because this was probably the worst tragedy in our history. So if we could just have a moment of silence, I think it would be appreciated by all of our constituents, particularly those who lost lives, lost family members in this. Thank you for your cooperation. At this time, I'll entertain a motion to adjourn.
Move to adjourn.
Second.
All in favor, raise your hand. And we are adjourned. That is unanimous. Thank you.